Good morning, folks. I'm Brian Smyth, President of NIPSA, and you're all very welcome to our COVID-19 seminar. First of all, a quick apology. We're slightly behind time. It's a few logistical issues. We have we've over half or nearly 3/4 of our delegates in at the minute, and others are still joining, so we need to move on in terms of expediency. So good morning and welcome to our seminar on COVID-19. I know it affects everyone here, our wider membership, our families and the communities we live in. And before I get into the substantive issues, I would ask that we hold a minute's silence in recognition of our colleagues, the many others that have died as a result of COVID-19. Thank you. On the day that's in it, I want to send greetings of solidarity to our members and colleagues currently on strike action in the Newry and Mourne Council area. Because of continued intransigence by management, members of NIPSA, GMB, Unite and SIP2 have been forced to withdraw their labour in an attempt to win a just argument. Stay strong, folks, and if the energy in the picket lines is anything to go by this morning, we know that you have the stamina to keep the fight going till the end. On behalf of NIPSA's General Council, I pledge all the support you require to achieve your goal. I want to pay tribute to every single member who throughout this pandemic has served the public every single day. While others may attempt a hierarchy of frontline staff or suggest some are more worthy than others, we will not get into that. I would like to say thank you to each and every public servant for your efforts and bravery to date. We've yet to fully appreciate the mental strains this pandemic will have on individuals, though clear evidence is emerging. There's much talk of the vaccine, and I had to rewrite this bit because yesterday it caught me by surprise. I had a kind of different slant, but it's been approved for rollout, which will potentially bring some semblance of order, of normality to our society. There seems to be plenty to cheer about the vaccine, and we will wait and see whether an effective process for rolling it out can be achieved. While we welcome the news and we appreciate the significance it may bring, we must also consider the many challenges too. We're acutely aware that the health service is stretched to the limit currently, and to implement the logistics of the rollout will prove extremely challenging. Due to the specialist process required to handle a vaccine, there are significant restrictions. I'm not going to rehearse them, I'm not a medical person, but there are restrictions in terms of how it can be handled. This means there will be single locations where the virus will be administered, and you will require 2 doses. Juggling the current workloads of frontline staff and ensuring they get to a vaccine centre twice will be no mean feat. The process is currently being worked through, and NIPSA's Health Committee members will play their part in ensuring it's as smooth as possible. While not having a specific policy on COVID-19 vaccinations, NIPSA, like all other trade unions, will encourage members to make a personal choice on whether or not to take the vaccine. NIPSA have already made representations to management insisting that the uptake of the vaccine must be at the discretion of our members and the staff, and this has been acknowledged as a personal choice and will form part of the communications which are currently being prepared. We will continue to have a healthy level of scepticism, though, in terms of how this rollout will be managed. While promises of numbers of vaccines and protocols for dispensing have been muted, these are short in substance and clarity. We've seen failures in respect of some of the most vulnerable in our society who were placed in residential and or nursing homes to be cared for. We've seen disagreement among the political leaders, and we've been left bemused by the decisions and turnarounds over the last couple of months. We experienced a continued lack of leadership at departmental level while insisting on rushing things through with no equality impact assessments, no proper consultation, and all under the guise of a pandemic, which we would argue is an excuse for putting in place long-term proposals that trade unions and communities have stringently opposed. We have a number of battles ahead that I'm confident together we can win. This includes a pay claim that will aim to reduce the deficit of years of austerity and a campaign to ensure safe and adequate staffing across all public services. We've seen a mass cull in the number of civil servants through a voluntary exit scheme. It did not take long to recognise that in fact those posts were essential and the gaps that have largely been filled with the agency workers. We will continue to fight for the reintroduction of posts recruited to permanent contracts until staffing levels are restored. We've seen a decline in budgets for schools, and our members have been stretched to undertake more work with less resources. The battle will continue to properly fund our education system and provide adequate staffing and resources, thus ensuring our children get the best possible education. As alluded to earlier, the councils are in a struggle to achieve parity across council areas. Add to that the number of posts that posts reduced, members being furloughed, and contracts actually being terminated. There are a wealth of activists within councils who will rise to the challenge and fight on behalf of members. And NIPSA will use every means necessary to progress the arguments on behalf of all its members. In health, we have postponed industrial action in relation to safe staffing, postponed being the key word. Notice has been served that this battle is not over and will resume after our heroic members have quelled the pandemic. We have launched our pay claim for this year, are seeking solidarity from all unions and preparing for a spring of discontent. And that, I believe, is very likely. I would encourage all members to make a conscious effort to join a library or dust down your library card and make use of it. These very important facilities face continued threat of closure, and we need to make sure that there's no opportunity for false claims to be made that further cuts or closures are necessary. Despite an impeccable track record over the years, our housing executive colleagues face a massive challenge going forward. And I've no doubt the resilience and the experience of the representatives, officials and members will rise to any challenge that comes their way. We have a collection of members strewn across the voluntary sector, facing impossible challenges every day. Continued reductions in funding, removal of grants, and ongoing redundancies are taking their toll. Together, this sector, with support from trade unions and communities, can meet the challenges head on. Together, we will fight this battle, bringing together all strands of society who benefit from the amazing work that our members in that sector undertake. It's likely we will be facing into the Covid-19 challenges for the foreseeable future, and I commend you all for the magnificent effort you have made to date and for what is yet to come. There's no doubt in my mind that NIPSA, the largest public service union, will be at the forefront of the battles on behalf of our members. I pledge the support of the General Council, the resources of headquarters and the superb officials, as well as the many hard-working support staff that keep this wonderful union as vibrant as it has been since its inception. I trust you will enjoy today, and together we will learn from our wonderful speakers. I look forward to the interactions, and I've no doubt there will be some thought-provoking questions too. Thank you. I'm now going to hand over to Alison after I wipe the podium. Give me 1 second. There you go, Alison.
Okay, thank you very much, President. And you're all very welcome, delegates, to this remote seminar. On behalf of NIPSA's General Council, I wish to welcome you all here to this remote seminar. The last year has been a very difficult year for workers, families and society at large. NIPSA, as the largest trade union in Northern Ireland, has played its part in seeking to protect workers in these very difficult times, whether that be through the Irish Congress of Trade Unions and the wider trade union movement, or at union level and in each of the collective bargaining units across the union, whether that be in the health service, local government, civil service, housing executive, education, libraries and the voluntary and community sector. Little did any one of us know that this time last year, while we heard of issues in a city in China called Wuhan, we could never have imagined how this could have affected millions of workers and citizens across the world. We are now living through unprecedented times and through a pandemic that none of us could ever have imagined this time last year. When the nationwide lockdown was announced on the 23rd of March this year, again, I don't believe any of us fully understood the magnitude of this. Whether that would be the impact on our families, on the economy, or any of us as workers. I know only too well the impact that Covid-19 has had on families, as I lost my dear mother in April to Covid. I want to thank you for the many letters, emails and phone calls of support that I got at that time. It was very difficult for me and my family. However, I am not alone. There are over, unfortunately, 1,000 families this year who have lost a loved one in Northern Ireland to Covid, and unfortunately, there will be many more. At least I was able to spend my mother's last 24 hours sitting by her bedside. This was something that I will cherish forever. And I know I was fortunate, as many families just got a phone call to say their loved one had passed away. If I could now turn to the issues in the workplace which our members are facing. Our members in local government have faced the brunt of the pandemic, as this is the only sector who have had members furloughed. While most councils agreed that they would make the furlough payments up to 100% of salary, and therefore pension contributions were made and members saw no loss, unfortunately, one council, Antrim and Newton Abbey, took the draconian step to not make up the furlough payment to 100%, thereby also impacting on pension contributions, which will have long-term implications for our members. And to add insult to injury, when it came to pay the increase of 2.75% effective from April of this year, Antrim and Newton Abbey Council again refused to pay the increase on the actual pay and only the furlough pay. Unfortunately, colleagues, while this is morally wrong, there is no legal action which NIPSA can take in that current situation. We do, however, continue to make the moral arguments within that council, and we will continue to do so. In addition, because of a funding situation, a number of councils are seeking to make staff redundant, even colleagues where any funding issues would not impact on those councils until well into next year. As the President has indicated in his opening remarks, the councils are also refusing to pay some cheaply protected redundancy payments, and this, colleagues, is a race to the bottom. As a union, we are considering all potential options, including any legal redress if possible. I would also wish to our members well in Newry, Mourne and Down Council, who are today taking the very brave step to take strike action to defend their terms and conditions and their rights in these difficult times. Having visited picket lines this morning, I can assure you that the members of NIPSA, Unite, GMB and SIPTU are resolved to get justice. I am sure you will wish them well in their endeavours and campaign for justice, and NIPSA will not be found wanting in ensuring they have whatever resources are needed to win for the members, and they will get it. Our members in the health sector have also been at the forefront of this health pandemic, with some members being at the coalface. In addition, we have social work members who are facing significant challenges because of social distancing to ensure vulnerable people whether they be young or old, are properly protected. There are very significant challenges of mental health of clients which are not being properly addressed and will be difficult to address in the years to come. There is an established negotiating forum to allow for significant issues in relation to COVID to be discussed at both trust and regional level. Some of the issues under discussion and negotiation are surge planning and strategic workforce issues, such as the result of the pandemic, including those self-isolating and the impact that this has on other staff. Across many areas in which NIPSA operate, we have members who are working from home. While there can be some advantages, no doubt, in working from home, there are also many challenges. With inadequate workspace, sharing spaces with other family members who are also working from home, broadband issues, and challenges in being able to switch off from work with laptops and computers sitting on the kitchen table or in another place within the home as a constant reminder of work. While employers are seeking to do something to assist members in these circumstances, the circumstances many members found themselves in March to September, with also having to juggle homeschooling together with doing a day's work, was very difficult. In our experience, some managers were very supportive of their staff, but others not so, and there was not always the recognition of the challenges of trying to balance working, childcare and homeschooling at the same time. Thank goodness I didn't have to do the homeschooling bit. One issue which NIPSA has sought to negotiate without much success, unfortunately, is a working from home allowance, which is allowable under HMRC rules. The arguments put forward by employers is that staff, you, are saving money through less or no travel costs, and they raise many other barriers. While NIPSA accept that not all members are working from home, there are ways to address an allowance for both those in work and those working from home. The facts really of the matter are that employers do not want to find a resolution, and it's so much easier for them just to say no. It is unfortunate that management across most of the public sector have adopted this stance, given that the allowance is to compensate for additional heating and lighting costs, which members are undoubtedly facing during the winter months. And it will be, and we have made this argument, that will be extremely difficult, particularly for our lower paid members, to put the heating on in their home while they're working on behalf of their employer, and I think it's a disgrace. Our members in the education sector have faced a multitude of issues, particularly those in the school sector. While initially sent home, when the school year restarted, it was, quite frankly, the only word I could think of was a shambles, and it remains so. Some issues faced by our school-based staff were the lack of appropriate PPE, bus drivers and bus escorts who did not have the proper protection arrangements in place or the appropriate cleaning regime when transporting children who may be carriers of the virus were amongst some of the challenges faced on a day-to-day basis. In the classroom, against the Department of Education guidance has been haphazard and confusing. There appears to be a reluctance for the DE Minister to recognise the impact of the guidance is having on workers and our children in what is a very stressful working environment. The key message at the moment from government appears to be keep our schools open at any cost, irrespective of the hour number, and keep hospitality closed. While I appreciate and recognise the education of our children is a high priority, colleagues, the health, safety and welfare of our children and their families should be the most pressing issue. Ensuring they are kept safe and well must be the priority for this Assembly, and I would call for that from this rostrum. The issue of track, trace and isolate has been a significant issue for the last number of months. While testing has certainly improved from the early days, the tracking and tracing, and most importantly, the isolating of those testing positive, remains a significant issue. We continue to argue that if workers do not receive full pay during any period of isolation, then we are less likely to isolate, as it's simple. Can someone afford to isolate if they only receive statutory sick pay? And while permanent members of staff across the public sector are in receipt of full pay in these circumstances. Unfortunately, that is not the case across all of the public sector for agency workers. NIPSA has managed to secure full pay for agency workers in the civil service where they have to isolate. This is clearly a health and safety issue. However, as a union, we must continue to make these arguments to call all other parts of the public sector to ensure that those agency workers who work in our public sector are able to self-isolate and not worry about whether they can afford to do so. I would like to wish to highlight the excellent work on Covid-19 that the NIPSA Health and Safety Committee have undertaken over the last 9 months. You will have received in your pack for this conference for the seminar copies of 1 e-zine and 2 Spotlight magazines, which have been produced by the committee in the last 9 months. These are excellent publications and give general advice on a range of issues. Some of the issues that have been addressed are: in March, the Health and Safety Committee published an e-zine giving broad advice and guidance to members on the emerging issues on Covid-19. In April, as part of the normal publication, the lead story was an article on what the virus was, how to prevent and help everyone from catching and spreading the virus, and what employers could do to protect staff. Then in September, a further Covid edition of Spotlight was published, and that edition covered a frontline worker's view on working from the homeless. This was a member of our Health and Safety Committee. It was a stark reality of what is meant for our members working in this area and the impacts the virus had on homeless people and our members who work with the homeless. There was also an article on health and safety and the duty of care placed on employers. There was an article on working from home and some very general guidance on how to set up a workstation and other very practical guidance and support for members, including mental health signposting. There was guidance on socially distancing, particularly for blind and partially sighted members and the wider public, risk assessments and how to conduct them in the workplace, the issues around heating and cooling systems and the impacts of that in the workplace on Covid-19, and the vulnerable workers checklist. These are just some of the issues that the Health and Safety Committee have dealt with over the last number of months, and I am sure you, colleagues, will join me in thanking and commending the work of the NIPSA Health and Safety Committee in highlighting a vast range of issues of relevance to members and their families. Conference, in closing, I hope that the programme put together here today is informative, but more importantly, an opportunity for you to engage directly with the range of speakers we have lined up for you here today. We will hear from speakers on the economy, including an alternative model. We just simply, colleagues, can't go back to what was there before, the implications on workers and issues regarding mental health and what our legal rights, whether that be from an employment perspective or from a personal injury perspective. In closing, I want to thank all NIPSA representatives who have been dealing with Covid-19 at the coalface. You have gone that extra mile, as you always do. You have not been found wanting. You have ensured that the issues of concern to members are brought to the collective bargaining table. Have we always got it right? Probably not, but I can assure you that the fight is not over. As a union, we will continue to represent the interests of our members throughout this pandemic in the most challenging of times. We can achieve much, colleagues, if we stick together. We can make the future better and brighter for all members and for the society in which we live. Colleagues, enjoy today, engage with the speakers, engage with each other. This is your event. Ensure you maximise your input, and together we can take the issues forward to ensure that we have a better outcome for workers and their families. Colleagues, thank you very much.
Over to me here, Conor. Thanks very much, Alison, for that. Appreciate that. I'm now going to move straight on and welcome our first speaker, and that is Owen Reidy, Assistant General Secretary of ICTU, which post he has held for the last 4 years. Owen will be known to many of you. He's a stalwart and very respected throughout the trade union movement. He has led campaigns. One of note would be the Lewis campaign in his days as an official with SIPTU. Well, you're very welcome. I look forward to hearing from you, and of course to the questions that may be put to you after that. So you work away.
Thank you very much, Brian, and President and General Secretary. I'm very grateful for the invite to be with you here today. I only wish it was in person because I really enjoy engaging with NIPSA delegates at conferences. It's one of the most participative conferences of all our unions, and they're always guaranteed good, vibrant debate, and I think that's the healthy nature of any trade union. Like Brian and Alison, I want to pay tribute to NIPSA, Unite, GMB and SIPTU members who are, as we speak, picketing in Newry Morn and District Council over a very important equality challenge. And, you know, COVID-19 disputes don't stop. People must reassert their rights and fight for their rights. And I think the entire trade union movement across the island is very supportive of our 4 affiliates in that battle. And like Brian and Alison too, I do want to pay tribute to all the NIPSA members who have been working tirelessly over the last 6 months in particular. You know, when people talk about the essential workers, it's very clear, you know, people talk about people in the health service, of which NIPSA is a union there too, but there are lots of other areas in both the public and private sector where people have gone beyond the call of duty in the interest of supporting their fellow citizen across society, and I think NIPSA members have played a very important role in that too, and I think that's important that it's acknowledged. I've been asked to say a few words about the economics of the pandemic, and to maybe perhaps offer and suggest a way forward. And we've put some work into this over the last 6 months as a Congress with all our affiliates, and NIPSA, as Alison as Vice President has played an important role in this too. And it's very clear that the pandemic has damaged many lives and livelihoods. We heard a personal story from Alison about her mum, and there are many people in that situation. We have seen nearly 250,000 workers across Northern Ireland being furloughed at some stage during the course of the last number of months. And we are going to see an increase in redundancies, there's no doubt about that. And it's said that there is an inevitable recession. Now, whether a recession is inevitable or not, what is not inevitable is austerity. But it's something, no doubt, that the Tories will promise us. And it's something that we collectively have to resist, because there is no need whatsoever for austerity post the COVID-19 pandemic. It is not inevitable. If it happens by policy choice, not by chance. And I think we need to remind ourselves of that. We need to inform ourselves of that, and crucially, we need to inform the public of that as we go forward over the next number of months. I think also, as well as COVID-19 being a crisis of pandemic proportions, it's also been an opportunity and it's an inflection point for those of us in the trade union movement and on the progressive left to, I suppose, recalibrate and to seek to reset the dial. And I think there are some lessons that we all have learned and need to learn. And they are, what role does the state play in our economy and society? For many people, the state was something that was criticized and seen as too big. And I think we've seen quite clearly, if the state does not step in, society suffers much more. So the role of the state is crucial. And for those of us who want to see an interventionist state, I think there's a real opportunity for us to argue for that. The role of work, the crucial value and importance of the role of work and the workers who carry that work out. And, you know, I think we know definitively now just who the essential workers are in our economy and our society. And they are not necessarily those workers who are awarded best financially through decent terms and conditions of employment. And that is something all of us are obliged to do something about. And we must be relentless in our pursuit of equity for those workers as we go forward. I think also we need to look at serious structural reform of our tax base, and I'll come back to that in a moment. But this whole issue of the role of work and work paying, it's very clear that work does not pay for many people. The Nevin Institute published some really startling statistics recently. 1 in 4 workers in Northern Ireland, that's nearly 250,000 workers, 1 in 4 workers, public and private sector, are paid below the real living wage of £9.50 an hour, poverty pay. With our young people, 1 in 3 of 22 to 29-year-olds are afflicted by that statistic. When you drill down, the largest single employment sector, retail, which has played a very important role in the pandemic and is being battered at the moment with the loss of jobs and the collapse of the high street, 45% of those workers, nearly 1 out of every 2, earn below the real living wage. And we know women and young people are disproportionately affected. Hospitality, a sector that is ripe for unionisation, but has very low union density, 8 out of every 10 of those workers is paid below the real living wage. Food processing, another important part of the economy, where we have a lot of migrant workers as well. It's 1 in 4 of those workers below the real living wage. And it's not just a private sector issue. We know in our human health and social work activities, 15% of those workers are paid below the real living wage. So work clearly does not pay for those people, and we need to do something about that. But in many ways, it's no surprise that that's the case, because when we look at our state and we look at our public spend, and when we look at the revenues that the state take in, the UK is lowest, along with the Republic of Ireland, ironically, or not so ironically, is the lowest when it comes to peer countries in Europe. The countries I'm comparing Ireland and the UK with, I'm not comparing Ireland and the UK with Romania and Hungary and Bulgaria. I'm comparing Ireland and the UK with other like wealthy countries, such as the Netherlands, Germany, the Nordics, Luxembourg, France, etc. And you'll see from our No Going Back paper, which I know Alison has distributed to you all, you'll see quite clearly that we have a low level of public spend. So we know our public services are challenged, and they have been for some time, north and south of the border. And in many cases, public servants have been asked to fight and contribute their part in the fight back against the pandemic with one hand tied behind their back, because public services are not properly resourced. We know that when you look at a number of other key headings in the UK and the Republic of Ireland, spending on education per pupil is lower than comparable countries. Research and development is lower. Continuous learning for adults is lower. And childcare, we know, in both Northern Ireland and in the Republic of Ireland, after mortgages, is the second most significant family bill. So there are major issues there. And here's the real travesty of this and the real inequity of this that we must expose at every opportunity when we talk about the economics of the pandemic. When you look at the tax that workers pay in the UK and the Republic of Ireland, essentially a worker in the Republic of Ireland pays 98% of the tax that those wealthy European countries, the workers that work in those countries pay. In the UK, it's 67%. Now, in the UK, it's 67% because workers who earn more than 6 figures don't pay as much tax as they do in the Republic of Ireland, but low and middle income workers do. So your average public servant is paying their fair share of tax, no doubt. But when you look at employers' national insurance in the Republic of Ireland, they pay as little as 48% of what EU peer countries pay. And when you look at the UK, it's as low as 41%. So you're seeing a dynamic there where workers, when it comes to tax on labour, VAT, are by and large paying what other wealthy European countries are paying, but the employers, when it comes to national insurance, are paying 48% and 41%. In Northern Ireland alone, per head of population, if employers paid their fair share over a period of time, that would be an extra 3.5 billion to the executive. That's an extra 18% in the spend that Northern Ireland would have. That would go a long way to paying a fair pay increase to hardworking public servants, and it would go a long way to resourcing our public services for all our citizens so that they get the just and real public services that they need. Now, business throughout this pandemic have been demanding and have been arguing for supports, and quite frankly, we have said any job that was viable before March should be protected and supported, and those businesses and those workers must be supported. It's interesting to see that right across the Western world, states that have a centre-right government or a centre-left government have all introduced, to varying degrees, furlough schemes, job-related income protection schemes. Why? Because they know that it is essential to keep as many people in work, and it's something that the trade union movement have been at the forefront in demanding and arguing. But we have seen the lowest of the low paid being abused in that situation. We've argued that hospitality and retail workers who earn below the real living wage should be getting 100% of their pay, because in many instances, the furlough of 80% has brought those workers below the national legal minimum wage, which is an outrage. The real living wage is seen as the minimum that one can live on to live in some form of dignity. So nobody should be below that threshold. But if business is to demand, and you hear it every day, business groups demanding support for this and support for that, and if they are to demand this, it is important that the state is adequately resourced. And you can't have a situation where you have a financial crisis every 10 or 20 years, a global pandemic every now and again, where there's an economic crash, and where the kitty of the state's finances are raided, but in good times they are not adequately replenished and resourced. And we know from the statistics I've outlined that workers are paying their fair share, but employers and business clearly are not. Now, we have argued that in both jurisdictions, north and south of the border, employers over the next 5 years must and need to pay their adequate fair share. And that taxing of employers' national insurance should be brought in with progressive budgets over the life term of a government. Let's see how we go with this. Obviously, it's something that the Tories and Fianna Fáil and Fine Gael will respectively seek to resist, but it's really crucial that we shout from the rooftops about this tax inequity, and that when we are met with calls for austerity, when there is no need, because if we resource the state appropriately, we don't have to do that. Interest rates are incredibly low at the moment, so it's really important that states borrow at low interest rates, and that we support business and support workers and support our public sector part of the economy as well, so that people can be protected as we come out of this pandemic. So that's a crucial issue, tax equity. And that's why we published earlier this year our paper, No Going Back, which is a policy paper that looks at a range of issues: health, education, the economy, and it's an all-island paper. It looks at both jurisdictions discreetly and makes suggestions, but I think crucially it has real serious policy proposals that are viable and realistic and aren't that radical, because all we're asking for is that employers pay what their European peers pay to make sure that our states are better resourced for everybody, not just for when there's a crisis. And we believe it's really important that we don't go back to the old failed ways of boom and bust, that we grow the economy and that we make it something that everyone can participate in, because we know clearly in Northern Ireland not everyone is participating in. So many people are excluded. And I will conclude with the following couple of remarks and observations. There's a couple of things that we can and we should do very, very quickly here in Northern Ireland, notwithstanding the limits of devolved government. The first thing we could do, Northern Ireland wants the whole issue of the national minimum wage to be a devolved matter. It's a double-edged sword in many ways, because this is a lower wage and a poorer part of the UK, and some forces in the Assembly may see it as an opportunity to drive down that national minimum wage. But if that does happen, we should be arguing that the legal rate of pay for any worker in Northern Ireland has to be at least at £9.50 an hour, which is the real living wage. And we shouldn't have this ridiculous situation where workers under 25 years of age get only a proportion of the national minimum wage. They are adults, they're paying taxes. Over the age of 18, you should get the full national minimum wage, and it should be pinned to the real living wage, which currently is £9.50 an hour. The next thing we need to do is to promote collective bargaining. The public service enjoys collective bargaining. That's why rates of pay in many instances are higher in the public service, and not one public servant should be apologetic about that. That is their right and their entitlement. But we've a job of work in the private sector where only 15% of workers are organised to make sure that workers in retail, hospitality and all the other areas have access to collective bargaining. And we have published a paper that we've sent to all MLAs where we've argued that sectoral bargaining and legislation should be enacted to promote collective bargaining in Northern Ireland, because employment rights is a devolved matter and it's within the gift of the executive. And crucially, the one definitive thing we must hold this executive to is the commitments that they signed up to in the New Decade New Approach Agreement. Our argument is that New Decade New Approach Agreement was signed off by the British government, the Irish government and the 5 political parties that form the executive. And there's a clause on page 44, and I would ask everybody to go and read it. It's 2 sentences. Clause X, page 44, under workers' rights. 2 sentences, and it says the following: there will be an enhanced focus within the programme for government on creating good jobs and protecting workers' rights. The parties agree that access to good jobs where workers have a voice that provides a level of autonomy in the workplace, a decent income, security of tenure, and satisfying work in the right quantities and decent working conditions should be integral to public policy, given how this contributes to better health and well-being, and by tackling inequalities, building self-efficacy, and combating poverty. I don't think we could have written those 2 sentences better ourselves. The 5 parties have signed up to this. The 2 governments have signed up to this. We have to hold them to account to make sure that they put that into the programme for government and that they enact a suite of workers' rights legislation and trade union-friendly legislation to make that a reality. It is within the gift of the executive to do that. It doesn't cost any money to do that. But what it does need, it requires political competency, and it requires the togetherness that we have yet to see. And I think there's an obligation on all of us in the trade union movement who have a leadership role, and every single one of the NIPSA activists on this seminar play a leadership role in the movement. There are about 8,000 leaders in this trade union movement in Northern Ireland, every shop steward in every union, and I include you all in that. It is critical that we force our government to enact the legislation to make Northern Ireland a fairer and more just place for all workers, whether they were born in Northern Ireland or whether they are international workers who now call Northern Ireland their home. So that's our motion, that's our mission, that's our ambition, and I hope you'll all join with us in making it a reality. Thank you very much, and I wish you all the very best for the rest of your seminar. And I'll hand you back to Brian, your president. Thank you.
Thanks very much, Owen. Really appreciate that input. Interesting discussion there on the role of the state, the role of the worker. Can I just say, folks, that the no going back document that Owen has referenced is in your pack, and I would strongly encourage you all to read it. And also the excerpt out of page 44, clause X, that document is also available. And I know from previous discussions many people would have read that, but I encourage others to do so. Can I just do a quick bit of housekeeping, because a number of people will be used to this process. Can I tell you it's a little bizarre because we're sitting here in an empty room and you've no interaction with ye, the participants. I can see Owen on the screen the same as you, but I can't see anybody else. Next door we have what's known as a control room, and there's a lad in there called Connor. Connor's now looking out for people. So essentially, if you would like to ask a question during this time, you stick your hand up. Connor sees your hand and he advises me. So, and we then invite people in to speak. And it says on my note, you can notify us by raising your hand. This is at the bottom of your screen. If people don't have the technology, just raise your hand and I've advised Connor to bring you in. So the first question we have is from Paul Dale, branch 15. Paul, you're very welcome. Have we to have a question for Owen? Work away, please. Did you hear me all right, Paul? I can't see. I can see. You've heard me, Owen, yeah? So I can see your face on the screen.
I hear you, President, yeah. I hear you, Brian.
I can't. Connor, can Paul hear me? Is there... Here he comes now. Paul, you're coming now, apparently. Thank you.
Thanks, Brian. There was just a bit of a delay getting me in there. I'd like to say hello to everyone and echo the best wishes and solidarity to the workers in Newry and Mourne who are on strike today. Solidarity, brothers and sisters. I also have to welcome this seminar. I think obviously there was a few gremlins at the start. I know there was some colleagues who have struggled to get in. Hopefully everybody is in now, but I certainly welcome it. And I'm sitting wondering, could and probably should we have had this 3 months into the pandemic? It would have been most helpful, I think. But I know NIPSA will build on this good example. Listen, I just want to speak from the branches that I work with in BOF and ask a question towards the end. But it's very much, I think, and I thank as well all our trade union and our trade union health and safety reps who have really stepped up to the mark over the pandemic and stepped into the breach. We in my department of finance were left with a whole range of workplaces. We had to get people home. We had to get them set up with the work from home. But when we started to face the return, a partial return to work, and for those who couldn't work from home around August time, July into August, it became apparent that we weren't trained for a pandemic situation. Locally, some of my reps negotiated tremendous deals where banks of 8 desks, where we only had 2 desks of those occupied. It was a strict minimum of 2 meters social distancing, and in many situations we extended it further. We had face coverings for people in those buildings. At some stage they were removed. I think it was a public health agency gave advice that coverings shouldn't be provided in the NICS. I'm speaking obviously as a civil servant. However, the reason for that, we do not know, whether it was on cost grounds, whether it was because there was a lack of face coverings, but it was certainly seen that there was outside influences at force trying to undermine what was agreed locally. So that question, we also had a very specific situation about ventilation systems, and I know the Health and Safety Committee have touched on this in their easing and their magazine. But we had buildings that had air management systems, and we really needed technical support from people in that industry who could advise whether it was safe or whether it was going to lead to further spread of COVID. So the question I really have is, and it's not just the NIPSA, it's for Owen Reidy as well, for the labour movement, could we have, and at this stage, and I think it's still valid, could we have provided more health and safety critical advice and get the actual experts in? And I personally believe we could and we should. And at this stage, we definitely should. But we had reps and health and safety reps who were coming under pressure from buildings to open, and we needed, and I firmly believe we needed the experts in that field behind us advising the trade union movement and advising our members and reps. I'll leave it there. Thank you, Brian.
Thanks, Paul. Owen, are you happy to come back on that?
Yes, President, no problem at all. Hello, Paul, and thanks for your question. I mean, I'll be brief because I'm conscious that Alison and others may wish to comment as well. I think the point Alison made in her contribution is, you know, when we reflect on the last 6 months, could we all have done more? Yeah, of course we could. Have mistakes been made? Yes, I'm sure they have, and we need to reflect on them and improve them. But a couple of things I would say. We are very careful that, you know, when affiliates want support from us, we'll give it. But what we won't do is cut across them. So I don't see our role in the ICTU to go to Unite or NIPSA or GMB and tell them how they should operate their health and safety. Our role is to support and complement. But I think 2 things which we've done, which I hope have been an important contribution in the pandemic. Through a Northern Ireland engagement forum that the executive set up, which included trade union leaders and employers and the PHA and HSE-NI and things like that. And Alison was a key member of that forum along with myself and some others. We put together a policy paper, a document that the executive endorsed on returning to work safely. And that was produced in July. And NI Direct tried to push it out there, and it got quite a lot of hits on the NI Direct site. And it was very, very clear, very, very explicit about how and when a workplace should and could only be occupied by its staff. Very, very clear about things like the 2-meter rule and all that kind of stuff. When we were engaging in that negotiation with the employers, they wanted words like may, should, could, and we insisted on definitive black and white health and safety specific words like must and will have to. And I think if you've seen that document, I think it's still a very credible document, and essentially we've argued that that is the minimum that should have been applied. We also did a paper on working from home, because we know many people found working from home a positive thing. Some people found that a very negative thing, frankly, as well. But it's really important, and we've made this argument, that when workers are working from home, that the home is essentially the workplace, and that employers still have health and safety obligations. So they're two initiatives that we've done. I'm not sure if you're aware of them. I hope you have been aware of them. If not, we need to up our game on that. But I think those initiatives will stand the test of time. But I'm very conscious that our role is not to tell an affiliate how their health and safety should operate. Our role is to support and complement. And I'm very clear of that, because when I was in SIPTU as an official, I didn't want the ICTU interfering as such. I wanted the ICTU to be involved in issues that I thought were relevant to SIPTU. So I hope that answers your question. Thanks, Paul.
Paul, you happy enough? Do you want to come back to Owen?
No, listen, I understand, obviously, but it is very much about complementing and learning best practice from individual unions and spreading that around. I just think that NIPSA has done tremendous work in many workplaces, but it seemed just to be very much workplace by workplace, and how active the branch structure was, obviously supported by NIPSA officials and any secondees that we had. And I think this is our task at the minute that we have to do, is spread that best practice and get it into every workplace to ensure that we're not working in different with different agreements, that we are trying to adhere and deliver best practice across all our workplaces across Northern Ireland public sector.
Agree with you, Paul. And maybe just as a point, when we come to the general discussion, next steps for NIPSA, you maybe already have identified one of the things that we need to look at, not putting your arm around your homework and sharing that with others. Okay, thank you, Paul. The next speaker I have is Lucia Collins, General Council member. Lucia, can you hear me okay? Your question for Owen?
Okay. Yes, Brian.
Yep,
Hello.
can hear you.
Good morning.
Yep, hear you perfectly.
Good morning. I actually hadn't intended to come at this point. I was going to come in later on, but given that address from Owen, I would like to just comment and ask a question. Can you all hear me? Yeah.
Yes, perfectly.
I mean, absolutely. I do feel we're coming a bit late to the stage. It's brilliant that we're here now, and we have the Congress and the COVID workforce paper that we can build on. But really, how many mistakes have been made to date, and how many more through the pandemic do the government and the Assembly continue to make? We keep hearing that they're learning from their mistakes, but 9 months later, we're examining the situation every day. Every one of us have been affected by some bad, terrible situations, and what I have heard from the ruling class is not helping me. We know PHA guidelines, health and safety guidelines, all are there for the capitalist class. They're there, yes, to registrate the industry, the working industry, but we have to take into account that the least protection possible for workers, because it's all about money. It's all about money, and it's about what they can afford to give us to help us, and it's why we're fighting for better provision. And I think that's something that we have to take forward. If we say we tried to take up a consultancy firm or somebody to help us with the health and safety, not to rely on management. I mean, we know the health and safety law is supposed to be the highest law in the land, and yet the PPE, the lacking, the care assistants, the care homes, all of the things that failed and are still failing. we're still seeing that chaos play out. So I want to be positive and I want to address the damage that has been done. And I have no fear of taking them on, as you say, Owen, with 8,000 activists. And we NIPSA and other unions, like today for Newry and Mourne, and I commend them for their stand. And we need to raise and build from now. Oh gosh. We should be under no illusion that money's the factor, and we have to get that message across to our members that whilst we've done everything as working activists on the ground that we can in our own areas, we can see the differences. We can see some places have been better protected than other places, and I'm working from home, but I'm still getting hassle from my manager. I mean, that's an everyday work in DFC, in the Department for Communities. That's an everyday situation. You get the phone call, have you done this? You've done that wrong. You'll have to come in a day. You'll have to come in and sort that out and look at this. So I'm just saying, we're responsible. We're partly responsible for presiding over the situation we're in, and we must fight the Assembly for all of the things, Owen, that you have been saying. And again, I just think, you know, we have more power than we know to make it right. Thank you.
Could I just say, Brian, a brief comment in response to that?
Yeah, work away, Owen. Thank you.
Thanks, Brian. I couldn't agree with you more, Lucia. And I mean, that's why we're advocating essentially a new economic model, because the current economic model has failed. And we've seen, you know, we've lifted the bonnet of the boot of the car, and we've had a look at the engine, and it's ropey. It doesn't work, and it doesn't work for our people. And I hope that's why, you know, that's why the no going back paper, I think, is really important. And I hope that all activists in NIPSA and all unions, and to be fair, NIPSA was the first union that invited me to address your General Council on no going back. And it's to your credit, and I'm meeting all the unions, but you were the first, because I think you see the importance of the necessity of a new economic model. But what we're going to have to do is rely on ourselves as workers and as trade unions, but we're going to have to build alliances, and we have to persuade and convince people, because otherwise we will get what we get, and we will continue to get what we have in the Assembly. And that's not good enough. So I think we have to be ambitious, we have to be hopeful, we have to try and build a consensus, we have to persuade people with our argument. And I think it's really important that we are ready for the backlash from the Tories when it comes to pay justice. And, you know, when people are trying to say that civil servants and public servants, when they're seeking a just pay increase, shouldn't get it because they should be grateful that they have a job because there's so many redundancies, we need to equip our people with the arguments that are in our paper so that they can combat that and fight it on just, credible grounds. There is no need for austerity, and we need to make that very clear. So I completely agree with you, Lucia.
Thanks very much, Lucia, for that, and I think everybody around the table would agree with that, and thanks for that response, Owen. I think we do have a collective fight. We're going to have to muster community activists as well as ourselves and deliver something for all of us collectively. I'm just going to ask Connor now. Sorry? Say it again, Connor. Francis Jewell from branch 111. Can you hear me, Francis?
Yeah, I can, Brian.
Great, work away, thank you.
Apologies for the big headsets. I'm now a hearing aid user, so that's why the headsets are on. So
no need for an apology, thank you.
Okay. Brian, I'd first of all like to pay tribute to the full-time officials for all the support that they have given throughout this whole pandemic. People complain and gripe and get on, but the full-time officials are working from home as well, and they have their own personal circumstances and their own mental health issues and different things that they have to combat. So as I say, I would like to pay tribute. Owen said there about having definitive words, not wishy-washy, and I feel Lucia was saying there about DFC, which is the department that I work in, about day in, day out, the pressures that we're under. Most of us are involved in administering benefits and dealing with vulnerable customers and stuff like that. So we're at the front line, and we're constantly under pressure, but the support that we have had from the full-time officials is more than welcome. Unfortunately, in recent times, in the last maybe a month or so, the management side are becoming a wee bit more complacent in regard to health and safety. They think it's going away. They acknowledge, yes, there is a virus out there and it is life-threatening and so on. But however, sure, get on with your job. For instance, on Monday, we have 7 new staff coming into the building to be consolidated, and management wanted to do old school. In other words, practically sitting on top of each other, and they were not amused when basically I told them they couldn't do it. But at the same time, they'll go ahead and do it, if you know what I mean. But it's having management side acknowledge that health and safety is a priority. They must use the guidance that is there from PHA. They have to adhere to it, not succumb to the pressure from senior management to hit targets. I'm not saying that customers, the public, don't need help on any shape or form, but the health and safety of our membership that are administering the processes needs to be a priority too. We can't be sitting on top of each other in order just to press buttons to get a claim done, so forth. And I'm in no way saying that people who are applying for help don't need it. Certainly they do, but the people administering it within DFC, we need the help too. So again, credit to the full-time officials for all that they're doing for us and for being at our beck and call, quite literally. I know I speak from that, from branch 111. Thanks very much, Brian.
Thank you, Francis. And people like you must keep up the great work and defy management's wishes. And I think you made a very salient point. There seems to be, because we've recognised this within health and other areas, that there's a little complacency creeping in, and we have to manage that, and we have to stand fast. And I know Paul talked earlier about removal of masks and things, so we'll take note of those things, and we'll certainly start to address those and make sure that that collectively is shared out. Owen, you want to make a comment there?
I just would support everything Francis has said, and I think, Francis is making the point from the coalface, and I think it's just really critical that we listen to that and that we support that and endorse that. Yes, obviously, the citizens who rely on the work that Francis and colleagues are carrying out are crucial, but the health and safety of the staff delivering that work cannot be compromised under any circumstances, and that has to be the bottom line. That has to be the message. Yes, work has to pay, but it also has to be safe. And again, health and safety needs to be brought to a whole new plane post this pandemic.
Thank you, Francis, for your contribution. Thank you, Owen. Can I now call on Ian Boersman, Civil Service Group Executive Member? Ian, are you picking me up? Have you got me, Ian? Oh, come on. There you go. Work away, Ian. You're on.
Sorry, Brian, I have my camera off. I'd like to thank you all for putting on this event. And like Francis, I would like to pay tribute to the full-time officials who have done sterling work during this pandemic. I don't think it's any exaggeration to say that they've saved lives amongst the workforce. As much as I welcome this event today, it is unfortunate that we aren't developing policy as well. I think we urgently need a policy setting conference, and the civil service, I know we are having one in February, and for me it can come soon enough. We are obviously seeing the beginning of possibly the end of the pandemic with the announcement of a vaccine, although government officials are saying it will take until summer until everybody is vaccinated, everybody who wants to be. And I would hope that we would be encouraging people to take up the vaccines. What I would say though is, there's no going back to the way things used to be. When we all went on lockdown in March, we got an email from the then head of the civil service, Sterling, saying that things may never be the way they were before. And I thought at the time that was slightly over dramatic. I don't think that now. Having come through the changes that we've come through over the last 6 months, I think there's been a decade's worth of changes in 6 months. We aren't just going to go back to our offices when this is over and work the way we used to before. There will be more working from home. In the civil service, the management are talking about a blended working approach where you have a laptop and you spend half your time at home and half the time in work. We need to hear from our members to navigate through these changes. We can't just rely on people sitting in executive bodies. And I speak as somebody who is a member of an executive body. We don't have all the answers. We can't set the changes that are happening now will set working practices for the next decade, maybe even longer. And we cannot make those changes without hearing from the members. We don't even know what all of the problems are. And I would encourage as many as people as possible today to speak the issues that they're having in their workplaces, because we need to hear from them. We also need to take their voices forward and move forward with policies based on those experiences. So I hope that now that we have ironed out a lot of the technical problems for holding events during this pandemic, the next step will be policy making forums so that we can navigate the changes that will not just deal with this pandemic, but deal with issues that it will affect our members, possibly the rest of their working lives. Thank you.
Thank you, Ian. You make very sensible points there, and I think we have struggled a little to catch up with technology, and hopefully we're on the road too. It is a little disjointed here, nothing to do with the organisation of this. It's just trying to get your head around. You're talking to somebody in a room, you're looking at a camera and you can't even see a face. Owen, I'm not sure there was much for you to comment there, but obviously, no, that's okay. Conor, have we another... So we have Patrick McWilliams, branch 118. Patrick, can you hear me? Paddy, is that Paddy? Paddy. That you're down as Patrick. Paddy kind of threw me a second. Can you hear me okay? Come along now. Okay, thank you. Paddy, you work away there, you're on. Unmute yourself. That's you.
Okay, yes, it's just, I want to come back to something that Owen said earlier on in relation to the who actually are the essential workers, and I think he made a very good point, because this pandemic has illustrated who are actually those essential to keeping society moving and keeping society working. And again, to the point that he made in relation to the rights and terms and conditions that many of those workers enjoy, there's no doubt whatsoever that many of them are on the very low end of the pay scale, struggling even to get the living wage. And I mean, to have a minimum wage and then it doesn't even meet the living wage. Well, what does that tell us? People are relying on top-ups and tax credits, etc., just to survive, and they're doing essential work. That's an absolutely disgraceful scenario. But ourselves in the civil service side, and again our colleagues in P&O side, we do enjoy fairly decent terms and conditions. And I think it's highlighted to us quite often when we work alongside agency staff who come in with virtually no terms and conditions. We've been successful in recruiting them in very small numbers, but we've also been very successful in some of the things we've done on their behalf. For example, we got them equality in the pay increments. And also, I mean, politicians get a lot of abuse at times, and quite rightly so. But in relation to the isolation and full pay for agency staff, that was something that was taken to the Finance Minister, and he quickly seen the rationale behind that and recognised that that was a health and safety issue. So by giving them full pay, we now have colleagues working along with us who don't have to make very difficult decisions in the mouth of Christmas as to whether they should isolate on sick pay or receive full pay. They now have that security, and we have to welcome that when it does come along. But there's an awful lot more work that can be done in terms of improving the rights and improving the terms and conditions of workers. And really the only way to do it is to organise. There's absolutely no doubt about it. In hospitality, in retail, for example, the two industries that are probably taking the biggest hit at the moment in terms of their jobs and their future livelihoods, organisation is at a very low level. I spent most of my working life working in hospitality. It has its own, with retail, it has its own difficulties in scattered workplaces. It's harder to organise. It's something that we're going to find more difficult going forward because our workplaces are now being spread out. It's going to be more difficult for us to organise the kind of solidarity that we could do in the past in large workplaces. And although I don't, in a sense, have a question as such to Owen, I remember speaking on this on a motion. I think it was John Douglas had put it up, and it was at the biennial conference when we were when it first came to Belfast, and I spoke on a motion there. And I was strongly speaking in support of organisation within the likes of hospitality and retail, and what that means for us as civil servants and as public servants. Our terms and conditions will always be under threat, while there are other workers who don't enjoy those terms and conditions. And I've always strongly believed that it's the rising of all boats that strengthens all of us together. And let's face it, in a pandemic like this is where it comes to the fore, because it's the hospitality and retail workers, or more importantly, even the transport workers, bringing staff to work on public transport, etc. If they're not safe, if they're not working in a safe environment, then we're not safe. If our agency staff are having to make a decision between paying their rent and taking the advice and isolating, then we're not safe either. And the message, I think, really is that ultimately, it's not a question of improving work in one industry or that industry. It's about improving everybody's terms and conditions. And it is vitally important for us that we work to try and unify all workers, because that's where our real power. A couple of speakers earlier on talked about the power of workers. Well, it is a late power. We don't often see it demonstrated. I mean, it was Big Bill Hayward that said that all the working class have to do is put their hands in the pockets and the employing class are licked. That's an actual fact, but we never seem to come closer to it. So what I would like to, just to say to Owen, I'm glad that he's raised that. It's something that I'm very passionate about. I've spent a fair bit of time trying to recruit and help our agency staff. And I would like to see that work continuing. I think ICTU have a huge role to play in that. I think all of us have a role to play in it, but where we need to try and encourage and help. And perhaps something that we could do with the Assembly is to bring it into our education system. So that young people coming through, we see our agency staff coming in, they're generally quite young. They have absolutely no concept of what a trade union means. And we need to address that, and we need to educate them, and we need to let them know that there is a better way. And the only way that you improve your terms, your conditions, and your lot in life is by organising and standing together. So although it's not a direct question to Owen, I would put it to him. I think we don't seem to have made the advances that we need to make in organising all workers. And ultimately, it's only by organising all workers that we all stay safe and that we all move forward. So thanks for the opportunity of speaking, and thanks for the comments you made, Owen. Very much appreciated.
Thank you, Paddy. I see no one eagerly anticipating to answer you, so I'm going to ask you to come in there, Owen.
Thanks very much, President. I have to say I couldn't agree more with Paddy. I think he's hit the nail on the head on so many different heads, and we could and should have a seminar on that alone. It's a crucial issue, Paddy, and you make the point. As a activist in the public service, you see that link, that it's not just all about civil and public servants, it's about all workers, and it's raising all boats. It is not in the interest of public sector workers in Northern Ireland that are organised that only 15%, 1 in 8 workers in the private sector are organised. And there's two things I would suggest that need to happen and are not happening to the extent that they should happen to address that issue. The first thing is this: private sector unions do need to reorientate their capacity and their focus and a lot of their funds to this. When I worked in ICTU, we made the point that we spent 97% of our money on 20% of the workers in the Republic of Ireland, and we spent 3% of our money on the remaining workers that were unorganised, and there was an imbalance there. And that hasn't changed to the extent that it needs to change. Something else that needs to change, though, is the pitch upon which we play, the industrial relations and legal framework in which we operate. I represent the Congress at the ETUC, the European Trade Union Confederation Executive, and we're in the process of trying to promote a draft directive, the EU draft directive, that would force member states of Europe, where collective bargaining coverage is lower than 70%, to do things to get it up to 70%. In the Republic of Ireland and the UK, it's way below 70%. And by the way, even though the UK is leaving or has left, tragically, I would say, the European Union, there's nothing stopping a Stormont executive with employment rights devolved mirroring a progressive EU directive if it sees the light of day. But two things I would say very briefly. In Northern Ireland, 90% of private sector firms have less than 21 employees. If a private sector union seeks to organise a firm and they want to go to the industrial court to get recognition, the threshold is there has to be more than 21 workers in the bargaining unit or in the firm. So that legislation that was brought in the Blair years is essentially redundant for us. And by the way, it hasn't really helped unions in Britain either. So the issue is not mandatory trade union recognition. The issue is to promote collective bargaining. And we need the conditions and the legal framework in which we operate in to be more trade union friendly, to facilitate that collective bargaining and that union organisation in wholesale, retail, hospitality, etc. But unions also need to do more, and they need to reorientate their resources on that front. And it's a work in progress, it's a job in progress. But Northern Ireland and the Republic of Ireland are probably one of the worst places in Europe when it comes to that type of access to collective bargaining. So that's why it's really crucial, that piece I read out in New Decade, New Approach, where it talks about workers having a level of autonomy at work. For us as trade unions, the only way workers can have autonomy at work is through an independent, free, active trade union. So, I think I agree with you completely, Paddy. There's much work to do, and we need to do it. And I think that European directive is something that could be significant, but we need to change the law in Northern Ireland. And we've a paper that we've submitted to MLAs on that. And that's a crucial issue. But unions as well need to reorientate their resources with putting more members' money, quite frankly, into organising initiatives rather than just servicing. Servicing is crucial, of course, but we need to organise the unorganised. So I agree with you more. I couldn't agree with you more, Paddy. I think there's a seminar or two in what you've said. Thanks.
Thanks, Paddy, for that, and thanks, Owen, for that comprehensive response. And maybe that is a seminar and one on the list, and we'll come to that later when we prioritise what we'll be seeking to do by way of a webinar in the near future. And it seems to me as though that might be a priority. Last speaker for this session before we take a break is Lachlan Duffy, General Council Member. Lachlan, can you hear me? You're en route apparently, Lachlan. There you are. Unmute yourself. Unmute yourself, Lachlan.
There you go, gremlins. Thank you, Mr. President. Owen, I really enjoyed your contribution there, and you spoke about some things that I'm passionate about. For example, the minimum wage, the ridiculous amount that teenagers get. I watched two teenagers go out to their weekend job and come home after 7-8 hours having received a miserable 30 quid after busting themselves to work. I suppose we could put that down to austerity. If there's a number of things that COVID has positively taught us, is that some things are only myths. For example, austerity. There was never a need for that agenda to be rolled out. It has impacted on issues such as minimum wage, a decent wage for workers. It has impacted on services and how they've been stripped beyond being able to function. It has basically robbed from the poor and given to the rich. All the things we learned from the pandemic are the myths in our workplace around working from home. As we know from pre-pandemic, if you asked to work from home from a work-life balance point of view, it was nearly an impossibility. Well, we know now that that was never true. The other thing we've learned is if you had asked for a workplace adjustment or an estates issue to be dealt with, it mightn't have happened that quick. Well, states are up to their eyes now, making changes to different workplaces in all sectors. There's workmen working that never had to put the hours in that they had to put in before. So that wasn't true. There was the myth that you couldn't step down services if you were short-staffed or if you were in a crisis. Well, again, we know that's not true because we had our stepping down and we've got our rebuild plans, evidence of that. So in terms of no going back, I think that we go back in a stronger position, having learned so much from this, that anything or most things that were told to us pre-COVID were not simply true, and anything that wasn't possible is now possible, because during COVID, what we've learned is anything's possible. You can close down the world. You can open up hospitals over a couple of weeks. In China, I think you can do it in 5 or 8 days, build a new hospital. So there are many things that we can go back into this positive, that we are stronger. I'm looking forward to what happens next stage, because I believe we can build on the strengths that we've had during the pandemic. And I know some people have said, you know, we could have had this COVID seminar sooner. I think it's very timely that we haven't. I mean, we needed the IT. You know, I needed it to unmute myself there, but we needed the IT services to be in place, and we've now got them in place. But I also think that we are going back in with so much in our armory that we can use to make sure that we never go back to where we were pre-COVID. Thanks for that.
Owen, you want to make a comment?
Well, I just very briefly, President, because I'm conscious that you're coming up to a break. I just want to agree completely with Lachlan. I think that sense of analysis and that sense of optimism and can-do mentality that I think he's articulated, we have to accept now definitively, and we can't let anyone deviate us from our mission, that, you know, a better world, a better society, a more equal participatory economy is more than possible. It's achievable, it's realizable, it can be funded without turning the world on its head, and we've outlined it in our paper. So we have to make our narrative and our aims and our mission center stage. It needs to become mainstream thinking. It shouldn't be just something that, well, that's what a bunch of trade unions would articulate. And I think we really have with missionary zeal, we have to go out there, first of all, within our workplaces and within our members, but beyond that, and build relationships with other groups in civil society to argue for a different, better society in Northern Ireland, and to make the Assembly, notwithstanding the limited powers they have, accountable. Employment rights is a devolved matter. We need to maximise our leverage on that, and there can be no, you know, regrowth in the economy without both sides of the labour market benefiting, and workers have not benefited, and we have to make sure that they should. And the last thing I'll say is, when the comments are made in the next number of months, as they inevitably will, when you're seeking pay increases, we need to arm and equip our people with these facts and these figures and these narratives that you're entitled to a just and fair pay increase. There is no need for austerity. It is a policy choice. It's not inevitable, and that there is an alternative. And we have to lead that and be proud of the capacity and the opportunity to lead that, and take that incredibly seriously. And at the end of the day, I think those are the things that Lachlan has outlined that unite all of us in the trade union movement, whoever we are, whatever we are, whether in the public sector, the private sector, civil service or health service, international workers or locally born. That's the thing. We need to focus on what binds us all together. And I think we have the capacity to do something. And I'm incredibly excited and enthused about the next 6 months and years ahead, because I think there's a real job of work that we can do, and with everyone's support, I think we will do it. So I fully concur with Lachlan's analysis. Thanks, Lachlan.
Thanks, Lachlan, for your input, and Owen, thank you very much for your responses there, and I agree, things will bind us together. Can I say a big thank you to you, Owen, for taking the time to come this morning? We really appreciate it as ever. You've given us a lot of food for thought, and for me, some clear messages. So appreciate your time. Normally now I would give you a wee handover and a wee token gift, but that's not happening. But trust me, it's in the post. I'm just going to ask Alison to sum up very quickly, and then we're going to move to a break before we go to Janet.
Okay, thanks very much, and thanks to all the contributors and all of those who we can't see, who are in their home workplace at this point in time. So I think that was certainly a good session to kick off with, to give us some thought-provoking issues for moving forward with the rest of the day. And it reminded me, certainly the last speaker reminded me of the time when we had the G7 here, I think it was 2016, that the trade union movement got behind a strap line, another world is possible. And I think certainly we have now seen that world. As the last speaker has said, Lachlan has said, is that, you know, all of the things we've been told where members were maybe struggling with disability issues and getting into the workplace or any other issues, is that we were told, oh, this would take months to do, and yet on the 23rd of March, many of us lifted our laptop, lifted our computer, stuck it in the boot of our car, got a taxi home, and we have been working from home and working very effectively from home. So while it wasn't how we wanted to get to that new world, I think certainly this has proven that another world is possible, and that was the slogan from the trade union movement. I think there's been lots of good points that have been made in this first session here this morning. I think we will pull those together, and there's a session at the end today where we're given the opportunity for us as a trade union, as NIPSA and NIPSA activists, to think, what are the issues? Because I did say in my opening remarks is that, have we got it all right? And no, we didn't, because I don't think any of us knew earlier this year or this time last year, where we would be this time. Could we have done this? Could we have got this seminar or a conference done 2 months earlier? Perhaps we could if we'd have thought about that in March, but we are where we are, and I hate that expression, and we are moving forward in relation to, we have our civil service conference organised for the 11th of February, and that will be a slightly different thing with people voting and all the rest of it, but we will get there with the cooperation of all involved in getting us to that point, so that whether we're in a real conference or a remote conference at the end of May next year, is that we will have this as a slick operation. But I think already there's been things have been said this morning that will lead to maybe shorter, not full day, shorter, intense engagement in this fora, because until we're all vaccinated, and that's going to take probably, I think, as a previous speaker said, until the summer of next year. I hope it can all be done by then. You know, the sceptic in me thinks, you know, will this be the operation that they think can be put in place? However, you know, if we can't meet collectively how we like to and how we like to socialise and engage outside of the normal conference events, then we will have to think about this. I mean, I was speaking to someone, it wasn't a trade union conference, but they had other mini events throughout a 2-day, which give people the opportunity, because I know maybe sitting at your laptop watching this, maybe at your kitchen table, isn't the ideal way. And, you know, things that can be fun as well. So it's not all just about serious policy making, albeit that's the main issues for a conference, but let's think outside the box about how we can make it both enjoyable and a policy-making conference that is really important to move us forward. So we're going to have a civil service conference on the 11th of February, and we're going to have a remote BDC in relation to the Northern Ireland Committee Conference of Congress, and I think that's the 23rd of March. So we'll have 2 practice goes before we get to I was going to say to Enniskillen, but wherever we're doing it from our homes or wherever on the 23rd of March. So, Owen, hopefully this has given you a taste of a remote event. And thank you very much, Owen, for attending today. And thank you to everybody who's contributed so far. And I look forward to hearing a whole load of different people speaking later today on a range of issues. So thank you very much indeed, and thank you to all the participants.
Okay, folks, thank you. Janet, I'm just giving you notice. We're going to come back in 10 minutes, and we'll start with you, Janet, if that's okay. And for the rest of you, just take a well-earned break, and we'll see you back here in 10 minutes. Thank you.
Thanks very much, Brian and Alison. Take care.
Okay, folks, welcome back to our COVID-19 seminar. Janet, see you on the screen there. You're very welcome, and thanks for your patience and your indulgence. We're slightly running over time, but that's maybe to be expected. Folks, I just want to welcome Janet Newsham. Greater Manchester Hazards is the acting chair of UK Hazards Campaign, an organiser of UK Hazards Conference, and coordinator at Greater Manchester Hazards Centre. Comes with a significant trade union pedigree. Has been involved in work with University College on Union Learning Forum projects, employed as a lecturer in trade union education at Manchester and Preston colleges, a keen trade union activist for nearly 40 years, branch officer, workplace representative, and served in the union's executive committee. She's also been a lay member of the employment tribunals in Manchester for 20 years. Janet, you're very welcome, and I'll hand over to you now to give us your presentation, and then I look forward to some questions after that. Thank you.
Thank you so much, and for inviting me to your conference. It's a real privilege to be part of this virtual conference today and to bring you solidarity greetings from Hazards Campaign and the Greater Manchester Hazards Centre, and also to send solidarity greetings to those workers on strike today. So next slide, please. So from the beginning of the pandemic, COVID-19 has been centred in workplace health and safety, and as the terrifying and deadly tentacles of COVID-19 struck us in our homes, in our communities, and in our workplaces, thousands of us died, and many more have been left with chronic ill health and disabilities. As the pandemic ravaged, the Hazards Campaign has charted its progress through fortnightly discussions, press releases, letters to the health and safety executives, public health and reps briefings, speaking at different events and providing advice for workers, and working with organisations like Independent Sage. And I put a call out, if you've never watched the Independent Sage, which takes place every Friday, then please do. They're providing really invaluable support, I think, for workers. And never has our work been more relevant or more valued. And it would be remiss of me not to mention the heroic role of trade unions like NIPSA and the safety reps throughout this pandemic. And from the Hazards Campaign, I would like to place on record our thanks to you for keeping workers safe. Next slide, please. So many workers have been placed at significant and unnecessary risk throughout the pandemic, and it's been clear that we can't trust the UK government, many of our employers, and in our workplaces, or even the health and safety executive to protect workers or public health. And workers' health is public health. An increased risk in the workplace has been shown to spread the virus and place communities and our families in jeopardy. In England, outbreaks in Leicester's sweatshops hit the headlines, and the meat processing and food processing plants across the UK and Ireland have been prime examples of rocketing infections, but these are not unique. There have been many examples to individuals and communities being placed at risk because of unsafe and unhealthy working conditions and practices. Health and safety law was developed over decades. It was fought for by collective action of workers. But for the last 3 decades, health and safety has been ideologically demonised as pointless red tape and a burden on business. And this has been challenged, and this has challenged its effectiveness, all the things that keep workers safe and healthy. Health and safety laws, enforcement and trade union organisation have been attacked and undermined by deregulatory neoliberal governments of all shades. Funding to the enforcement authorities has been cut by more than 50%, and the introduction of new laws as technology and the route of workplace harm changes have been blocked. And in too many cases, workers' ability to get compensation or legal redress has been denied. There has been an insatiable drive to cut regulations, the very ones that protect workers, our communities and our people. Steve Toombs, who's an academic in the Open University in the Better Regulation, Better for Whom, says business harms are routine, systemic and crucially avoidable. They are a form of violence so widespread they've been called social murder because they put communities, consumers and workers in a position that they inevitably meet a too early and a natural death. And before the crisis, many of the very same essential workers regarded highly through the pandemic were trying to survive on insecure 0-hours contracts, poverty wages, sleeping in unhealthy housing or even in their cars or on friends' floors or in tents outside workplaces that they couldn't afford to travel to. Workers sacked for taking too long at the toilet, being taken away in ambulances because they were too scared to call in sick and with life-threatening conditions, or workers peeing in bottles or shitting in plastic bags because they didn't have the time to move from the workstations or they didn't have any welfare facilities available. Rory O'Neill in the Hazards magazine said that workers should not be disposable and work should not be spirit-sapping, body-breaking grind, and warned that bad jobs are driving us over the edge and it is time to turn and fight for basic decency, security and rights at work. Non-essential work was kept open in the first lockdown in places like construction, building luxury hotels in Manchester. And again now, many COVID clusters outbreaks in those kept open and workers and community are infected as a result. The pandemic has highlighted the inadequate protection of many working people against risks at work and how inequalities in society, those in precarious work, low wages, impoverished living conditions and underlying health conditions, many related to previous exposures to unsafe and unhealthy work, have increased workers' exposures to the risk of infection. There have been systemic failures in our occupational health and safety laws to protect workers and prevent harm. Zero-hours contracts continue to be exploited. Workers continue to be exploited. No sick pay, some furloughed workers forced to work. Vulnerable workers, many working in multiple jobs without risks controlled. Inequalities have highlighted the risks to health, a disproportionate impact on older men, Black and ethnic minorities, some women in certain jobs, and for many for socio-economic reasons, and systemic racism and a lack of PPE that was available. Or workers wearing PPE that was not up to standard. In fact, we saw the standards reduced as workers became exposed, infected and died. And now workers are expected to wear face coverings, which is not PPE. Schools, hospitals, buses are all workplaces, but treated as something else where risks don't need to be controlled. Who has ensured workplaces are COVID safe? Well, in England, the HSC initially locked down, then they introduced call centre and is inspecting workplaces through telephone conversations. This is not enforcement in our eyes. And early public health advice concentrated on increased hygiene and better cleaning and giving space, which incidentally was about to be changed to 1 metre as the aerosol risk information began to gather momentum internationally. We know now that we need a Swiss cheese approach to controlling risks, at least under transmission risks, until the transmission risks are minimal in our communities and workplaces. Next slide, please. So government guidance was issued that weakened employers' duties. In fact, our workplace enforcers were kept out of the picture of controlling transmission risks. Perhaps if they'd been central to government advice, then PPE would not have been downgraded. The care workers exposed to the virus with no personal protective equipment available, or taxi or bus drivers, food delivery workers, health workers, cleaners, teachers, postal or transport workers, they're not the ones who can work from home, and many have been abandoned to life-threatening fate, and one that many have sadly lost, and for most, one that wasn't even thought important enough to count. Trade unions have been desperately trying to organise their own PPE supplies to protect their members, and where collective action was possible, workers forced employers to protect them. The UK is by no means the worst or unique in its negligence of the risks of people, but with a long and proud history of health and safety law, they should have been better. The laws weren't changed, but they were undermined by weaker guidance, by a lack of enforcement and a lack of resources for our enforcement officers. PPE should have been available and it wasn't, and precautionary standards were reduced to match the inadequate supplies. Who could forget the images of Chinese army of virus testers in their full protective clothes compared to the frontline health workers in adapted plastic bin bags? And the deaths of our loved ones in care homes is unforgivable, given that many were exposed because the government failed to implement strict infection controls, providing testing, PPE, and encouraged infected residents to return to their care homes. And many of those that died weren't recorded as COVID deaths because they weren't tested. We've seen many clusters of cases of workers over recent months. Most didn't hit the headlines until dozens of workers have been infected, and some have sadly died, as I said before. And advice about transmission sources has lagged way behind the available research, and the government have been forced to provide information only because too many people now are aware of the science. The UK government's priority has always been business first, profit before people, business and Brexit before health. And health and safety law, as I said before, hasn't changed, but the government guidance has undermined it. There's been abuse of the available science. They've ignored workplace transmissions to keep workplaces open. And in England, the government forced schools back to get workers back. No recognition of the community and family transmission risks from children. They failed to control or invest in resources to ensure the risk of transmission was controlled. They haven't followed the zero COVID strategy and a COVID workplace strategy. Find, test, track, trace, isolate and support was abandoned to private services which have failed to contact, failed to support those isolating and failed to test. And the government was forced to act to protect workers' lives, but no overall strategy being followed, only too many deaths, then lockdown and release until vaccinations established. We're on a roller coaster of infection with no track and safety net. Hopefully the vaccine will arrive and will work effectively, but we're talking about many months, maybe years before that happens. We have a class war, I believe. A few days ago, Matt Hancock seemed at a loss to understand why so many people in Britain go to work when they're unwell, and that says it all. Workers on precarious contracts, unable to earn enough when they're at work, and when they don't work at risk of being dismissed, are not being paid sick pay. Next slide, please. So the Hazards Campaign timeline lays bare the lies, deceit and ineptitude of the UK government, with a belligerent path of privatisation and giving away millions to their mates, which has resulted in failed PPE, failed apps, failed testing, tracking, tracing and failed control of the transmission risks. You can see a copy of this in the latest Hazards magazine. Next slide, please. So our employers, there's been a mixed response to the pandemic from employers, and we've heard some of it this morning. Some have worked with trade unions to ensure workers' health has not been put at risk, but many have disregarded the precautionary standards and people have been infected, and the enforcement bodies that should have protected workers have been AWOL. Health and Safety Secretary has not acted the same across the UK. In Scotland and Northern Ireland, you had a better relationship to start with. And there were some differences when where there's a closer relationship with trade unions. And we saw from the paper that was produced, that was talked about earlier, in England, there was an initial weak statement made and then nothing. In fact, they discouraged people from reporting any infections, any results, any ill health and any deaths. So the HSE locked down, they carried out phone checks, as I said before, hardly inspected in person, even though most risky workplaces continue to work. You'd have thought the HSE would have sat down and said, you know, which are the high-risk areas, high-risk workplaces, and then prioritise those, but they didn't. They didn't enforce, didn't communicate. And the fear, I think, of privatisation or privatisation just around the corner has stopped them. And if they're not careful, they're going to be complicit in their own demise. So this has meant, as I said before, workers infected, seriously ill, left with long COVID and dead, and employers discouraged from reporting infections, ill health and deaths. Next slide, please. So we've been talking about the future of health and safety law way before the pandemic. And last year we prepared a manifesto which sets out a blueprint to improve and build a health and safety system based on prevention, precaution and participation. And I'd urge you all, in light of all the failings of our health and safety during the pandemic, to read it on the Hazards Campaign website. We need a change and we need it now. Next slide, please. So workers organising, and we've seen plenty of basic trade union health and safety organising and some global solidarity. The pandemic has shown clearly that trade unions make a difference in the workplace, fighting to ensure workers are safe and forcing employers to carry out their duties. And some of the examples on the slide show the Shut the Sites campaign by construction workers to shut non-essential work down, the bus workers to control the risks on buses, cleaners that were striking to get paid sick pay, legal actions on PPE for gig workers, COVID risk registers set up by different unions to record the ill health and deaths, and the Zoom call of 20,000 members of the school unions to talk about the issues that they had after lockdown. And we've seen new reps online training, lots of new reps, lots of and online training, and also, you know, it'd be remiss of me not to mention some of the community groups that have been acting, like the parents of school children, the people before profit, the students that were campaigning on the campuses, the Zero COVID campaign, and the long COVID groups. We have to enforce all our nation's governments to follow a zero COVID strategy to reduce the risk, the spread of the virus to a negligible number. We can't wait for the vaccine for this to happen. And then only alongside a publicly owned, locally resourced, find, test, track, trace, isolate and support system, we need COVID-safe workplaces only open if they're fully controlling the risks and certified as being safe, with proper controls in place to ensure that we quarantine people coming into our islands. So I wish to end with, when this is all over, but our new reality is that for many people it isn't all over. Many thousands are being left with chronic ill health. Many thousands have loved ones who have died, and many are left with trauma and scars that may never heal. But this pandemic, above all else, has shown that unity is strength, and we need to organise and act collectively to achieve decent jobs with a real living wage and secure employment, and a system of health and safety that takes a precautionary and preventative approach, and one that is proactive and participative. For the betterment of society, we need decent jobs, decent lives, and a health and safety system fit for all workers. And I end by remembering all those people, and especially those workers who have died unnecessarily because their employers didn't control the risks, the enforcement authorities didn't ensure workers' safety, and the government continues to be negligent in eliminating the virus. We will remember with heartache our dead, but we will continue to fight like hell for the living. Thank you.
Janet, thank you so much. That was really, really interesting. I deeply appreciate it. Just to let you know, some of the people who are facilitating actually come out of the control room and said, wow, that was some speech. So you touched a lot of people there, Janet. Your one thing jumped out at me: prioritise high-risk workplaces. I discovered yesterday in meeting with senior management that the Department of Healths in the various countries have significant data telling where they perceive, I know it's sometimes difficult, but where the percentage of workers are, or where the high risks are, but they haven't yet published that. And there'll be some very interesting outcomes from that, in terms of the what they've decided to impose upon us versus what maybe could have worked or couldn't have worked better. So I really, really thank you for that speech. I'm going to open that presentation. Just before I do open to the floor, folks, the slides from this session, and I know there are some fascinating slides, and thank you again for that, Janet. I need another wee way to look through some of them. They were intriguing. And the slides from the presentation in terms of the legal aspects will be shared with participants initially, and then will be subsequently shared to the greater membership and on our website and stuff. So I'm going to open the floor to questions for Janet, from anybody that has them. And the first question is coming from Tanya Killen, General Council Member. Can you hear me, Tanya? Okay.
Can you hear me now? Okay, yeah.
I can hear you. Can you hear Janet?
Yes.
Yes, yeah. Tanya.
Janet, thank you very much for your presentation. I have to say, I thoroughly enjoyed it, and it just hit so many chords. I work in the health service, so I do, and I suppose, governments worldwide, they've spun this different version of it. We're all in it together, but in reality, we're not all in it together. Those on the front line, those that, are fighting this here are not in the same position as our ministers and the government. So they're not, and that shows without a doubt, really, and what the pandemic has shown is just the inability of our governments to deal with the pandemic, as the working class, you know, the poor, the vulnerable worldwide all die, you know, in greater numbers, you know, due to overcrowding, unsafe workplaces, inadequate PPE. I mean, and the barbarity just of the inequalities of the capitalism has been laid bare, really. Like, you know, it's been clear that it's the working class who will be paying the price for the COVID crisis. So it is that is fundamentally down to capitalism. You know, the capitalist politicians, every one of them, you know, have proved time and time again that they're here to serve the interests of the rich and the multinationals, and not at the working class. We are, like, you know, 9 months on from the start of the pandemic. You know, health and safety has been a major issue across public services, but certainly within the health service. Everybody is aware of the crises within the care homes, you know, within the hospitals, you know, I think that, I mean, for certainly us on the front line, is that what it has proven is that the regulations, the guidance, it's all been too little and too late. So it has, you know, where people are out, they're on the front line, they're fighting for people's lives, and they're fighting for their own livelihoods now. Like, you know, they, again, frontline workers, right across all sections, they are sorry, at the front, you know, I mean, they are the ones that are putting their lives at risk. So they are, I mean, just a point you made, this is a class war, it's without a doubt. So it is, you know, and trade unions can and do make a difference, really. It's the government, it's our employers that have been negligent. I have to say, on behalf, and I do apologise, I missed Owen's speech and the previous speakers because I have difficulties getting logged in here. Health and safety is a major issue that is a concern for everybody in the workplace. We have a collective responsibility, but the employers have a fundamental responsibility that they haven't been up to. I do think I just tuned into Alison's last points, just, you know, where, and I would echo just some of the points that other people have made, is that this is a seminar. My view is that this should have been a conference where we led policy in relation to this issue. I mean, I think that is fundamental. I think that is unfortunate that NIPSA didn't go to the fore and to take this, because I think it is incumbent on every trade union to be able to do that. I think going forth that our emphasis has to be different from the government's, you know, where they are back to business as normal, that we have to ensure that there's no premature let up in safety measures and guidance and standards, that alongside we need to be on the offensive in terms of defending around health and safety, defending jobs, defending terms and conditions, defending pensions. You know, it is, I mean, we have already seen that it is going to be people in the workplace that will pay for the price for COVID. As you've quite correctly stated, people have paid for their lives, you know, and within the health service, certainly we have seen already where it's gone from the claps and the great to the unsung heroes to, in the Belfast Trust, for instance, where we're now from the clapping to clamping people, like, you know, where people are being, you know, we hear now some rhetoric from management around it's staff that are bringing it into the workforce, into the workplace, whereas without the acknowledgement that it's about the conditions that people are working in. Again, Janet, I really do thank you very much for your presentation.
Tanya, thank you. Janet, do you want to make any comments on that? Tanya's very impassioned speech there.
I would just say that I've been fortunate this week to attend the United States COSH conference, so their health and safety conference, and their main speaker was saying just exactly the same as what you were saying, Tanya, is that we need to be making demands now, what we want after the pandemic, what we think, you know, what we want our health and safety system to look like, and what we want workers to work in, you know, because they've been put at risk, and we don't want that anymore. So now is the time to make those demands and to be very clear about what we want. And I think that's, you know, exactly the same the world over, really. We've got to, if we don't do that, we'll go back to worse conditions that we had before, that, you know, the conditions that made people unsafe and made people ill and have caused them to die.
And I think what struck me, Tanya, from your input was the collective responsibility, and I think we are going to have to build on that, and that includes communities, includes trade unions, includes all the active groups that we do currently work alongside and do, and have had some very important campaigns and some very important wins, but there are a lot more to come. I'm opening the floor now to other speakers. Anybody else have a question for Janet? Helena McShane, Helena, General Counsel. Can you hear me, Helena? Then there's that momentary pause. All right, coming now, Helena. You walk away and speak to Janet. Thank you.
Hello, Janice. My question is that at the moment we have PHA guidance that all workforces seem to be tending to abide by. I don't accept that we, a trade union or management of any area within the public sector or any private sector area, that they should be using this as the end of all. For example, I work in education, and we have had problems with our transport sections and within our school where there's not sufficient space between pupils and staff. We've argued and successfully argued now with our employer education authority that PH guidance is not enough, on the factor that transport staff we're in a unique situation that if you're an EA transport service, your children in that bus didn't have to wear a face mask. But if you belong to the private sector, as in, the Ulster bus, which is one of our big transport areas, that children of a certain age did have to wear a face mask. So we've made that argument, and it took a while to do it. But at what risk? At this moment in time, we don't have any results of what the long-term effect of COVID is. And I think also COVID is, in Northern Ireland, we do have a high percentage of suicides, unfortunately. We have a high percentage of sickness, unfortunately, again, but it is linked back, and studies have proven that it is linked back to our past of the troubles that we've had in Northern Ireland. And I think COVID, long-term, will have a similar effect on it. And I would like your point of view on the guidance from the PHA and the long-term effect on COVID. Thank you very much.
Thanks very much, Francis. Janet, do you just want to walk away, Janet?
Yeah, I'll just say that we've for all the time that the guidance has been out, we've been condemning it, if you like, in terms of it not meeting health and safety law. In fact, there is overriders in the guidance that say health and safety law is prevalent now. Is what you should be following, and it overrides guidance. But our employers have taken the word of the guidance in schools, in universities, in all different workplaces, and in construction, as being what they need to meet, and it doesn't meet health and safety law, in our opinion. Our employers have got a legal responsibility, a duty to assess the risks and to control them, and they're not doing that, because we know that people transmit the virus. People that transmit the virus, so anybody can be infected. You don't know who's infected. They may have symptoms or no symptoms. They can be pre-symptomatic. They can be asymptomatic. They can. It's transmitted by direct contact, by indirect contact, by droplets, and by aerosols. And what our employers are not doing is controlling the aerosol transmission. Some of our employers are controlling droplets and direct contacts. They're doing extra cleaning. Some of them are put in place 2 meters distancing. 2 meters is not enough when it's an aerosol. It's a guide. It was a guide for test and trace, if you like, but it's a guide, and they need to put in all sorts of things in place. So, the requirement by the law is that they assess the risks and they control those risks, and they control it through a control hierarchy approach. So first of all, is the risk there? Yes. Can the job stop? If it can't stop, can it be done in a different way? So can you isolate people? Can you replace face-to-face teaching with online teaching? That sort of thing that you should be looking at. And if that can't happen, then the next one down, that's how do you isolate the worker from the risk? And you could do it by putting them in a separate room, a different room, if you like. And then you look at controls, engineering controls, administrative controls. So things like perspex screens, maybe, you know, on the buses, what they've done is sealed off the driver to the risk. And then, you know, and other things like 2 metre distancing, like one-way corridors, like stopping sort of some of the touch points in our workplaces, introducing shift working, less people in the workplaces for less time, putting signage up, that sort of thing. And then finally, the final level of control, if there's still a residual risk of contracting the virus, then it's got to be PPE. So that's the last thing you look at, because you're looking at all the collective restrictions first, the collective controls first. And PPE is the last line of defence, and it has to be at a precautionary level of precautionary standard. And it was wrong that they stopped, that they didn't look at that. And the way that they put school staff at risk has been negligent in our eyes. And it should never have happened, because, you know, we know that children might not get as ill from the virus, but they can still infect other people. So we know that you know, that all these things, there's evidence from all different countries. We're not first in the pandemic, so there were other evidence that came through before us. We've got to hold them to account. So, I mean, we hold our employers to account. We make sure that they've got proper risk assessments in place, and they show us the risk assessments, and we record everything, because we know that the health and safety executives are under-resourced, under not enough people. So we need to provide that evidence to them. So what have we got? The records of who's been infected and where they're being infected and how they're being infected. And then present our enforcement bodies with that information if people become infected in the workplace. And there should be risk assessing actually from where you leave home to where you're going to work. It should be the whole situation that's risk assessed and controlled, and how we can help control it. And if our enforcement bodies are not taking up their duties, are not reacting and not supporting workers in that situation, then we need to force them in some way. You know, perhaps we need to take legal cases, but that shouldn't be the first thing we look at. The first thing we look at is to tell our employers that they have a duty to protect us. They have a duty to carry out a suitable and sufficient risk assessment to control the risks, and put the onus back on the employers to control those risks. Hopefully that helps.
Thank you, Janet.
Oh, sorry, what I didn't mention was the long COVID.
Long COVID.
Do you mind? Yeah, just to say that there's lots of evidence now. In fact, there's about 400 doctors who've had COVID, right? Who've set up these groups, and they are looking at all the symptoms or the long-term impact of it. And so that's really unusual. You know, they've not had that situation. I don't know whether they're in contact with each other in that situation. So there's really good evidence that there's going to be long-term ill health effects of it. We know now that are going to be people with disabilities as a result of it. And so we should be ensuring that they've got reasonable adjustments put in place. I don't know if your unions have got, some unions have got disability passports, reasonable adjustment passport. We should be working with our employers now to put protections in place of those people who've suffered from suffering from long COVID, or the effects of COVID, which are numerous. You know, it's a multi effect on our organ effect on our bodies that needs to be that's going to have to be looked at. You know, and it'll have a massive impact in our workplaces. And what we don't want is our employers to start sacking people because they've had it. We want to make sure that we've got proper reasonable adjustments in place to keep people in work who've had COVID.
Thank you, Janet. And Helena, keep up the good work in terms of challenging. I think the big significant message I got, and I'm sure others got out of that, was the legislation far outweighs the PHA guidelines. And I think we need to maybe elaborate a wee bit more on that. If you wouldn't mind, Janet, I'm going to bring in a couple of speakers, but if you would think about, because maybe others know, but it's slightly new to me, the disability passport. I wouldn't mind hearing a wee bit more about that and how that might work, because I'm not sure we've discussed it before or had it here. So, have you, Helena, I was just going to say, do you want to come back in?
It's the factor that within education, within the sector that NIPSA organises, is for the support staff, and our support staff have some kind of cloak because it's not possible for them to stay 2 meters away as our teaching colleagues can do. So it's the injustice that's happening. I feel personally that our school-based staff are aligned to what has happened, maybe not in the same extent, and hopefully not in the same extent as what happened to the residential homes. You know, that hasn't been looked at. And yes, we're quite well aware of the guidance on, you know, what the legacy is, the legal end of it is, but it's trying to get management side to
of course not.
Guidance and using the legal end of it, but it's a real force going forward on that there. And then the long-term COVID effect, like I've got one member already, she's had COVID in end of March, and the long-term effect in her hair is now falling out some months afterwards, and that is all linked to long-term COVID. So that's an issue for her going into an education workforce where, unfortunately, our dear beloved little kids can be quite cruel at times when they see somebody's hair falling out. But it's all of those things, and I think Janet's made some good points. And again, I was on the picket lines this morning in Derry, and I want to send solidarity from the rest of my branch who couldn't make it because they're on this call. And we were very adhered to the health and safety while we're on COVID picket lines this morning too. So congratulations to all those 4 unions.
You did steward that well, Helena. Thank you. Can I bring in Eamon Doherty, General Council member, please? Eamon, can you hear me?
Yes, Brian, I can hear you.
Good man, I can hear you. Work away. Speak directly to Janet, Eamon. Thank you.
Thank you, Brian. Janet, I'd like to thank you for your presentation. Very much appreciate it. The main thing that had home much and I hope I haven't picked you up, was the lack of proper engagement from our individual islands, health and safety executives and public health agencies. Your explanation of the reason why, and again, I don't want to misquote you, was their fear of privatisation. And that very much strikes a chord with me. I believe it's imperative going forward, therefore, that we insist that trade union representatives become an integral part of such bodies. I believe such bodies have a duty to protect workers, and they've been negligent in doing so far during COVID. They prefer to buy into the government line for fear of privatisation, and that must end. Internal reviews of such bodies must be carried out post-COVID, and a new dispensation for such bodies granted. Thank you, Janet.
Janet, do you want to come back on that? Janet, do you want to come back on that? I can see you nodding there and agreeing.
Sorry, I muted myself then. Right. Just to say that, I mean, I think that is a real fear for the HSE, for Health and Safety Executive. We know that they've already done that. They've done the local authorities have put out, you know, they've just been starved of resources, and they have these. Oh gosh, I'm forgetting the term now. Where they can choose, where businesses can choose which local authority then is going to is going to control the risks. Is going to do the risks. You know, is going to manage the risks of those businesses. And you know, business up in well, I mean, one in the Wirral in Liverpool is being their local authorities across in Manchester. You know, so they're not an understanding of what the risks are in that business because it's a chemical business. And being, you know, they're being enforced by somebody else, by partially enforced by a local authority away across in Manchester. But I do think, you know, we were really concerned at the beginning. You know, you'd thought at the beginning of a health and safety pandemic like this that there would have been up on the rostrums would have been health and safety executive alongside, you know, the health, the doctors, you know, the health. People and Public Health England, because you know we could see that was going to be a major source of transmission was workplaces, and they weren't. And we've kept looking at seeing what they were doing and why they were doing, and we know that the call centre is the privatised call centre. They're doing spot checks with private offices now. And you could see that that's the way that they want to go. They want to privatise the whole system, you know, which is about enforcement of regulation, and would be a nonsense that if it was privatised. So we have to fight, I think, like mad to make sure that that doesn't get privatised or put in the public, put in private hands. So none of us will be safe, and we're not safe now, but we certainly won't be safe in the future.
Thanks, Eamon, for that. You want to come back on anything, or thanks for your input? And I think collectively we do need to have that challenge, and we do need to become involved with the campaign. I think it's beyond a joke. Our health and safety executive has been non-existent, to say the least. Are you coming in, Eamon?
No, thanks. No, that's me.
Thank you. Thanks for that response, Janet. Can I ask then John McKeegan, General Council member, to come in? John, can you hear me?
Thanks, Brian.
There you go.
Mr. President, a bit slow there at getting reconnected again. Part and parcel of this different IT world that we're working in. Thanks to Janet there for her presentation. It's indeed very interesting. I have it's a health and safety question and from a legal context. If employers aren't listening, are workers exercising their right to stop work and leave their work area without being disciplined if they have reasonable concerns about their health and safety? Now, people working in the health sector and providing service to other workers and to the population, there'll certainly be emotional demands and attachments to provide their service, but they do have the right, if they believe that their work is unsafe and potentially can cause them harm, they have the right to step back and be represented by their unions or by the legal profession. So it's possibly a way of challenging poor practices. And can also congratulate Peter there and his fellow strikers down there in Newry and Mourne. Well done.
Thank you, John, for that. Janet, I'm not sure if you want to take it, or we may defer to the legal section this afternoon. It's entirely up to you.
Well, I would just say that, you know, we've got a right to remove ourselves individually if there's a serious and imminent danger. That's section 44 and section 100 of the Employment Rights Act. And when we're not advising people to do it because it's an individual right, and that means that you could be sacked for it. Now you can go to tribunal and win your tribunal, but that could be months down the line. So, I mean, our preference would be to take collective action, you know, to join with everybody else and make sure you've got collective action. But workers are using section 144 and winning in workplaces, putting pressure on the employers and winning those cases. The Health and Safety at Work Act says that our employers should have in place a serious and imminent danger procedure. So we should be asking our employers for that now, so that we know what we need to do if they feel that they're being put at risk, and use the Health and Safety at Work Act. It's there for us to use, you know, so let's use it. And then, you know, absolutely, if you are in serious and imminent danger, then you've got the right to withdraw your labour to keep yourself safe, and then to go, you know, depends what your employer does, if they sacked you for it, then to go and to go to tribunal on health and safety grounds. But speak to the lawyers later.
Thanks very much, Janet. And I can see John thinking it'd be great if we went to the tribunal and you were one of the lay reps. John, are you happy enough for that?
Yes. Thanks very much, John.
Okay.
But people need to be responsible as well for their personal health and safety, and sometimes those actions have to be taken to the employer. Make the employer take positive action to improve the conditions of work in the workplace. So thanks for that, President. Thank you.
Thank you.
Thanks,
can I call on Brenton O'Reilly, DFC Northern Ireland, to come in? Brenton, can you hear me?
And here we go.
Got you now, Brenton. You work away. Janet's listening.
Yeah, I think so. Yeah. Thank you very much, Janet. Yeah. So firstly, what has been mentioned earlier, that the PHA guidance has been taken as the be all and end all, and that is the case in our workplace. The management are just basically effectively hiding behind the very basics that the PHA are saying they need to do. So how do we? So the question is basically, how do we effectively challenge that PHA guidance as the be all and end all, and argue that point with management that is purely just the very basics, and that they should be going above and beyond that. Another point as well is regarding the long COVID, the lasting effects of the COVID. Although staff in the civil service anyway aren't being taken through the disciplinary process for management attendance process for COVID absences, but the lasting effects of it are being ignored on that point, and staff are being basically coerced back into work with the threat of the disciplinary action because of the lasting effects of the COVID. Thank you.
You want to answer that, Janet? Do you want to come back?
Yes, please. Yeah, thank you very much for that question. And I think, on the public health guidance, as I said before, it's not good enough. It's not meeting the legislation, and health and safety law is about preventing workplace injuries and illnesses and deaths, isn't it? That's what it's about. And if we don't think that's meeting it, we should challenge it, and we need to challenge it by putting our employers under notice that they're not meeting that legislation, they're not meeting the rights, and the consequences of that are that they could be prosecuted for it. And perhaps we need to be spelling out a bit more about, the sorts of prosecutions that employers can have served on them if they don't protect people. But this is a strange world that we're living in, and I think it's going to take a lot more than just us saying these things and trying to force our employers. And it's going to take collective action by trade unions. It's going to take, collective action by our whole communities, because they have, as a result of what they've done, is put our communities at risk, our families at risk, not just the workers in their workplaces at risk. And employers' duties are not just about the employees, they're about anybody that comes into contact with that workplace, and they've got a duty to the members of the public as well. So we have to find a way to force them to comply with the legislation. And just going back on the long COVID situation, what we know as well with the long COVID is lots of people weren't tested and didn't at the beginning, so they were made very ill, weren't taken into hospital, weren't treated properly by doctors, and they weren't tested. So to have that, they're not going to have the evidence that they had COVID, and that's left them with all these conditions. Now that might affect things like so legal redress and compensation, and we need to think about that, because you'll need to have some good records in our workplaces as to who's got it and when they've got it and that sort of thing, to help those individuals in the future. And then just come back on the disability passport. So unions have been trying to find ways to stop employers where you get a new manager and they come in and they want to renegotiate what your reasonable adjustments were, or you move jobs within your workplace, and again that your managers then querying what your reasonable adjustments are. And so this was a way of putting it down in writing. It's quite a simple solution, but putting it down in writing, agreement with the management that you have this disability passport or reasonable adjustments passport, as called in different organisations, and then that's negotiated probably with HR or occupational health as to what reasonable adjustments need to be made, what support needs to be put in place, and then that goes with that person all the way through that workplace, and it's reviewed regularly and to make sure that it's still keeping up with conditions, or if there's anything else need to be improved. And I think it's a really good, it takes a lot of pressure off workers, I think, in those situations. I think the things like government workers are going to, lots of these workplaces where before the pandemic we're really using draconian methods to get people out of workplaces, are going to use the pandemic and the symptoms and the conditions of people with long COVID to get rid of those people again. And that's got to be a political there's got to be a political side to this as well, because what that's going to mean is that thousands more workers are going to be put out of work as a result of contracting the pandemic, that lots of them got because the governments, the employers, didn't control the risks. And so we've got to find a way of getting that narrative out into the communities and into society, and start challenging them on that.
Thank you, Janet. Brenton, are you content? Are you coming back in?
No, that's great. Thank you very much, Janet.
Thank you. Thanks, Janet. Can I call now Marty McKee, General Council member? Marty, can you hear me?
Can you hear me, Brian?
Yep, perfect, Marty. Work away.
I want to stay on there for a change. Unfortunately, speaking of the doc and Brendan, a lot of what I want to say has already been said. But Doc articulated in a lot of manner the dichotomy of the dynamic of the HSE and the PHA and the difficulty we have with them, and it will largely been denuded of all power and authority, and in the main have been marginalised by our executive. As you well know, our executive chose frequently to ignore medical advice in the lead up to lockdown. So my question would have been, how can we as trade unionists help to empower and strengthen and make more relevant these bodies such as the HSE and the PHA in the face of this vocal opposition from our politicians and management edgelords, and how do we strengthen their advice so it has more legal teeth?
Great question, Marty. Thank you. Janet, over to yourself.
We've got a fight on the hands of public health, haven't we? Because they're privatising that, and so we need to be objecting to that and stopping that happening. Because the role of public health should be that independent source of advice and, the thing that sort of forces and ensures our health of our country, of our nation, of our nations, and of our people. And if they privatise that, that's certainly not going to happen. It's not going to have that independence. It's not going to be able to challenge government, challenge employers with anything if it's privatised, I don't think. And then health and safety executive, I think, this is a long time coming, what's happened with health and safety executives. And read the manifesto that we've put out, because it's a whole change that needs to happen to put health and safety executive right. We need to get rid of privatised services out of it. We need to put proper resources into it, keep that independence, take politicians out of the boards of it, because it's become a political animal as well now, with ex-Conservative MPs on the board of it. And it needs to have, again, that independence. It needs to be able to have, which would make it stronger, it would be far more supportive of workers and ensuring workplaces are safer. So there's a few things I think that we need to do, and there's certainly a lot of campaigning that needs to happen, and it's not going to happen in the short term. But we need to be vocal and start to put an alternative narrative out there about what we need to protect workers, protect people in the workplace.
That's great. Marty, you happy enough for that?
Happy enough, Brian, thanks.
Thank you, Janet. That's very helpful. Any more speakers? Lucia, General Counsel, can you hear me, Lucia? Yep. Work away, Lucia.
Hello, thank you very much, Brian, for letting me in again. Janet, thank you for that. Very informative, and I think you hit the nail on the head that we have to have a political and an industrial response, not just political but industrial. I mean, we can take the legal cases down the line, but as you say, the tribunal system is what it is. You have your 3 months, and if you're fighting your hands to get management to accept any liability, all of that there. So you're going at this point to inform everybody. And this morning already we have a wealth of information, a wealth of it. We've had Owen on with the task force stuff and the no going back stuff, and all of this work that Hazards have done, and all the work that the health and safety committees and unions have done so far. And I think if we keep talking to each other and inform each other and get more sessions like this, we through Zoom since March have made a new way of communicating, and we have to continue to do that going forward. The government have their agenda, the Assembly have their agenda. Every stage of this destruction has been noted by us and been commented on by us. So we know as much, if not more, as what governments and the Assembly and all are doing, and we know what they're doing, and we know what it's all about. So we need to bring the political and the industrial issues all together positively and constructively, and not let the dilution of power, not let that authority, the information we have be diluted. Local health and safety has worked for the most part in some places, other places it hasn't. But the Whitley structures that we have in the trade unions must be fully protected. Yes, managements, some places they haven't engaged, some places they have. We've got some piecemeal places working in silos. Bring it all together. Bring it all together now. Communicate UK-wide, Scotland, Northern Ireland, England, and your wealth of experience, Janet, is just brought a new dimension I can see for us going forward, and thank you so much for that.
Thank you, Lucia. Janet, over to you.
Yeah, thank you, Lucia. That's fantastic. And I think one of the things that we saw through the pandemic, what we've seen through the pandemic, as disappointed as really, because we know in Scotland there was a different relationship, you know, with the health and safety executives, and they had the committees up there, the FAS committee up there in Northern Ireland. I mean, Northern Ireland put out a press release straight away, the HSE, saying, tell us if your employers are not protecting us. And that was really good. You know, that it was inspiring for us, because there was nothing going on like that in England. But then that didn't keep up with what was going on. You know, it failed. And really, I would expected, you know, Scotland and Northern Ireland would have been fantastic examples of how we could work together, and how, you know, how we should have worked together, and how we could make a difference. So there's a lot to do, and I think absolutely right, communicating and keeping that relationships going. Health and safety's had and PPE, nobody's mentioned PPE before, did they? Nobody knew what it meant. But it's, you know, it's on the agenda now. So we've got to keep up that impetus now and make sure that we get proper rights, that, you know, and proper protections, and that, you know, we continue to talk and we continue to learn off each other, because it's been a learning experience for us as much as anybody else. So yeah, thank you for that.
Thank you, Janet, and just the mental health issues too. I mean, the funding is absolutely ridiculous and has disadvantaged so many people, and I just know we'll be talking about that later on. But also, it's a big issue for yourselves in terms of the mood of people now and how people are feeling. I mean, my whole estate. I would say the depression and the medication that my friends and that my neighbours are on has rocketed, and no mental health funding. So, I mean, we'll be talking about that later, but it's...
Lucia, you've muted yourself. Lucia, you've muted yourself. You got the no mental health funding, and then...
Sorry, I'm sorry. Look, I'll just finish off by saying that the mental health funding is so important to us all. I have friends and neighbours in trouble now at this time, and the mental health funding, Northern Ireland's the worst, but all of UK is bad. So it's a big job for yourselves to how to help people going forward, because it's going to be awful. It's just going to be awful. Thank you, Janet.
I think you've hit the nail on the head there, Lucy, in terms of the mental health and the funding, the lack of resources, waiting list, the hidden waiting list. We talk about the operations, but from a mental health perspective, it's particularly difficult. Can I call Carmel Gates, Carmel, headquarters official? Do you hear me, Carmel? There's always this delay and you don't know if we've lost. Carmel? No?
Sorry, Brian.
Oh,
sorry,
there you are.
just the buttons are a wee bit different than you in this kind of setting, so apologies that
right, okay.
You couldn't hear me.
Away.
Yeah, just I suppose really quickly before lunch, and thanks for giving me an opportunity to speak. I do, I mean, I think Janet very clearly laid out how this is these are class issues, the tackling of COVID and the response to COVID. And I think one of the worst things for me is the fact that we have, sorry, just turn me. One of the worst things for me is the fact that it's for the ruling class. This is the new crash of 2008, and we know that after 2008, the ruling class and governments used the opportunity of the crash to attack workers, and that we tighten our belt and so on. And just as we were coming out of austerity, as we had been promised, and workers were getting back on their feet, and we saw the historic action taken by health service workers at the end of last year here, not across the water, but the heroic action taken by health service workers here. So workers were beginning to fight back, and were gaining the confidence to claim back some of what we had lost during the years of austerity, and the fact that we've all had a pay cut year on year for the last 10 years. And as we know, as I said, the rich were getting richer while workers were being told, no, I'm sorry, pay freezes and so on. And now here we are again, that this pandemic, to some degree, obviously it's not planned, and I'm not a conspiracy theorist, but obviously it is working very much again in the favour of the ruling class and the rich, because once more, this pandemic is going to be used, as we have seen, and Rishi Sunak has already said it, that, oh dear, as a result of the money we have spent on the pandemic, we are now going to have another pay freeze, and that workers are again going to be paying. Now, obviously, our members are public sector workforce, but we know that if you drive down public sector wages, you also drive down private sector wages. And as one of my colleagues said earlier, a rising tide lifts all the boats, but also a sinking tide lowers all the boats. And I think that this is something that we very definitely need to start fighting. We cannot accept the argument that there isn't enough money to pay for this pandemic. We cannot accept the argument that public sector workers or any workers must pay, because we still are in a position where the government have spent less on this pandemic than they spent bailing out the banks, and and everything that happened in the economy ever since. So I think from our point of view, obviously, I mean, COVID has been a very sad time for everybody. We have seen workers lose lives and so on. But I think we need to now build our resilience to this issue and how we deal with it. Colleagues have dealt with how the health and safety executive and others maybe haven't played the role they should have, that PHA is designed to ensure that workers continue to take the brunt of this pandemic. But from a bigger point of view, none of us should sit here and listen or accept the fact that we should take pay cuts as a result of COVID. None of us should feel guilty as public sector workers that we have, to some degree, security of jobs, but not all of our colleagues have, as we know from council workers and others are going to be losing jobs. So I just think we need now to change the narrative in favour of workers and working class people and say this COVID experience is not going to be what defines the next decade, that workers are not going to accept COVID as an excuse for austerity. We are not going to accept it as an excuse to attack public sector workers. We are not going to allow them to use it as an excuse to cut our pay, our terms and conditions, or any of those other issues. And I think it is important that we now set a marker. NIPSA, and as Owen Reidy has said, NIPSA has set a marker on a whole load of things. And I would now obviously want us to be setting the marker as the union that stays strident and says, We will not be standing for this. We will not allow this government, any government, our executive or any other politicians to drive down what we have fought for, and that we need to get back. If we have to get back onto picket lines to do that, then we get back onto picket lines. Thanks.
I only say 2 lines. Well.
Thanks, Carmel. Janet, do you want to make a response to that? And if you don't mind, Janet, indulging us if we go on a few minutes. I know you've an afternoon engagement. Is that okay?
Yes, certainly.
Thank you.
Just to say that, you know, the COVID-19 didn't cause an occupational health crisis. It exposed it. You know, so we've got to fight back. You know, because if we don't fight back, we're never gonna get anything. It's going to just go, as you said before, it's going to go downhill from here. And we've got to stand and fight. And I think that's, you know, absolutely right. So thank you for that.
Thanks, Janet. There's flashing lights here and going on. Thank you. I'm going to call in last speaker, and Janet, appreciate your indulgence here. We have run over the time a little, and we really appreciate it. But I think it's a measure of how people felt about your presentation and how buoyed we are. And I know we're learning lessons and hopefully getting some groundswell of opinion here that we need to step up our activities and do what the lads were doing this morning, and in order to force the workers' rights through. So Naomi Connor, a headquarters official. Naomi, without trying to restrict you, could you I'm just conscious of time, and Janet has an engagement later, and I want Alison to sum up. But can you hear me, Naomi?
Yeah, can you hear me okay, Brian? Yeah.
Perfect. Thank you. Yes, work away.
Janet, I'll be as brief as I can. I just wanted to highlight one of the kind of forgotten areas when it has come to COVID. We've heard much sort of, you know, from the government about small businesses closing and, you know, cafes and things like that. But I believe as someone who represents in this sector that the community and voluntary sector are without doubt one of the areas that have been overlooked and are coming out of this crisis are going to be in a much worse position. What I want to start by saying is that it is part and parcel of the NIPSA family and the wider trade union family as well. And I do believe that it is an area that we can organise in and that it's within our grasp to do so. But what I'm going to say is it has always been a problem in that sector, the precarious nature of funding. Funding from sort of complex funding streams, but you know, is always bound by a year, 2 year, 3 year time limits, has been exposed. But what has been done about it is precious little from a departmental point of view. So we have redundancies hitting that sector really, really hard at the minute. It's the first sector to experience. In any crisis, they experience the worst of everything, really. But as a starting point, very many of those workers have the basic minimum in terms of terms and conditions anyway. And they have the minimum statutory provision. So even when they're made redundant, you know, the payments are paltry. The notice isn't much because they're working in small organisations. Sometimes the notice is as little as days. So we have people who are frontline workers. They are frontline workers. They are part and parcel of our public sector. And we're talking about people who work in hospices, you know, cancer charities, homeless organisations, disability organisations, people working with people with addictions. And these people are being treated despicably by some of their employers. Some of their employers don't give a toss about health and safety, you know, and don't look because of the nature of the employment, don't look to improve it or even have it in the first place. And I think that's hugely problematic. But one of the things that I think we can do, many of these organisations, whilst they have complex funding streams, are funded by statutory agencies and receive funding from core departments. So as much as agency workers are protected, and they absolutely should be, some of these workers aren't even getting that basic minimum living wage. And the departments need to say, and the ministers need to say, that if they're funding an organisation and that money is being used for purposes of wages, then the people who are out on absence through shielding or COVID should receive beyond the statutory minimum that they're receiving at present. I have people, the majority of whom are on statutory sick pay, some aren't even, some are now on benefits, who have underlying health conditions, and they're visiting food banks, people who are in support worker roles. I also have people who are saying, I can't afford to shield, I have to go to work because I can't survive on on £93 a week, and who of us could. So I do think that sector is the one that has been left out of much of the discussion and has been left behind. And what I will say as well, from a disproportionate point of view, the majority of people that I'm representing, although not exclusively, but the majority, because they are in care settings, are women as well. So what I would say is women are bearing the brunt of much of this, and there's a disproportionate impact. I do think there is a responsibility on the departments to step up and say to those organisations, these people need to be paid, they need to be protected, and going forward, we need to look at how those funding streams operate, because many of these organisations, the same way small businesses have been supported and others, well, many small businesses haven't, but some of these organisations will go under and have. Thanks, Brian.
Thanks for your brevity. No,
wasn't very brief.
No, seriously. John, do you want to make any comment there?
I don't think I could say much more than that. I'm part of that sector as well, by the way, in the work that we do. So I understand totally, the impact of it. I also live in Preston, by the way. I don't know whether you've heard of the Preston model. It's an economic model that they're trying to have a look at it on the website, because they're looking at different ways of looking at local economies, and got some interesting ideas about attaching organisations to make sure that people have got living wages and to anchor institutions. But also it's about looking at the democracy. And I think, I think Owen before talked about, the economic model now, it's failed us. I think there's a chance now that we need to look at different economic models for our local areas, and that might be something that's interesting to look at. But I think back to sort of the sector you're talking about, there needed to be far more resources put in, not just money, but resources in how people could continue to work. And the government's failed us. It's failed education in not providing the resources and the staffing, and and improving their conditions. But it's failed lots of different sectors that it could have improved and allowed people to continue working safely without transmitting the virus. And I think that's a problem. And it could have been so different if we'd have had a government that was prepared to work for people and not work for profit.
Janet, thank you so much. I appreciate you indulging us for well over the time that we had planned. I know there was a number of other people were keen to ask you questions as well. I think it's a measure of your the effect that your presentation had on us, and I deeply thank you for that. I look forward to hearing from you again very soon. I know you can't stay for the rest of the day and you have other engagements, so thank you very much for everything you did for us, and we look forward to seeing you again. Just before I go to lunch, folks, I have some unfortunate news in that the Speaker for Aware Northern Ireland has had a family crisis and is unable to make the session. So we've therefore asked the legal rights, employment issues and personal injury people to come to bring that forward to 2 o'clock. But we will give a guarantee that we will look at a specific seminar, because I know quite a few people had indicated their desire to look at participate in the mental health one, and we know that the person's very keen to engage with us. So that may be top of the list for one of the 2-hour webinars that we have, where we can have a bit more a presentation and a question and answer session. So 50-minute lunch, 2 o'clock. See you back here. Janet, thank you. Good luck. And I'll see you all very soon. Thank you.
Thank you so much. Bye, everybody. Have the rest of the conference goes well. Thank you.
Welcome back, folks, to this surreal, slightly surreal situation. Today, the afternoon session, as you know, unfortunately, Aware Northern Ireland can't be here, so I'm delighted that we have, first of all, Marine Corps John McShane with his newly shaved head, which he did magnanimously for cancer. So you will all get a first glimpse at John. Many of you will know, if not all, he needs no introduction. He's on the screen behind me. You're very welcome, John. Thank you for taking the time. I look forward to your learned advice as usual. And I'll hand over to you now. Thanks.
Well, Brian, as you know, I've just come back from NAM. But I'd first like to say thank you for the kind invitation to speak this afternoon. The first thing I'm going to advise everybody is that you'll be glad to know these lecture notes are available for download on the MTB website. So that's www.mtb-law.co.uk. So you won't have to actually keep any notes of what I'm going to talk about, which is Article 68 of the Employment Rights Northern Ireland Order in 1996. Also, on that same on the web page itself, it's under the section News. You'll also see the before and after pics of myself, and also a link to Brave the Shave, which this is the result of raising money for Macmillan Cancer. And I'd like to encourage as many people as possible, if you would like to consider maybe making a donation to a well worthwhile cause. So with no further ado, what I propose to do is just give an outline in relation to Article 68 of the Employment Rights Northern Ireland Order in 1996. First, what I want to do is I want to preface this by bookending it, that it's an individual right. So this is not a collective trade union right, and that's very, very important to consider, because it's not NIPSA advising its members to maybe take this course of action. It's for NIPSA to advise their members in relation to that this is the law, but it's for an employee, a member, to consider whether this is circumstances that are applicable to them and whether they wish to rely upon the protection afforded by Article 68. First of all, Article 68 of Employment Rights Northern Ireland Order 1996 provides that employees may not be subjected to a detriment, such as disciplinary action, in certain cases relating to health and safety concerns. Now, what I do in the lecture notes, as I say, that are available for download, is I give the entire section of section 68, but the relevant subsection is actually paragraph D. Now, what I propose to do is read that in its entirety, because that is the relevant section that I'm going to more or less talk about. So it reads, subsection D, in circumstances of danger which the employee reasonably believed to be serious and imminent, and which he could not reasonably have expected to avert, he left or proposed to leave, or, in brackets, while the danger persisted, close brackets, refused to return to his place of work or any dangerous part of his place of work. So that's the pertinent section, but you'll note the relevant section that I want to underline is the employee reasonably believed. Now then, the next subsection of Article 68 is the section 4. Section 4 reads, this article does not apply where the detriment in question amounts to a dismissal. Now, normal reading of that would mean that effectively an unfair dismissal arising in these circumstances under that subsection you wouldn't be able to pursue. But while you read the rest of the Act, what you then read is Article 132. So while subsection 4 specifically states that Article 68 does not apply to cases where an employee is dismissed, Article 132 of the same 1996 order provides that an employee who is dismissed for acting upon health and safety concerns in a manner consistent with Article 68 will be considered to be unfairly dismissed. So whilst the first reading of Article 68 reads that your only protection is to detriment but excludes unfair dismissal, the Act does encompass the ability to pursue unfair dismissal in circumstances where you're dismissed for leaving the place of employment because of a health and safety concern. Now, proceeding on, Article 68 1D, which you'll recall is the subsection within the Act that I read out, reads that an employee who believes themselves to be in serious and imminent danger may leave the workplace or refuse to return to it. The employee's belief in that danger must be both reasonable and genuine. It must therefore be an honestly held belief reached after due consideration by the employee of all relevant information. Now, the normal scenario would be then what is meant by, for example, the meaning of the word danger. In the notes, what I do then is I deal with the specific piece, the specific case law that deals with what is meant by danger. It's a case called Harvest Press Limited v. McCaffrey, and I give the full citation in the lecture notes. The EAT, which is the Employment Appeals Tribunal, held that Parliament was likely to have intended these words to cover any danger, however originating. So the normal reading of that would be to encompass what is the current circumstances of the global pandemic of COVID-19. So therefore, it's a reasonable belief that your health and safety is at imminent danger. Given that a belief in the existence of a danger must be genuine, members should consider online advice from reputable sources about COVID-19. Now, this is the matter that is very, very pertinent to understand and accept. It is a matter for individual members to make their own decision as to what they decide to do. So it is not a scenario where effectively you can induce members to potentially think about breaching their terms and conditions of contract, to remove themselves from the workplace, which would otherwise amount to unofficial industrial action or refusal of a reasonable work instruction or leaving the workplace without proper authorization. It has to be for that individual to make that choice. It is a matter for individual members to make their own decision as to what they decide to do. If any member decides they're not returning to the normal work because it is dangerous, they should, and this is the advice I want to again underline, they should, of course, let management know why they're not returning. They may wish to record the reasons in a letter to management. They should also make themselves available to carry out other work in the workplace that they don't consider to be dangerous. That's because what I'm suggesting is that you want to ensure there's a causal link to the rationale by which you're leaving that workplace. And the best method of having that evidence is to have contemporaneous evidence as to why you made that decision. So recording your rationale with management, but equally not appearing to be unreasonable in refusing alternative work that may be available for you to do, but for the circumstances that you believe the work that you're removing yourself from has a specific nature that you consider it dangerous. Therefore, moving on, if any member is subject to disciplinary action, any other detriment, such as a loss of pay or dismissal, they may bring industrial tribunal proceedings. And that's what Article 68 is all about. It's about you being treated in a detrimental manner because what you've done is you've refused to go to the workplace because of the risk of danger that you believe you're exposed to. In effect, potentially COVID-19. The tribunal would need to decide then if the employee's decision that that work was dangerous was a reasonable belief and one that was genuinely held. As I then stated before, that's why it's very important that what you have is the contemporaneous evidence as to why you refused to go to work or effectively left your place of work. It is very important to have the evidence at the time so the tribunal can consider your reasonable and genuine belief as to the basis upon which you left or choose not to attend your workplace. Now, the one thing I would want to do is to preface this by effectively a kind of warning. There's no precedence in this area. There's no established case law in this area. Essentially, what will be going through the tribunal process, both here and in England, are cases that are testing the extent that this protection arises and covers. That's why there's no way that I can effectively give some guidance as to what may or may not be genuine and reasonable belief. But it is a situation where I am entitled, as is your union, to clearly outline what the law is and what the protections the law affords to you. This is the only, as I can see, a genuine basis to assert that while you're not attending the workplace, it gives you some protection in relation to either detriment or being dismissed because you're absent from the workplace. Now, at the start of this lecture, what I tried to explain is that it's an individual right. And I believe what I want to do is reinforce that. This is not a situation where it can be an inducement by a trade union. It is not a collective trade union right. It is an individual choice that members can be advised in respect of their individual protections under the law, being Article 98. But then it is a matter for that individual to satisfy themselves that they had a reasonable and genuine belief that they informed the basis for their either absenting themselves from work or effectively leaving the place of work. Now, that is clearly established in the case law. And what my notes go on to do is give that citation, which is the Secretary of State for Justice via the Prison Officers Association. that was in circumstances where the Prison Officers Association essentially has a ban on it in relation to inducing strike action. They sought to sidestep that prohibition by effectively relying upon what Article 68 states, in effect believing that it's a collective right that their members could then refuse to go to the workplace. But that was effectively determined to be unlawful by the High Court in England. And what I've done is I've given the full citation again, because it is extremely important that it's very clearly understood by all listeners that this is an individual right, not a collective right. It is a matter for individual choice, following due consideration of their own circumstances and consideration of any sources of information in relation to, for example, the potential risks of COVID-19. Now, what I want to do is then read out that full citation from the case law, which is Article 68 has nothing to do with inducements to take industrial action. It does not confer any protection on trade unions. Rather, Article 68(1)(d) grants protection to employees against suffering detriments for leaving the place of work and or refusing to return to work in the face of a reasonable belief on the part of the employee that he is in serious and imminent danger which he cannot reasonably have expected to avert. So that effectively is an overview of Article 68 of the Employment Rights Northern Ireland Order in 1996. I hope that is of some assistance to people who are listening to myself. As I say, the article is available for download from the MTV website, and as well as after laughing at the fixtures before and after of me with her and without her, I would encourage you, if you could, to have some consideration as to making a contribution towards Macmillan Cancer, and the link is on the website. So again, the link is www.mtb-law.co.uk. You go to the news section of the website and you will see two recent articles, basically this lecture outline, and the other bit is the Brave the Shave, which I magnanimously and selflessly and idiotically did last Friday. Thank you very much, Brian, and I trust that is of some assistance. And at this point, I would like to hand over to my colleague, Mr. Viv Harty.
That's brilliant, John. Thank you. You were very concise and you were very clear. I'm just not sure we understood the bit about the Brave the Shave bit. Maybe people did pick that up, but it was a bit vague. Thank you. Viv, yeah, I can't hear you talking anymore. I can see you on the screen up here. Viv Harty. Oh, you're swapping seats. I hope you are dusting things down and doing all the COVID rules that you're supposed to. Some of you may not have had the pleasure of meeting this gentleman. This is Viv Harty, Senior Partner in McCartan Turkington Breen. Viv, we're very grateful for you giving up your time and coming to chat to us today about the personal injury, and I think the two collectively may form some of the questions and the discussion that we have. So without further ado, I'll hand over to you, Viv, and look forward to hearing from you.
Brian, thanks very much for asking us to come along and speak to the conference, and thanks to the General Council and the membership. As you said at the start, it is highly surreal. This is the first NIPSA conference that I've been at where you don't get three days, 3 nights accommodation, sleep honoured, top class dining, free lunches, and a bit of golf for bumper game. But we're pretty adaptable in these circumstances. So the area that I have been asked to speak upon is personal injury cases and the effect that perhaps the COVID and the pandemic has had on that area of law. I've broken it down into 4 headings. There is the common, the personal injury case, and we hear this expression all the time on the television about duty of care. There is what's known as a common law duty of care. The common law is the law that has been developed and formulated by the judges over the last 500, 600, 700, 800 years. And essentially, the law says that insofar as we're concerned, that an employer owes an employee a duty of care. It's a duty of care to take. It's a duty to take reasonable care in all the circumstances, and that common law has then been fortified, if you like, by various statutory enactments over the last 150 years, going back to when it was made illegal to send young children up chimneys and whatever. and Factories Acts in the middle of the 19th century, where workers began to be granted protection, albeit very flimsy at that particular time. And it's come all the way up until today, when, particularly over the last 50 years, due to a lot of European legislation, workers have got a lot of protection, particularly in an office type environment and a clerical type environment, where a lot of protection wouldn't have formally been given, when our society tended to look towards factory type environments where this type of protection would have been paramount. Now, there's oodles and oodles and oodles of acts of parliament and statutory instruments, etc. But the ones that we would be concerned about with are what we would call colloquially the six-pack regulations. In particular, Regulation 3 of the Management of Health and Safety at Work Regulations, Northern Ireland 1999, which basically is a very interesting one from my perspective, and has been over the last 20 years, because it requires an employer in any given set of circumstances to carry out a risk assessment. So, if any potentially dangerous situations arise and an employee injures himself, one of the things that we're looking for, has the employer bothered carrying out a risk assessment? Invariably, sadly, the answer is usually no. But obviously, in this particular type of environment, with the COVID and the pandemic, I'll return to that as to how it would have been appropriate to carry out risk assessments in due course. And then we have Regulation 4 of the Provision and Use of Work Equipment Regulations, Northern Ireland 1999. Which is one of the limbs of that, is that an employer is under statutory duty to ensure that proper equipment and safety measures are taken in the workplace, and that's obviously very important for the purposes of today. We have been working on a number of cases for members of NIPSA and other workers within the health sector, working for the various trusts, where perhaps, and we're talking about a pretty narrow window here, maybe about the beginning of March 2020 until about the beginning of May 2020, when for instance there was little or no PPE available. And it didn't just apply to people working in a clinical or a hospital setting, but also applied to people who are working in clerical settings in various hospitals and health trust sites. And we've seen that there was little or no regard was taken, and little or no risk assessments were carried out in a number of the cases that we've come across. And that is one area of law that we're looking at the moment, and that we're currently working on, and that we currently have cases. But perhaps one of the more interesting and probably the most prevalent and relevant to NIPSA and its membership is the protections and the potential for bringing person injury claims, perhaps, are enforcing employment law rights for those people who are working from home. Because in this firm as well, we have we were all working from home, and now we have a sort of a blended or mixed solution where about half or more of our staff are working from home and come in a day here and a day there to print documents out. But what duties are imposed upon an employer in respect of its staff who are working from home? And we would argue very strongly that the workplace is now the home, whether it's the kitchen table or the bedroom or the living room. These are all now workplaces, and all these regulations that I've been talking about, and many more, also apply to the home environment, which is now a workplace within the meaning of the legislation. The same duty of care applies to the situation. The employer owes a duty to its employees to take reasonable care in all the circumstances. A number of the things that an employer should be doing, and I guarantee you a lot of them perhaps haven't done it. They should, clear sets of instructions should be issued to staff. Proper risk assessment should be carried out. Whether or not that involves people coming out to every individual employee's house and carrying out a risk assessment of a particular workstation is moot, and I'm not entirely sure that wouldn't necessarily be reasonable in the circumstances. But one of the things that especially now that we're 8 or 9 months into the pandemic and 8 or 9 months into people working from home, one of the aspects that the employers should certainly be looking at is is the workstations. Are the workstations safe? Are they adequate? Way back 25, 30 years ago, I was involved in many, many cases for NIPSA members in what were called repetitive strain injury cases, where people didn't have properly adjusted chairs, didn't have proper desks, ergonomically their workstation was a dangerous place to be. That might sound quite bizarre, but I'm sure some of your members and some of your colleagues perhaps are struggling in that regard. It would be interesting to know what the employers have done, because I haven't had any feedback on that. It'd be interesting to know what the public sector employers have done about that over the last 8 or 9 months, now that they've had a lot of the warnings are up and they've had a period of time to work their way into it. I would think that a court would hold, for instance, that it was incumbent upon those employers to have taken steps at this stage. The other proper equipment should obviously be given to staff and proper assistance. All the working from home has I'm sure many charms to many people. Somebody had texted me in the early part about their vegetable garden and whatever, but all joking aside, it can be quite a lonely existence. People who are living at home on their own, working at home on their own, spending their entire time on their own. I would have thought that an employer in these circumstances, and in particular a public sector employer, should be ensuring that staff are being properly counselled and cared for, that they're being reminded and encouraged to contact organisations like Care Call to make contact with the Occupational Health Service. Their line managers should be teed up to ensure, once a week or once a month. I don't know what the situation is as it is on the ground, but that people should be asked about their welfare and their health and safety, and particularly their mental health, perhaps during this period of time. And obviously, all staff and all, particularly in the public sector, should be properly managed and supervised. And the employer is under a duty, in my opinion, anyway, of keeping in touch with its employees to ensure that their mental health and their general health and safety is being looked at. So that's a very, very broad overview of a very, very wide-ranging area of law. The bottom line, I think I'm saying, is that nothing has changed. The nature of the case has changed, if you like, or the nature of the work circumstances have changed, but the same principles of law still apply, which is and the first one is that the employer owes the employee a duty of care and a duty to take reasonable care in the circumstances, and it's a duty to provide them with a safe working environment, safe equipment, and make sure that the employee has access to assistance where required. And we'll be hanging around afterwards, I think, to answer any questions. And if anyone would like to speak to me personally, you know where we are. You can send me an email. You can send me an email or write to me or come in and see us or contact me by telephone. I'm more than happy to deal with any queries from anybody. And it's a pleasure to speak to you all. And maybe some other time there will be a trip to or the nice hotel down there at Lough Erne or even up in Derry. Thank you.
Viv, thank you. That was very comprehensive and really appreciate it. And I think it's important that we don't forget the trade unions were involved in the fight and at the forefront of campaigns and achieving the workers' rights. We will be there again. And as you say, it's a battle, but just a different battlefield. And some of the stuff you raised there, I believe, is currently at the forefront of our minds. I think it was alluded to earlier. There's some semblance of sense that the pandemic's nearly over and we need to herd everybody back in, and all of that's going to take its toll. And I think we're going to have to be on our toes to defend situations like that. So I'm going to open the floor now for speakers and for questions for either John and or Viv, for anybody that wants to come in. Enda McCartan, you're on first. Can you hear me, Enda? Enda?
Yeah.
I can hear you now, Enda. You work away.
Yeah, okay. Just a couple of points to Viv. I mean, first of all, I think, interestingly, you'll all probably be aware that civil servants normally get destroyed at this time of the year for their sick leave, but I see there was a report in the Belfast Telegraph yesterday saying that sick leave had dropped or plummeted, I think was the word used, by 30% during the current pandemic. So I don't know what that says about working at home, but in terms of you know, a safe environment at home, you talked about you know, basically employers have the same duty of care when we are working at home as they do when we are in the office environment. I have found in LPS that we have been particularly good. We have particularly active branches in LPS, and our management has by and large supplied us with most or a fair bit of the type of equipment we need. I know there is a working at home policy presently being worked on, and that might take care of you know, more things like furniture, for instance. But definitely, you know, all sorts of IT kit has been readily available, and indeed, in some cases, it has been updated. Stuff that was initially handed out at the beginning of the pandemic has since been updated. So I suppose one of the things that a lot of people have been talking to me about in my branch is, yes, it's all well and good, you know, having a desk and having a you know, a computer and a laptop and whatever else. The difficulty people are facing is, you know, the additional expense incurred working at home. And I know a lot of civil service management, and it's been mentioned before, you know, they're saying that this is offset by the fact that people don't have to travel and whatever. But there are a number of people who live, you know, in the vicinity of their workplace that may not have that additional expense. And one of the things, and I'm sure we'll all realise that working at home now, you know, you try to keep the heat off until, you know, maybe 4 weeks ago you tried to keep it off to 4 o'clock. Now it's getting you know, earlier and earlier. My daughter's at home from school over the last week, and she's now insisting it goes on at 11 o'clock in the morning. You know, so you know, that's like, in a lot of ways, and for a lot of people, that's not sustainable. In terms of the safe environment, I mean, I have a safe environment because I have a table, I have a computer, I have a big screen, I have a headset, but I don't necessarily have heat, you know, as much as I would require. You know, does that, you know, like, I suppose, and for a lot of people, the extra expense that they're going to have to go to provide heat in their workplace, which is now their home, is going to cause a lot of mental strain. So my point is, how does the non-provision of expense by the civil service impact on our health and safety from a mental perspective in terms of worry around increased costs?
Those are all excellent points, and in fact, you've just basically painted a scenario to me that I wouldn't necessarily have been 100% aware of. Leaving aside any issue which applies to the situation that I was talking about, I would have thought that your employer is under a contractual duty to provide you with recompense in relation to heating costs, electricity, etc., etc., etc. You make a very good point there that a lot of people live close to their workplace, so aren't making any savings in relation to travel. So I would have thought there shouldn't be, you know, any issue. You know, the heating in your house would normally be off, say, from 9 o'clock in the morning to 4 or 5 o'clock in the evening. Now it has to be on all day, particularly over the next 2 or 3 months and over the last 4 weeks. So I think if subject to looking it up and checking out the exact contractual law point, I would have thought your employer owes you some money to recompense you in relation to that and any other additional expenses. The worry arising from their failure to do that, I just don't know about that. That wouldn't necessarily be one of the scenarios that I would have in mind to give you a cause of action against your employer for personal injury, because the worry, anger, frustration do not in themselves amount to a personal injury. It has to actually be a recognised psychiatric injury in the opinion of a psychiatrist. But all those other issues I would have thought should be dealt with by any reasonable employer, particularly in relation to heating and light.
I mean, just one thing, and I don't know if you're aware, the employer can refund or pay us £6 a week to cover these expenses. They have refused, and anytime I contact them, and I know NIPSA have been in contact with the employer about this, they point us in the direction of HMRC. With HMRC, you can only claim the tax on the £6, which equates to £1.20 for most taxpayers. You know, so basically it is nothing. It's not going to cover, you know, anything. So we have been refused at every stage to date, and I've even contacted NIPSA HR myself, and I'm getting nowhere. So it would be interesting, you know. I think we should keep pursuing this, you know, because I mean, as you say, you believe that they should have, or they should recompense us for additional expense incurred.
Well, so, and also, by the way, and this might be an area that John would be able to add something to. I'll just hand over to John there.
And I think the position in relation to your contractual position is regulated by your terms and conditions of contract. Now, we all know that civil servants effectively don't have a terms and conditions of contract, you know, ready referral form. So what I would need to see is the basis upon which we contend there's some entitlement, either through some kind of circular or any other document that gives rise to the claim in relation to the £6. But I think there's, aside from that, there will be certainly the ability to make representations through the industrial negotiations. Essentially, the buildings that you would be in are not being heated to the same extent. The costs of what would take to run those buildings, it's not being incurred by the civil service. Essentially, those costs have been passed over to your employees who are incurring them in the home place, so in the households. So I believe that would be something that's well worth to engage with NICS to say, look, the reality is we're incurring costs in effectively doing the work. You're saving those costs by the buildings not being having the same numbers of people in them. So it's an aspect I would think is essentially something for negotiations upon. But I'm particularly interested to see exactly what you say gives rise to the £6, because I'd like to see that before I would give any further advices on it. But I think there's, aside from that, there is an aspect open for negotiations, I would assume.
I know that's
Andy, you've raised Andy, you've raised a very significant point, which I think is going to affect significant numbers of our members. So I just want to bring Alison in at this stage to relate to specifically the issue about the HMRC and the tax and the £6 and stuff, Alison.
Yes, and thanks for raising this point, and I did make reference to it in the open remarks this morning. This is a collective bargaining issue, and certainly whether it be the civil service, the housing executive, or anywhere else in the public sector, is that other than a number of small organisations, arm's length bodies, the employer has hid behind the fact that is that they don't have to pay it, that there's no money to pay it, and that anyway everybody's saving on travel costs in coming to work. The HMRC rules are very clear in that any employer can pay their employee up to £6 per week tax-free to allow them particularly for heating and lighting, and that's very clear within the HMRC rules. But Andy, you're absolutely correct, is that whether it be the civil service, the housing executive, the health sector, on all of the other sectors in which we organise, they have point blank refused to pay the £6 and instead say, well, you can claim the tax on that, which really is a tax code change, which would deliver about £1.20 a week for basic rate taxpayers and double of that. So if you're a higher rate taxpayer, otherwise you're earning more money, then you actually can get double of that. And I just think that's morally wrong. We have made an argument in the last few days, particularly in the civil service, because we are topping and tailing the guidance in relation to home working. And this will obviously fall out to other areas of the public sector, where there's £94 million sloshing around in the Department of Finance and in the Executive, which is COVID-specific money. So we heard a fortnight ago now there was 540 million as part of the Barnett consequentials came across, was used for rates relief and a whole lot of other issues, particularly for businesses. But in addition to that, the Department for the Economy are working on a scheme that we as citizens will all receive somewhere between, I don't know, £70 and £500 has been mooted irrespective of whether you require additional money. And this appears to be a bit like the Eat Out to Help Out scheme. So we'll all go out into the high street and spend money. But there is 94, the point that I'm making there is that there's £94 million unspent of COVID money. The executive are thinking, what are we going to spend this on? If we don't spend it by the 31st of March, then it could be handed back. So myself and trade union side have made the argument directly to the management side is that this is COVID-specific money, and therefore the money is there to help particularly the lower paid workers across the public sector. And this is an absolute disgrace because potentially they'll give us another £25 a week to spend in the high street, or else the money will go back to Treasury. And I understand they're struggling to find out how they would actually spend this money. And this is an opportunity to pay back to all public sector workers for what they are giving up at this point in time. Because I understand, because I'm working at home at the minute, it's blooming freezing in the afternoon. And you know, if you can't put your heat on, is it you put another jumper on or you put another 2 jumpers on? And it's only going to get colder over the next few months. So the money is there, and we are pursuing that and have raised that as an issue with management side last week. And they said they would raise it with supply, and we're waiting for them to come back to us on the issue. But they said, their exact words was, I wouldn't be very hopeful. And I think that's an absolute disgrace, because the executive are sitting on money there that could be in the hands of people who have a legitimate right in the workplace to be able to work in suitably heated and light accommodation. So I leave it at that point. I just wanted to update everybody. We're still pursuing this, but the answer is no, no, no.
Thanks. Just one more quick point. It was pointed out to me by one of the members in my branch that, you know, given the fact that we've been working at home for 8 months, if we deal with the general public, particularly in some of the more difficult areas, we are inviting argument and distress into our own homes and our own spaces. And this is causing, and I think you referred to that too earlier, Alison, this is causing a lot of pain and heartache to people, you know, potentially, you know, in your own sort of space, you're inviting them. When the person said it to me, he says, I'm inviting people into my home who are shouting at me. And I'm going, sorry, you're not supposed to have people in your house. And he says, no, remotely. But, so thank you.
And a very well made points, and I think we'll exhaust one part of the process and then may come back to the 2 gentlemen for the second part of that. So as the man says, watch this space. Can I call on Janice Welch, General Council Member? Janice, can you hear me?
Hello?
Hi, Janice, can hear you loud and clear. Go ahead and ask your question of the Marine and his mate there.
When you said my name, I just lost connection. My name.
Okay. You're back.
Thanks,
now.
John and Bev. That's been really helpful and useful. I suppose my question would have a million questions, but I'm not going to kind of abuse the sweet spot that I have. My question's about risk assessments that you touched on there, and going back into the workplace. When the first surge eased off, we had this kind of blended approach, and there was a big drive, get everybody back in relation to doing half and half. But whilst risk assessments, yes, are happening, managers are, where we're trying to intervene, we have members that could be working from home, and this is a battle day and daily, members that easily could be working from home, but managers, their own words, they want to see bums on seats. So they hide behind there's the risk assessment and we're following the guidelines. But I suppose my question there is, how do we get past that in relation to, because we are having members who that is happening, that managers are doing the risk assessment, they're following the guidelines, but that's not 100%, I suppose, safe, because you're up against maybe somebody not wiping down a desk prior to you and stuff like that. So you can't be 100% guaranteed you're safer at home. So it's getting past that. How do we get, our members are at risk, potentially will and are catching contract and COVID, even with all of that. and it's just getting to that in relation to personal injury cases and that, right? And the knock-on effect of all of that as well, I suppose, is the mental health issue. I just wanted to talk on the anxiety. I have members who are off on sick leave. There were issues in the workplace maybe anyway, right? But I think COVID just finished a lot of people off, right, in relation to how this was being handled by managers and that, and this demand in relation to you need to be in the workplace, we need bums on seats and that. So I don't know if you understand what I'm kind of asking there. It's about for our members who are contracting COVID and the employer is saying, well, we've done everything. Is there still cases there? Do you know what I mean? In relation to
I presume that the question is addressed to me, I presume.
Yes, yes.
Yeah. But yes, first of all, the two aspects, the risk assessment and then specifically about stress at work, I'll call it, if you like, stress at work claims. There's a statutory duty imposed upon an employer to carry out a risk assessment, particularly when a new set of circumstances arises, i.e. the pandemic, okay? But once they've carried out the risk assessment and they've identified the risks, obviously in consultation with staff side, which I presume that they will have done or maybe not done. Once they've done that, they then, exactly, I can see you shaking your head. And once they've done that and they've formulated the risk assessment, I think it's up to perhaps the staff representatives, the union, to maybe say, look, thanks very much for carrying out the risk assessment, but we do not feel that you have adequately dealt with the following areas, i.e., we still think that the offices are overpopulated. We also think that proper steps haven't been taken in relation to wiping down services when people are moving about the offices and using the same workspaces and workstations. This is the type of thing that you have to look at. And a lot of these issues are sort of common sense type issues. That's what sort of infuriates me sometimes when I'm doing my job, to see how accidents happen when they could so easily have been prevented. But the one thing is that the law will not give you 100% guarantees for health and safety. This area of law will basically say that an employer is under a duty to take reasonable steps. Now, obviously, when the pandemic kicked in March time, it was a bit of an emergency situation. So I could see a judge saying that perhaps in an office type environment, that maybe this was an employer just doing his best. But here we are now in December, and this thing's been going on for 9 months. I don't think a judge is going to be so charitable in his or her outlook towards the actions or inactions of an employer in this type of situation. In respect of the stress at work type case that you're talking about, these are some issues that you said existed prior to the pandemic, and they're ongoing and having been dealt with. I would make the same point again. I can understand perhaps a judge being slightly sympathetic to the plight of an employer trying to deal with the pandemic in March and April and maybe leaving some other issues to one side. But once again, if we're reaching October, November, December and nothing has happened to progress that particular complaint or that particular issue, then I don't think a judge is going to be so benign in his approach to the employer. So the answer is there's no 100% guarantees in work. Once again, we're back to this concept of reasonableness, but some of the actions of the employer, in my experience and what I've heard today from Enda and yourself, sound like fairly unreasonable to me. And if you want to get in touch with me to discuss any of those things, by all means do so. Send me an email. I've got loads of stuff on it, and unfortunately we have quite a lot of time on our hands as well, because the courts aren't sitting and we're not obviously seeing people face to face, although I'm sitting beside this guy here, maybe a bit too close, but I'll move away into my bubble.
Can I also add in, look, the whole point is a risk assessment does not amount to some panacea that cures all ills, because everybody's aware that suddenly a situation where we've got a risk assessment, suddenly get back into work. But what if that workplace is essentially in a scenario where people are starting to congregate, old habits are starting to come. People are talking at the, people are talking because somebody's birthday, and suddenly it's a situation where people are congregating around a desk. That's why it's important to know one of the topics for today was Article 68, because in those circumstances, if you have a member that's able to say, for example, look, I understand that maybe when I came back in July and August, there was no issues because people were adhering to social distancing, people were adhering to the one-way system. But then old habits come back, and I made representations about it, and they were ignored, or they were just saying, no, your job is to get back, your bum should be back in your seat. But then in those circumstances, you can see that an individual may seek to rely upon Article 68 because they have a genuine and reasonable concern. It's because the facts in that workplace give rise to that genuine and reasonable concern. And that therefore, in those circumstances, if that individual has a genuine and reasonable belief of danger to themselves, then that individual can make the decision, I'm not going to be present in a workplace where I am exposed to this danger. Therefore, I'm going to absent myself from the workplace. And they're protected in law by not being able to be treated in a detrimental fashion and not being dismissed. But the reason why I've bookcased this at the start and at the end of my presentation is that it is an individual choice. And that was why it's very important. You can tell your member, this is the law. These are the protections that the law affords to you as an individual, but I cannot tell you to make that choice either way. What you have to do is you have to go and satisfy yourself that there is a genuine and reasonable danger. You can go and you can look and make your own research onto the risks that you're exposed to. Then you can take a view informed by either the absent or omissions by what the workplace is doing to inform your decision. But it's important and very important that when it's absolutely clear when you're having those discussions with your individual members is that this still has to be your choice. It can't be a choice where I give a recommendation or a choice that points you in a certain direction, because then that crosses the line where then there's a risk in terms of being asserted as a collective right, because the case law is crystal clear. It is not a collective right. It is an individual right.
Mm-hmm. John, that's been very useful, that link actually, to bring that back to Article 68. You did the 68 presentation and David did that, and actually it's amazing then how that all, like, you brought that back round again. Absolutely. And the other thing I suppose really of note is the employer and health anyway did nothing. There was no learning in between. You see that middle period before the second surge started, it was, the emphasis was on we need to rebuild services, we need to rebuild services, no learning. And they quoted to us when we would expect the second surge. It came a wee bit earlier than we expected, but the employer knew this and failed our members, you know, big time, because they focused on let's rebuild the services, let's get everybody back in. But thanks, that's been very useful. Thank you very much.
Yeah, no problem.
Janice, thank you very much for that. That was very useful. Thanks you two gentlemen. I think what we'll be doing is bringing members' cases up and bringing them through to you too for an overview and see where we go, because I know Janice has a million questions and I know she touched on a few points and I'm sure they're reciprocated from many, many others in there. So at this point I'd like to bring in Deborah McFarlane, branch 503. Deborah, can you hear me okay? Deborah?
Hello, sorry. I
no
disappeared there.
That's you through to the lads now, Deborah.
Great. Hello. This is my first time at a seminar. So thank you very much for allowing me to be here today. It's been so enjoyable. My role is a trade union rep, but I'm also a health and safety advisor within the public sector. So we have been working non-stop since the start of this, since March. Performing risk assessments with managers. And I've also got the opportunity to sit on a health and wellbeing group. And for me, it's, I'm coming in and I'm going to be very quick. It's just to reiterate what the gentleman and lady said first. As regards to lady Janice, one of the things I would say if employers are bringing staff back into the workplace is to make sure they've got appropriate numbers of first aid personnel and fire safety personnel as well for the buildings that staff are in. And we would always say if anybody has any issues with health and safety, is to contact your health and safety person as well, as regards the risk assessment. But for me, one of the big things is touching again on mental health. I know we talk about risk assessments, the employers have to do risk assessments. That's not just where it stops, is to do the risk assessments. One of the big things that I'm working on, and hopefully all other employers are, is this will come to an end. There will be a stage that this will come to an end and employees will be returning back into the workplace. And I don't know, I'm very open. I'm always very open when I do training sessions with anybody. I'm very open about my own mental health and my own anxiety that I have. I've certainly come into this, and I'm not leaving this the same person that I've come into this pandemic. And I think employers, I keep getting told about that there's counselling for employees, and they use the word stress. To me, I think the word that's going to come out of this is trauma. There's going to be a lot of persons coming out of this that have exposed with trauma. And trauma is one of those things, it's very hard to actually pull back from, and it can take a long time to actually pull a person back or to heal from trauma. And I think employers need to, certainly where I'm working, one of the big advice is, yes, you're doing your risk assessments to protect people while still in the workplace, but when persons are coming back into the workplace, it's going to be very hard for someone who sat at home 7 days a week. I have people who I liaise with who are carers for their parents. They don't leave the house. They don't mix with anybody. For them to go back into an office environment with 70 people and potentially with trauma. Because the government, I remember back in March, even been scared to step outside my door because of what we were getting bombarded with within the news. It felt like a monster was outside waiting to pounce. I found that very traumatic. It's going to take me a while to actually recover from it. And I've been very open with my managers, and it's managers, while they're doing the risk assessment here, they have to prepare, they need to get a plan in place for persons coming back into the workplace. And you have a lot of employees. One of the things that I've recommended is that managers have one-to-ones with employees via WebEx, Skype, whatever, you know, how they manage to do that, to chat with employees to find out, are they exposed to anxiety? Have they been exposed to anxiety? Is there trauma issues there? The gentleman also touched on it as well, in that we also have, I have persons who are working from home. When you're dealing with a job where you're working with members of the public, and members of the public can be abusive to you on the telephone, when you're in the office environment, you can escape that. Continuous abuse can lead to trauma as well, not just stress. This goes deeper, abuse in the workplace. When you can go home, you can escape from those feelings and from being in that environment. But when you're working from home, I have a member of staff who says every time her phone rings at night, her heart beats, her heart stops, because of the effects of the calls that she's dealing with day in, day out. For me, I can't even wear a perfume that I was wearing back in April, because it sets me off. It reminds me of the time back in April when we were so scared, there was a monster out there. So employers have to be prepared that when persons come back, you can't just say, right, everybody come back in next Monday, that's it. I think it's a case of it's going to have to be, as much as it can, a person by person case. And looking at them, you know, we're being asked to do maybe stress risk assessments. I think, as I say, this goes deeper than stress. This goes into trauma. I think a lot of persons, I don't know about anybody else, but certainly I have changed coming into this. I'm not coming out as the same person. Going back into the workplace, I'm going to find it hard as well. And my employer needs to understand that. And they need to treat persons with kid gloves. These are unprecedented times. And it is, when employers are doing risk assessments now, very much, I think persons should be preparing, how do they get people back into the workplace and not bring them all in as one? Do they look at bringing them in on a staggered basis? Do they have one-to-ones with the staff on the telephone beforehand? Or they may have to refer them to occupational health, they may have to refer them for counselling. These are all the things they need to prepare for as well, and they need to put the steps in now. When they're doing that, how they bring staff back in again and protect staff as well, because they are going to get staff back coming in who may not have been exposed to mental health issues, who now may be exposed to it now. So that's really basically what I wanted to say. It's a passion for me. Mental health and well-being is a passion for me as well as safety. And it's getting that message out there that they need to prepare people to bring them back in again and to do it gently with them. So thank you very much. Thank you.
Deborah, those are all excellent points. In particular, the issue I think somebody had mentioned, maybe yourself, about the lull between the two surges of the pandemic, and the employer perhaps had an opportunity to put into effect certain steps. This is perhaps an opportunity, as you've pointed out, for employers to be looking to maybe 3 or 4 months' time, when people will be returning to the offices in great numbers, and this is the time for them to put into place measures and steps that will hopefully be able to staff will feel safe coming back to work and will be counselled and not mollycoddled, but as you treated with kid gloves and treated respectfully, because we've all been damaged by this. By the time we do start to begin to return, which isn't now, but it'll hopefully will be in the spring, that'll be a whole year out of all our lives that we've been living through this. So an employer, I think, in light of that, is going to have to sharpen up his or her act. And I know that you will, obviously, wherever you work, I presume it's in the Education Authority, is it?
No, it's actually, I don't know if I'm allowed to say. I'm allowed to say, or I'm not too sure.
But maybe not. Sorry.
It's just, I'm not used, but I work in the public sector housing association, and it's quite a large housing association organisation. So, and they've had to continue, especially emergency repairs, have to continue throughout. They've been working throughout. So we've been very busy doing risk assessments. And one of the big things I would say for all companies to make sure they're doing is a large project I worked on is regards first aid personnel. First aid personnel, there was advice came out from the Health and Safety Executive. And as well as that, the British Resuscitation Council UK, the British Resuscitation Council UK have recommended, and we have all our first aiders now, we've just ordered the kits in, that anybody providing first aid, particularly CPR, must be provided with specialised first aid kits. And that is because during the process of CPR, performing CPR, aerosols can be transmitted. So they would recommend either you wear a P3 mask, and they wear surgical gloves and a face visor or goggles, or if you don't have a P3 mask, then you would cover the casualty's face with a cloth. That's a large project we're working on, and hopefully all workplaces have listened to that as well, to protect their first aid personnel when they're performing first aid tasks.
Thank you so much for your contribution. Delighted you're enjoying your first seminar on this, and really appreciate everything you've said and done, and thanks for that response from the two lads. Can I call in Geraldine Mullen, please, branch 732. Geraldine, can you hear me? That's you now, Geraldine. Work away, you've got the lads' ears.
Hi folks, can I just say first of all, Brian and Alison, thanks for this seminar. It's been really great and much appreciated and very helpful. So my question is a strange one, in that, can a member, and I don't know who to direct this, so I'm just putting it out there to both of you, can a member of staff refuse to give the vaccine? And the reason for that question is I got and I'm thinking about, I suppose it's conscientious, but they're querying that they do not want to be putting themselves at risk with their code. It's a nurse member, so they've asked me the question. My advice to them was that they need to go and have a conversation, an in-depth conversation with their manager, and it's a GP surgery, and have that discussion to see exactly what. But my thought is it's part of their role. And the other thing that they wanted to do was, when they're given the injection, is to say to the member of the public, well, I don't think this is safe. I'm saying, well, you can't say that either. But I suppose my main question is, can they refuse to give the vaccine? Is that going to affect, their job as such?
Can they refuse to administer it to other people, or to take it themselves?
Can they refuse to administer it to other people?
Well, I would have thought that would be, the employer asking the member of staff to do that would be construed as a reasonable work instruction. And I would have thought that they would be obliged, and they would be contractually obliged to do that. What they may have some religious or moral objection to it, I think that it would be unreasonable not to do that. It would also be unreasonable not to take the vaccine as well. I would have thought, if they work in a healthcare environment as well. So those are my initial thoughts on it. You know, the public, all these things are overlaid with public policy considerations. It's obviously good public policy at the moment that this vaccine is the way out of this crisis, and that it is incumbent upon everybody to take the vaccine where appropriate, particularly if you're working in a care home scenario or in a hospital or health trust scenario.
If I could interject as well.
Yes, John, please do.
I would wholly agree with Viv. I think in the context of actual circumstances you outlined, there was a nurse who was refusing to provide the injection. I think that would be considered a reasonable refusing a reasonable work instruction. And then you're getting into the whole argument in relation to the rationale for why, whether it's a religious or some other kind of viewpoint. Then you would get into the whole issue is, well, what has she done in the past in relation to what her normal work responsibilities, and why in this circumstances it's so different? You would get into a very tricky scenario that it would be so fact specific. It's hard to give generic advice out. That would be my tone of caution. The only other thing is, I think in the circumstance, if the nurse was providing the injection but also saying this is not safe, you're getting very much into the realms of potentially some other substantial reason dismissal, which is the catch-all in the absence of it being redundancy, capability, or conduct, or some other substantial reason is essentially everything else. And if you have a person in that role telling people who are coming in as members of the public, this is not safe, I could see potentially an employer deciding that's just so beyond the pale that you could be, the potential is there for an individual to be dismissed from the basis of some other substantial reason. So if it is, for example, a religious viewpoint or conviction, then it's far more attractive to have that conversation and make those representations to the employer before you're in the position of having to actually do the action. And then effectively have that discussion to say, look, in the alternative, because I have this conviction or religious belief, I think it's more appropriate that I don't do this work, but I do other people's work so they can do it, that may be feeling more comfortable providing the injection. That would be my thoughts on it, that individual could be exposing themselves to the risk of disciplinary sanction and or dismissal, dependent upon the specific facts. And that individual needs to carefully consider whether they're willing to go down that route. And the alternative, rather than putting themselves in that position, have the conversation with the employer. If it is a religious viewpoint, have the conversation. It is my religious viewpoint, and I do not want to be drawn into that conflict between my day-to-day work responsibilities and my faith.
Yeah, it actually wasn't on religious. It was to do with the safety of the vaccine, and they are querying it. They are. Sorry, I just heard Brian there. It was to do with the safety of the vaccine, and they are very sceptical, and they're reading all these journals and they're saying that it's not safe. So their professionalism is being put at risk in their codes, and that they're administering something which they profoundly believe is unsafe. But you've just assured me that the information I sort of relayed to her was exactly what you'd said, that it's a reasonable request and all the rest of it. And the only other point was in relation to the personal injury cases. I suppose going forward, people and long COVID members are suffering from this, and it's so real, and it's so plentiful, unfortunately, out there, which is the scary bit. And it's about putting employers, making employers aware that they must take heed of the long COVID, and just because we're in crisis for staffing, that they're not forcing staff to come back too soon, even if they're going back to work, but more importantly, when they are going back, that they are given shorter shifts if they are feeling in slightest fatigue, but that there's steps put in place to ensure a safe return, and that reasonable adjustments under DDA, pre-COVID, and we ensure all that. I think just going forward with this, it's really important that we put employers under that pressure now, that they're not just getting people back in too soon to do a 8-10 hour shift when they're not fit to do it. And it's about negotiating that with employers. Otherwise, I think we should be able to take personal injury cases in relation to that if they're poorly again. Yes, Viv.
Sorry, Viv, what are you saying there? Go again.
obviously, if you contract COVID, particularly some of the more virulent forms of it, that would be a personal injury. It could be difficult enough establishing that you contracted the virus or contracted the illness in the workplace. That evidentially could be difficult because we're all operating in all sorts of environments, in supermarkets and whatever. But one of the better points that I thought for these personal injury cases, and I thought this from the outset, is the psychiatric injury case, whereby somebody sustains a psychiatric injury due to the fact that the employer has failed to take any reasonable steps to protect him or her in the workplace. That's what I thought would be the better case. Although in some of the cases that we do have, we are bringing the case in relation to somebody contracting the virus itself, or the illness itself, coronavirus itself.
Yeah, no, I thought, I mean, to prove that's extremely difficult, and it's more about, when they're returning to work, that they have put in steps to protect them, as in reduce their shift. Sorry, Brian.
Geraldine,
I agree with you, by the way.
Yeah, and I'm thinking phased return on a longer basis, but in these certain particular circumstances. Forgive me for my expletive. I couldn't believe, Geraldine, it was going to be about a belief of the vaccine. I'm not sure where we'll go with that one. Viv, not like me to challenge you, but I need to just come back on the point you raised in terms of, it's now just went straight out of my head what you raised. You raised the point about, the contractual, that you'd said there, it probably might be incumbent upon people to take the vaccine if they're working health. I can assure you, Viv, we have significant numbers of persons who are clearly stating, no chance. I'm not doing this. And we have actually negotiated with the management and said, this has got to be on a voluntary basis. And what they've said is vaccinations start 14 December for health service staff and finish in February, and thereafter you go to the back of the queue. So I would just like to tease that out a wee bit. Do you think that is something that we need to be considering for a member to take forward as a genuine argument? They're not getting the vaccine.
But John was talking there about the ultimate sanction, which is dismissal for failure to abide by a reasonable work instruction. But if you're saying to me that an employer saying you're lucky that you're in one of the top tiers and you're going to be administered with the vaccine right at the beginning, and if you refuse to take it, you go to the back of the queue. Well, if that's the sanction, I'm sure your member will be happy enough. Is that correct?
I'm conscious you said maybe people could refuse. I wouldn't have thought it was an argument, but it's one maybe we'll tease out again with.
Well, I have to say to you, it's obviously it's a novel point because we've never had to deal with this particular set of circumstances before. But I would have thought that a health service employee refusing to take the vaccine but continuing to work in a health service environment could be creating a problem, and I can see you say you've loads of members who say that they're not going to take the vaccine under any circumstances, and I'd say that's everywhere in the world. That would be the situation. Yeah. It would be interesting to see how the employers with this and how government deal with it. If there are masses of people who are refusing to take the vaccine, I would have thought it's going to be the last thing the employer is going to be doing is doing mass sackings and stuff like that. So it's going to be an interesting battleground, I have to say to you. But I would have thought that is a reasonable enough work instruction. That's just my initial feeling on it. I may change that if I hear something to the contrary.
Okay.
I would have thought that it has to be voluntary.
Thanks, Charlene. Appreciate that. Can I ask Janet McVeigh, branch 733? Janet, are you connecting? Anything it's Janet, lads? Oh, great. Yeah. That's you, Janet. Work away. You've got the ear of the lads.
Okay. What I was going to say now, what everybody else has said, now I've got caught up on what they're all saying. What I wanted to say that I did concur with what Andy was saying, about members hating their homes and things, because I've had that myself. Also then what Deborah was saying around the stress and the trauma that people are experiencing, that I also have members coming to me saying that they're struggling to do their day-to-day activities outside their work environment because of the whole COVID and social distancing, and struggling even to go for their own groceries because
of the social distance aspect. So it's not just within our workplace that we have to worry about our members and around their own mental health and well-being, but actually outside of work as well. And then Bose, on the last point there around the vaccine, I think that will be an argument that will be have to had, because I also have members who are saying that they do not wish to take the vaccine who work in the health service as well. But Bose, just to my own point, what I wanted to make reference to was, how do we ensure that our employers carry out that to make sure, like, the risk assessments around working from home? How can we ensure that they know that our workplaces are safe? I mean, I've been working from home quite a number of times, and I have never been asked by my manager, what is your workstation like? You know, how do you take are you taking your breaks and things like that? And I know that's been the same for a lot of our members, and probably would be amazed if the trusts actually go anywhere near what they're supposed to do. So Bose, it's good maybe for us even to think about that, and maybe to even take on that challenge. Thank you.
You know, all I can say in respect of the employer and the risk assessment is, you just have to keep knocking their door. They have, you know, they're under a statutory duty to do it, and if they don't do it and somebody injures themselves, they're leaving themselves wide open. And it's not good by an employer not to listen to the genuine concerns of its staff, and to flagrantly ignore the legislation. So, especially in the public sector, particularly in the health sector where you clearly work, is that correct?
Yep, that is correct. Yeah, and it, you know, it is around ensuring that then we do follow up. I know I'm a health and safety rep within our branch, and I have been trying to hold them account around the risk assessments for people actually coming back into work. But those, the next challenge is to ensure that those are still working from home, that we ensure that the risk assessments are carried out for them and the support then is there for them as well.
Okay, thank you, Janet, for that, and thanks for that response. I'm going to call on Peter Boyle, General Council member, straight from the picket line in Newry. He might give us a wee update on that before you go, Peter, and then you have the ear of the lads. I'm just hoping you're connecting with us there, Peter. That's you in?
That's me in, yeah. Sorry, folks. Busy all day today, but a couple of things came up. Let's say that was dodgy territory for me. I want to just thank everyone that support us, and particularly to Brian and Alison and Francis and the General Council members that give all the support for us today. But the one thing I found today was the legal aspect of regarding being on picket during the middle of COVID. Now, we had our sheets and all that done today, but we found that there's obviously this is going to happen again because the way things is turning out. But we found the lack of information regarding pickets and a strike action in COVID, given the fact that councils will now be trying to rush people back to work in probably not a safe environment. I was wondering where or what is available. Because I know Unite are trying to take a case against the constabulary in the mainland, but where are we fixed regarding that? I'm sorry for dropping this on you, but it's just pertinent at the present moment in time. I wonder could you just give us a wee bit of guidance.
Well, in relation to, like, you're fully familiar that strike action and what is an industrial dispute is limited in terms of what statute defines as giving grounds for industrial action. And that's gone through whatever the protocols necessary in accordance with the Trade Union and Labour Relations Order, I think 1985. But I'm not sure what you mean in terms of the overlap with COVID-19. I'm not sure what exactly.
Peter, are you asking essentially, can an employer force its employees to go back into the workplace if it is adjudged by the union, for instance, that all proper risk assessments haven't been carried out, and the union believes that it would be endangering its members by forcing them back into the workplace? That's the question.
Yeah, and on top of that, then what is the legislation regarding picket lines and stuff like that? We can't find anything on it. We had police driving by us and having today, and we were sort of going, hope they don't stop.
But is it pickets in relation to to what, in the context of COVID-19, in terms of the social distance.
Yeah, social distance and that sort of thing is right. Yes, yes. I thought there was an exemption for.
Well, I'd have thought that the social distancing rules probably override the employment rights and trade union labour reform legislation. I would have thought.
Yeah.
But that's a typical waffly lawyer's answer, I'm afraid, Peter. So, but my gut reaction or my gut feeling is that the social distancing rules probably override the other. But I would have thought that the police, if everybody was nicely, everyone had,
yeah. But it was just
if everyone had an individual brazier, you would be able to get round the legislation, I would have thought.
Yeah, that's okay. No, it's just that there was that incident with the Unite Union taking the constabulary on. I didn't know what way we stood with it. Was there an exemption for picket lines, or will we follow the code?
No. In blunt terms, basically, there's inherent conflict between them both. You're going to have a situation where the whole point about a picket, properly constituted, is a normal picket. The problem is what you have a picket in the midst of a global pandemic. So essentially, it's going to be used as a method to essentially say, look, you can't all congregate because essentially you're in breach of the COVID regulations, which you are. But the point is that we have to all comply with the regulations. The problem is then it takes the pressure in terms of the strength of your position is undermined because you don't have the numbers on the picket line. That is the byproduct, unfortunately, of the process. But effectively, the regulations trump everybody marching out and congregating as a group, because unfortunately we are in the middle of COVID-19.
Yep, 100%. That keeps
the only other thing I would to conclude with, that goes to the point I was talking about in relation to people who are, that's why there's this issue in relation to what the Prison Officers Association tried to do. They tried to lead their people out by saying we're relying not upon we're relying upon Article 68 or their version of Article 68 on the Employment Rights Act in order to lead their people out and say, look, we're not going to effectively go to work because of the understaffing in relation to the prisons over in England. But that was seen as what it was, which essentially collective action by another means. And you're not allowed, as a Prison Officers Association, you're not allowed to participate in strike action. We are lucky in that we're not in that kind of category of employee. We're prohibited, like the police or the prison officers, in relation to participating in industrial action. But in the middle of the COVID pandemic, we have to act in accordance with what the regulations prescribe in relation to social distancing, etc. So hopefully that was more of a lawyer's answer in relation to your question, that there is an inherent conflict, but the COVID regulations were right, essentially congregating as a group in relation to picketing action.
Okay, thanks very much. That clears it up for round two. Thank you. All right, bye-bye.
Okay.
Thanks, Peter. Thanks for that comprehensive response, gentlemen, and maybe we'll revisit it if and when, unfortunately, the need to have further strike action in the new year comes, and we just define it clearly so we can know our strong position. I'm going to call in Paul Dale. Paul, are you connecting with us there? These moments you wonder if... Paul? There we go. There you are, Paul. You're in.
Thanks, Brian.
Work away. Thank you.
There's a great delay on me coming in these things. Listen, I'm not going to take too long here, but I was listening very carefully to what John was saying at the start, and he was very much underlining the protection by laws only for individuals, and I understand that. I don't think it's that helpful, but it was obviously a concern towards trade union reps that they lead or they try to take a group of workers out at the one time. It's very obviously that it needs to be each individual makes up their own mind. But that brings us on to the current employment law. Is there not a fundamental weakness that when someone is dismissed and it goes and they win their case, that there is no offer of reinstatement to the post, We saw, it was in the news over the last few weeks, I'm not sure if everybody's aware of it, there was a shop steward in Edinburgh, was dismissed by, let's call it a large Swedish furniture manufacturer, but he's a native of Fermanagh, Richie Venton. He won the case in law, but all he got was compensation, and there was no automatic right to reinstatement, which to me is a fundamental weakness of the legislation, and we have to bear that in mind. So I suppose that would be one question. I wanted to go on. I'm really disappointed that Aware NI couldn't make it, because colleagues ahead of me have discussed the mental health issues. There's a lot of concern in the area that I represent, and I represent a number, I represent branches in the Department of Finance. But we had a horrific situation, a tragedy recently, where one of our colleagues decided to and took his own life. Now, he had been in contact with colleagues and with trade union reps in the run-up to all this. So we are very concerned about the effect and the trauma, there's no other word for it, the catastrophic trauma on those individuals who are left behind. If we look at the bigger picture, Northern Ireland has been, health practitioners and experts have been saying for 20 years that our mental health support programs are underfunded dramatically when you look at the rest of the UK. Studies have been done by University of Ulster and a separate study by Queen's University of Belfast that says the trauma that people have been dealing with, even in the years running up to the current pandemic, was horrendous, and that there was no meaningful, properly funded mental health or suicide awareness programs funded by Stormont and the UK wider government. I'm assuming this is more than the duty of care, but I was talking to another expert who said that the mental health trauma will really hit when the pandemic, when we're leaving the pandemic, and that's when people and reps and ordinary members in the workplaces are going to need substantial support. So, and I know NIPSA as a union will be arguing and campaigning for proper funding, but there has to be a duty of care on the employer, that we have colleagues and union reps, but ordinary union members as well, having to deal with these horrendous situations. Is there anything in law that can help us for those scenarios?
Well, I answer, Paul, how are you? I'll answer maybe the second part first before John moves on to the big gap that you've identified in the law in respect of unfair dismissal and the remedies that are available to a tribunal. The problem with the psychiatric injury claim, the potential problem is, as I said, everybody, whether they're in work or out of work over the last 9 or 10 months, their mental health will have been affected undoubtedly. That's going to be a big thing, and this is going to go on into next year, into the middle of next year or whatever. So to say that you sustained the psychiatric injury as a result of some inaction or failure of the employer is going to have to be very, very fact specific to each individual case. And I can see that there only will be a few cases arising. But I think going forward, I think it's going to be incumbent upon an employer to recognise, as we were discussing earlier, that a lot of its workforce are going to be vulnerable, are going to be damaged, their mental health is going to be damaged, and to pay due regard to that and to make sure that they have put into effect steps that we were talking about earlier for the forthcoming mass return to work, which will hopefully, or not hopefully, happen in the spring going into the middle of next year. So it's the same duty of care, duty to take reasonable care, but I would have thought that an employer failing to put into effect procedures for what's going to happen in 6 months' time could be deemed to have breached the duty of care that is owed to its staff. if you find that helpful, that comment.
Paul, if I could, I think you know me and you know my tone of phrase in relation to being direct with people. Basically, the law in relation to the reinstatement, re-engagement is crap. What you've got is a situation where the employer can simply ignore the tribunal direction to reinstate. And what that happens is the employer is going to be penalised by simply an additional value on top of the compensation determined by the tribunal. But what I have a more issue about is the insidious nature of the statutory cap in relation to unfair dismissal claims. Look, it's put in context now where essentially if you're sacked unfairly in the current circumstances where the amount of people who are going to be looking for jobs and the lack of jobs to apply for, you can expect a substantial amount of people having difficulty of gaining gainful employment within any kind of medium to long term period of time. It might be years, but the statutory cap that applies in relation to unfair dismissal claims is approximately 80,000. Now that includes the claim in relation to any pension loss, which a lot of public sector employees, when I deal with in the context of an unfair dismissal, forget about. They focus on the fact of what is my loss of earnings? What am I going to lose for the next year, 2 years? What I say to those individuals is that's the small beer for you. The big element is actually going to be your pension loss from a public sector pension, potentially into a scenario where you're going to have to obtain a job in a private sector employee that will act according to the bare minimum of the statutory protections in relation to pensions. So what I have more an issue about is the insidious nature of the cap in relation to unfair dismissals. The reinstatement re-engagement, look, you're not going to have a scenario where your employer is potentially going to be forced to take you back. You know, you think about the practicalities of that. You've been unfairly dismissed, you go back in, that relationship is gone. Is there really practically going to be a relationship that's going to be repaired going forwards to you to remain with that as an employee ad infinitum? I think more of the issue is about in relation to what I would say would be in relation to making representations as a trade union about why on earth there's a statutory cap that basically curtails what the full extent of a person's loss. And that's more clearly established in a scenario where the person, especially in the current circumstances, might be out of employment for a substantial period of time. Now, the other thing I want to turn to is the last number of speakers have talked about maybe something that I hadn't really given proper consideration to is the mental health aspects that are effectively happening to people on this unusual period in everybody's life. What I want to do is just bring it back to a wee bit in relation to what protections the law affords you in relation to the employment sphere. Now, the argument would be there is protections under the Disability Discrimination Act 1995, but that requires the person to be disabled as defined what's required by the Act, which is the perception of danger, the ability to communicate, learn and understand, and the ability to have social, basically social relationships. If you are in a scenario where you think that you come into that label or potentially come into the label, there's nothing to stop you making representations to say, look, I'm disabled, I want to have reasonable adjustments. Those reasonable adjustments I think I need would be maybe I'm redeployed because I don't believe my mental health is being affected by the job I'm in, or it's a situation where some accommodations within the workplace or sort of shifting or of hours. Reasonable adjustments is exactly what it says on the side of the can. It allows you to ask your employer, in the circumstances where I'm disabled, I want to have reasonable adjustments to remain in the workplace. Because essentially the outworkings of that, if I don't have those reasonable adjustments, could potentially be people who are disabled being pushed out of the workforce, which is what the Disability Discrimination Act 1995 is there to protect that outcome. So the only point that we make, maybe coming back to a more arguable stance, a more tangible way to make representations, is by talking to your members if there is those circumstances where you can make that argument about the perception of danger, the ability to communicate, learn and understand, the ability to form social interactions, that might be the grounds. But even if not the grounds, or you suspect maybe there's not enough to have the person being disabled as defined, it's notwithstanding that, it's appropriate to make potentially representations to say, look, these circumstances, the person needs some help. then what that does is that leads into potentially what Viv is talking about in relation to the potential for personal injuries action in relation to the mental health aspect. Because what's required in a personal injury case for psychiatric injury is the foreseeability of psychiatric injury actually being at risk. So what you could do is say, look, unless we do something for this person, this is going to be the deterioration or the exacerbation of the underlying mental health concerns. And you back that up by asking the member to say, look, go and see your GP. See whether your GP will give you a letter saying that to whom it may concern, that there's a foreseeable risk to this individual of deteriorating or exacerbating their mental health or creating a mental health aspect. In those circumstances, it's like literally handing then the ball back to the employer. We're giving you knowledge. We're putting you on formal notice through your representations as a trade union official for this individual, acting in the best interest for this individual, saying you've got a duty of care to this person. And unless you address that duty of care, unless you take preventative action, unless you resolve the issue that's going to exacerbate or give rise to mental health aspect, what will happen is essentially you'll ignore it. Then we'll be coming back in 6 months, a year's time, but the people who will be coming back won't be me to try and resolve it. It'll be the people who will be coming back will be the lawyers. So hopefully that fairly extensive.
Thanks, John. I'm even more depressed now because I knew people didn't have the right to reinstatement, but I didn't know there was a statutory cap even on the amount paid and for unlawful dismissal. So again, it's a disgrace on every political party who sits up on Stormont, but that is the situation that's facing trade unionists in Northern Ireland. Thanks for your answers. Thank you.
Look, it's a devolved issue. It certainly is something that says appropriate to make representations, but the bit that public sector employees forget about is the fact that WICS makes up the substantial element in any unfair dismissal, which is the value of the public sector pension that they have. And if you have a situation where you have a 50-year-old who's made contributions for 20 years and suddenly he's going to end up in a situation where another 16 or 17 years are going to be lost, you can imagine the significance of the impact that's going to have their pension in relation to pounds, shillings and pence. And then you can expect that very quickly that cap to be reached past ages ago. So that's more, from my point of view, insidious in nature of the protections that affords. On first sight, you've got reinstatement and re-engagement, but it actually doesn't mean that because the employer can ignore that. But worse than that, even if you go through the most horrendous dismissal that doesn't have any relevance in relation to discriminatory dismissal, but is just horrendous on its own merits, I don't like you, get out, or you treat a person abominably just because you don't get on and you sack that person. The fact is that no matter how badly you dismiss that person, the worst case scenario is employer facing the liability is capped at 80 grand. I think that is more insidious.
Thank you very much, John. I appreciate that. Paul, you've raised some very important issues, and I want to just reiterate again, Paul, not just to you, but to everybody, aware Northern Ireland will be coming back. They're very disappointed they couldn't do it today, and I think we've heard clear, strong, unequivocal evidence that the mental health aspect of this and the psychological and the emotional impacts are vital to us. And I think we'll bring the same numbers back again for maybe a half-day seminar, mix it in with something else. But certainly I promise you, we're going to look at that. I'm going to take a 5-minute comfort break because there's 6 or 7 people who still want to talk. On the basis, Viv, that you've already alluded to the fact you aren't in court, you're not busy, I'm hoping that you can hang on with us for another half an hour or so, because I think this debate has been very useful. So if that's, thank you. So everybody take 5 minutes, stretch your legs, and we'll see you back here. Thank you. Hello, welcome back. We have a number of speakers. Thank you for your indulgence, John and Viv, really appreciate it. I'm just going to go through the list now and hopefully get some particularly difficult questions. Can I call in on Patrick Mulholland, headquarters official? Patrick?
You want to take two and bring them in and two? That's the way you're going to get through it. No?
Thank you. That's you, Patrick.
Thank you, Brian. Well, just want to make a couple of points, comments, and a couple of questions as well. And I think first of all, it is important that we consider how the public discourse has developed over the lifetime of COVID. And if people remember in the early stages, there was a great deal of talk about we're all in this together and applause for essential workers, essentially. Alongside that went severe neglect of the health and safety of public sector workers, and also, frankly, in Britain and Northern Ireland, neglect of the public as well. And so we now are in a region that has one of the highest levels of death rate outside of America, an extraordinary situation. So if we're thinking about the real situation from the point of view of public health and the point of view of the safety of public service workers, it is writ large that they have been neglected to the point where it is abuse. And that, I think, has to be the starting point of our discussion, even around the legal issues. I think we can reasonably say that we have a grossly incompetent and a grossly corrupt Tory government, and we have at least an equally incompetent subcontractor in the Northern Ireland Assembly that's largely implementing the Tory government's policies on COVID and COVID-related safety. So what that means is that safety has become a secondary issue to cost. Viv made the point, I think it was Viv made the point about the safety legislation as being based on what is reasonably practical. And what that really means is that the employer is given license to largely do what they want on a cost basis, that can push back on most safety legislation. So I think we need to take that into account when we're giving consideration to how we address this going forward. And I must say, I think the points that John and Viv both made, if I have understood them correctly, and I'm very happy to be corrected if I've got any of this wrong, but I think they are very important points. I think firstly on the health and safety law, and particularly around the law, the ability of workers to withdraw their labour in a situation where they feel they are unsafe. That law is not particularly worker friendly, and it's important to understand that. It's actually written in a way that's quite confining for the workers. It creates a situation where they have to be very clear, or we have to be very clear about almost an imminent threat or an imminent danger to them before it is reasonable for them to withdraw. I think the other point that is extremely important, and if I have understood this correctly, and again, open to correction on this, is that it's not a collective right to withdraw your labour under health and safety law. It's an individual right. And from a trade union point of view, that is an extremely important distinction. And it has to be said, at certain points during the COVID crisis, I think some people in the movement have been slightly wrong-headed about this and have had an over-reliance on health and safety law as the basis for people withdrawing their labour in the workforce, in the workplace, when they thought they were in very dangerous conditions. Now, it did happen in some places, such as meat plants, such as the post office, etc., but I think in all cases that they wouldn't really have wanted to be testing that to the nth degree through cases or anything. So I think there was an over-reliance on that. And in fact, it weakened the position of the unions, and it weakened the position of workers in the sense of how they could respond legally when they were faced with very, very serious issues. I think the second point is around the personal injuries claim side of things. And I suspect we are only at the beginning of that process, because the personal injury claims really are now arising as we move out of the first more brutal phase of COVID, if you want to put it that way, and the impact is more obvious. I think we're going to have obviously, there'll be the issues around people who got COVID, but then people have and very well developed the points around mental health issues, etc., etc. My view is that it would be hugely beneficial to the trade union movement to see an avalanche of personal injury claims, good personal injury claims going through MTB, and for us to be winning them hand over fist. Because every personal injury claim that's paid out by an employer or paid out by the government reinforces health and safety laws, such as they are, but it also creates an impetus for government to introduce stronger health and safety law, because the only thing really that makes them do so, apart from trade unions fighting the battles that they fought in the 19th and 20th century to enforce them, is cost to the employer. So I think we should be encouraging personal injury claims left, right and centre, obviously not creating an avalanche of pointless claims to MTB, but I think we certainly should be encouraging as many claims as we possibly can. And then the third string to our bow, one that maybe has been neglected a little bit, and maybe John and Bev could touch on it, is this question of industrial action in response to health and safety issues and in response to particularly urgent health and safety issues. Again, my view, we should not for 1 second shy away from taking industrial action, either to make employers carry out at least the minimum that the law allows, or to force them to go further than the law allows. And in fact, I would go further than saying, that obviously we'd want to do that, and all unions would want to do that within the law, but we should go further than that, and we should clearly state that in life and death circumstances, NIPSA as a union would be prepared to call its members out on illegal industrial action, because sometimes that's the only option in front of you. And I think the COVID crisis actually indicated how that is a possibility. So if we can give a concrete example, if we were faced again with what happened in care homes 9 months ago, the devastation, the destruction of human life that took place in Northern Ireland's care homes, if we were faced with that again, would it be justified morally to call people out on strike and say, enough is enough, this has to end, we have to end this abuse of a generation, an older generation of people who are not being protected, they're not being looked after, while all those protections were there to be had. It was a conscious decision by government not to put the protections in place, and something should have been done to stop it happening at that time. Now, we were overwhelmed at that time because COVID was overwhelming everybody. But now, if it happened again, should we take action that actually would take us to the point where maybe we would have to step outside the law? In my view, we should. We shouldn't seek to step outside the law, but we should not shirk stepping outside the law as well if it is necessary to protect human life. And the reason I make that point in the context of this discussion is because the reality for a great many of our members, the day-to-day reality of their work life is not, it's not a work life where their fundamental health and well-being and their life is at risk. But for certain sections of our workforce, that is the case. And COVID points towards, that being a possibility as well. So we have to be prepared to say we will go further than the law allows to protect our members and make sure lives aren't lost. I suppose I need to sort of throw a couple of questions in here as well, just to concretize things. One is around the issue of professional health and safety advice. We have very, very many people, very, very many health and safety reps in our ranks who did a brilliant job during COVID, did a magnificent job. Different numbers in different areas of the union, etc. But I think everybody would agree that there was a dearth of, the high-level professional information coming through that maybe would have given a cutting edge to us on some issues, and perhaps would have speeded up our response on some issues, and maybe would have added to the weight of what NIPSA was able to say around health and safety advice. And I'm just listening to what John and Viv are able to say around the legislation. Would it be possible, with that in mind, for us to consider another seminar that maybe would go into the legislation, how it would be applied, how we work our way through all of this in more depth, perhaps even a day dealing with the law solely on its own around health and safety, I think would be useful. And then the other question that I would ask as well is around the personal injury claims process. Obviously, there's a danger coming out of COVID that we have a flood of them, and we don't really have the capacity to deal with them. I think it would be useful if we could maybe begin to engage in a discussion about how we could streamline the process to make sure that, first of all, it's worthy cases that get through, but secondly, to make sure there's no sense amongst our activists that there's a blockage on taking cases forward, because sometimes just the bureaucracy of moving cases forward can create that sense of there's a blockage, and we don't really want to be in that position, because we do need to hammer this nail home if we are going to, you know, improve health and safety for workers going forward. Just, that's me, Brian. Thank you.
Thanks very much, Pádraig. Lads, I'm going to hold you. I'm going to take a couple of speakers in the time. I know that's comprehensive and a couple of questions. I'm conscious of the time and I want to try and bang in. So if people can, if you two can think of the questions coming back, and I know they're significant there. Naomi, one word: brevity. She's nearly in.
Yeah. Can you hear me okay? Yeah.
That's you now, Naomi. Yep, work away.
Okay, I just want to say that in relation to information about health and safety and legislation, the ICTU have been running online seminars since April and May, which look specifically at the legislation of what to do in the workplace, and things like, you know, how, if you are in imminent danger, how you should go about leaving your workplace in order to protect yourself as a worker. So quite a few of those have been run by ICTU since April and May time, and they're ongoing. And on Wednesday, the 9th of December, John Hendy QC and Casey Jones from the, Carrie Jones from the Institute of Employment Rights are hosting an event for the Belfast Trades Council. And it's looking at those issues, returning to work and safe workplaces as well. So I just wanted to plug that because it's been quite topical today. My question is specifically in relation to statutory sick pay, and whether statutory sick pay can of itself be viewed as a detriment when it comes to dealing with people with disabilities in the workplace and reasonable adjustments. The reason that I'm posing that question is because many of our members were forced to shield. And that is obviously something which had to happen. They were forced to shield because of a health condition or a disability, or in other cases for other reasons. But a cadre of those members were forced onto statutory sick pay. So they couldn't attend the workplace. They weren't furloughed, either because the employer didn't wish to furlough them, had to replace them, or simply just didn't want to be bothered furloughing them. So for a substantial period of time, and even for those who had to go on to extended shielding, those people suffered quite a significant detriment because they were within a matter of days put on to £95 a week from their normal earnings. So my question is there, given that this would affect disproportionately people with disabilities, and I take John's point that some of this has to be bottomed out in emerging case law, but is there an angle for disability discrimination for those people who were forced to shield and have not, have encountered substantial material detriment by way of that reduction? Or would it be likely that the courts would view, the 95, 85, whatever it is a week, as reasonable when it comes to covering that detriment? I mean, the arguments are there for, the fact that the moral and financial implications are sort of far-reaching, and it's inadequate. But I'm just wondering if that's something which is likely to be explored when we emerge from COVID. The issue itself of statutory sick pay and the fact that some people were forced to go on to statutory sick pay, because the reality is they weren't sick, they were shielding. They weren't actually sick. And also moving forward, if those people were to be off for another reason in the near future, their statutory sick pay may indeed be exhausted, or their sick absence may count. The period of absence may count towards future sick absences as well, and they could be penalised for that financially and in other ways.
Okay, thanks very much, Neil. We appreciate that. Gentlemen, if you wouldn't mind answering the last two the two persons' questions, and then I'm just going to tell you, I'm going to take the last 5 speakers from there, taking no more. Helena, John, Francis, Damien and Marta. So if you can prepare yourselves, bear in mind the time, folks. If we can, your answers can be as long as I like, gentlemen, but if we can keep the questions a little tighter. Thank you.
But I'm going to put John's chomping at the bit here to deal with Naomi's query, I think. But in relation to Patrick's, what we were talking about there, about the, employment law definitely needs to be strengthened up, and a lot of the legislation in place to protect people in the workplace needs to be strengthened up. But I would make the point that a lot of the legislation is there, but it's not been abided by the employer. I think that's a very important point. A lot of the employers either are willfully ignoring it, or secondly are ignorant of it and ignorant of what their duties are under the legislation. That would be my opinion of it. We wouldn't be in business to a certain extent if employers were abiding by their duties, common law or statutory. We wouldn't be any cases if the employers were doing what they were supposed to be doing. And that's why we're here. We're meant to be providing a buffer between the employer and the employee, and making sure that the weight of the law is imposed upon the employer. So what I would say is that certainly there are gaps, but a lot of the stuff is there, but it's not being abided by the employer. In relation to industrial action going beyond what is lawful, I'd make no comment on that, if you don't mind. But obviously we wouldn't be advising any client to breach any law, whether it was a good law or a bad law. But morally, I know exactly where you're coming from. And in respect of the statutory sick pay, I will hand on to someone who actually does know what they're talking about, which is John.
I think, Patrick, you know me in terms of speaking truth to power, if I term it in that fashion. The position is, the advice to NIPSA definitely would not be to act in breach of its lawful obligations, because the whole point of complying with the TULCRA is essentially it affords NIPSA the immunity and affords individual employees from protection under the law from being dismissed because they're breaching their terms and conditions of contract. That fundamentally is the protections that are afforded both to employees and also to the union. If it's a situation where you act outside that lawful process, then effectively the exposure is there to both the members to be dismissed in a fair manner, and for the union to lose its immunity in relation to potentially being sued, and also more than likely injunctive relief being pursued by an employer to prohibit that industrial unlawful action occurring. So my point in it would be, unfortunately, the advice would be very clear in that respect, that I wouldn't be advocating at all NIPSA to act in breach of its lawful obligations. But I accept wholly, and I want to make that clear, I accept wholly and agree that irrespective of the lawfulness, there's also a morality issue here. And I think it's a situation where that point was being made very clear by yourself, Patrick. But that would be my view in relation to that issue. Also in relation to the wider ambit of a trade dispute that maybe it was, you heard me talking about earlier. That's very, it's a broad brushstroke, but arguably the position would be in relation to work that it could come under health and safety in relation to being within the ambit of what is meant by a trade dispute. But the whole point is then you have to go through the protocols required, your balloting requirements, everything else, your vote, your scrutineer's report, everything in compliance with its obligations to allow you to participate in that. That's very different than to what I was talking about at the start of the presentation in relation to the protections afforded of Article 68. And you can see why the association tried to sidestep its prohibition on being able to take strike action by using Article 68, and that's why the case law clarifies the position in relation to Article 68 that it's an individual choice to be made. Turning then to the issue in relation to statutory sick pay and sick pay, effectively, it sounds unfair, but your contractual position is regulated by your terms and conditions of contract. If it's a situation where but equally there is an ability to articulate an argument that the whole point is the employer should make a decision, which it's encouraged to do, to look at putting an individual on furlough. Essentially trying to pressurize a person into a scenario where they're in financial Armageddon, because essentially you're caught between a rock and a hard place. I can't afford to live if I go on statutory sick pay, but you're asking me to come into work and risk my life, effectively. That's the predicament you want to be in. But then what you would do in those circumstances, if it was that fundamental, then you go and rely upon Article 68 and you rely upon the protections in terms of detriment. I have been detrimentally treated in that I made representations and you decided not to put me on the furlough scheme, but essentially to expose me to a financial position where you wouldn't wish it on your worst enemy. Now, expanding slightly beyond that, my view in relation to anything in relation to adjustments on a DDA basis is that that does require a degree of exceptionality. And in my view, the case law is clear in relation to that, that unless there's some degree of exceptionality, that is a reasonable adjustment that an employer should consider putting a person on a full contractual pay as a reasonable adjustment. I simply do not view that that is the case law where it is at the moment. Now, I accept there's a moral argument and people are entitled to make the argument and also be entitled to have that case determined ultimately by a tribunal and whether that was or was not a reasonable adjustment that should be accommodated. But my position on it is that the law, from my point of view, is clear that the degree of exceptionality that's required to surmount that threshold is extremely high, and that's the way I would put it, because otherwise you're getting into situations where I don't want to, there is other issues involved that are fact sensitive to each case. But hopefully that addresses both your questions, Padraig, and also answers your questions, Naomi.
Thank you, John. Thanks.
Thanks very much. Thanks very much for that comprehensive response. Moving swiftly on, Helena. And if the others, I'm not sure, Conor, can you line the others up to get ready to come on so it's a wee bit quicker? Please, if that's possible. Thank you. Helena, are you engaged there?
Hello.
That's you. I can hear you, Helena.
Yeah.
Work away.
No, what happens is they knock us off, so they do when we're trying to get on and they restart us again. My question, which maybe was appropriate earlier, but I did have my hand up for some time, is regarding the health and safety legislation. It is clear to me it is not there to the protection of the workers, but the employer. And Viv, you said earlier at the beginning of your speech, reasonable steps, and this is just a proof of it. And I'm going to use education because the majority of the members here have had children or have been a child in school scenario, that when all schools went back in September, and some of our schools were operating throughout the COVID issue because of key workers, etc. But when we went back to schools in September, management of schools said no to any masks. We didn't need masks. We didn't need masks on buses, and we didn't need masks in school. Now, my personal opinion is this: it was all money linked. Because if they had deemed it in their health and safety risk assessment that masks was needed, then they had to provide it. Now, that has now changed. Masks on buses, masks in certain schools and certain classrooms, masks with classroom assistants working with children closely, and masks all in common walking areas within schools. So, what can we do there as a trade union? Because after all, Maggie Thatcher's law hasn't been enforced in here regarding trade union issues. So we should it's now a devolved matter, and we should be pushing a trade union law regarding all of these issues, just not health and safety, but a lot of other issues. And I would like your opinion on that. Thank you.
Thank you very much, Helena. As I said, a lot of the health and safety legislation, there are gaps in it. But in my opinion, and having worked in this area for 30, 35 years, thankfully a lot of the legislation is in place, and a lot of it did come from Europe in the early part of the 1990s and imposes you were talking about the duty to take reasonable care, but also in certain circumstances imposes a strict liability on an employer where the employer can't escape in some of them. But you know, I can discuss that with you separately if you wish on another occasion. But you know, a lot of the points that you've raised, in my opinion, are absolutely genuine grievances, but probably belong within the sphere of industrial relations and not the law. But sometimes the response of the employer in that type of situation will create a legal cause of action. If the employer, when you have brought something to its attention, has failed to take all due care and due regard to what you have said, and somebody has subsequently suffered a detriment as a result of that, that person then would probably have a stronger case because of the fact that you had intervened on behalf of the workforce prior to the detriment taking place.
Yes, but then, for example,
I don't know where that.
Pardon?
I'm not sure that actually deals with your query.
Yeah, it's the issue that, you know, where it was very clear to everybody, if you worked in a residential home, you had to have a face mask on. Where you're up close working with a pupil who are carriers, we all know that children are carriers of it. They may not be, they may be asymptomatic, and thankfully they're not affected badly on this on the whole. But that scenario between a home care, a hospital, and a school, and we went to management side and stated the factor that we were deeply concerned, but it took them a period of time, and I do believe they were lacking in the time frame, and that if members got COVID, and I know that's another issue of how you prove where the COVID was actually got from, but now I can clearly see it within schools. You see within a couple of weeks 4 and 5 classes, members of staff and pupils in 4 or 5 classes, you know, a knock-on thing that they are going off, the classes are closing for 14 days, isolation, etc. So it's that how liable is the school, EA, Stormont, etc. Because if the money was there to give proper protection, and I'm not talking about the masks that we can buy down the town for, you know, 55 or for 10 of them or whatever. I'm talking about proper masks, which only our staff who are dealing with aerosol issues within special schools are getting those completely fitted for them. But it's the general classroom assistant, the member of staff that's working closely, and it's not only in education, other people will have it in other areas. I'm sure the social workers, you know, going into households, etc., having children in their car because they have to lift the children out of a home for particular reasons, would all be affected by this. And then the link back to Maggie Thatcher law, how do you think we could progress this with having a devolved matter here?
Once again, that's a matter for representations to be made to your venerable elected representatives. You know, and you know, if it's a devolved matter, it's open to Stormont to enact the legislation. But whether or not we can't really get them to do anything. Well, sorry, I'm not going to start entering into that sphere. But it's hard to get.
Be here all day, couldn't we, Viv?
Yeah, but it's hard to get them to pass any legislation on any issue, and there's a number of issues in relation to the administration of justice that we would like them to deal with, you know, which is clogging up the system as well. But the face mask issue is an interesting one, because undoubtedly a lot of the face masks that we're using perhaps are not protective of us. You've alluded to more high grade type face masks. Normally speaking, cost and expense at that level would not an employer with the defence. But I would have thought that some people who are forced into the workplace, who have complained about not having proper protection, including the masks, they may, if they subsequently contracted COVID, as you quite rightly say, you wouldn't be able to necessarily prove it that they got it in the workplace, but they could possibly claim a psychiatric injury. If they had a psychiatric injury, they could claim that that was a result of the negligence and breach of statutory duty of the employer, because the employer had failed to provide them with proper protection in the workplace. That is a possible, and I underline possible, that's a possible route for bringing a personal injury case. But in relation to the union forcing the employer to do that, you just have to keep hammering away, and that hammering away will provide traction to future personal injury claims down the line, because the employee will be able to say that its representatives made these representations to the employer, but the employer failed to listen to them or to implement proper health and safety procedures and practices in the workplace.
John, thank you.
Okay, Helena, thank you.
Maniwa? John, are you speaking there?
Yeah, thanks, President. Hello, Viv and John. A couple of points there to make. I suppose, firstly, could I just commend Deborah, Geraldine and Jardette for raising the issue about reconnecting again, getting people back into work. And certainly it's raised for me consideration of risk assessing the individual who is coming back into work, particularly if they have underlying concerns in relation to their mental health. But I want to take you back, Viv, way back to the beginning when you made your presentation in relation to risk assessment at home and the right to a private life and surveillance of people in their home if they're at work. In relation to what sort of legislation is it that protects people, albeit a well-meaning manager phoning up to see how you are or being viewed on a camera on a laptop, and if someone else that lives in your house, they view it as being overly intrusive. How does that, how do these things all impact on home workers? And
first of all,
the third and the final point, sorry, I just put them all together in one go so you can be able to answer them. In relation there to Helena and the concern about face masks and face coverings, my understanding is that face masks is a terminology that's used in the clinical setting, and that face coverings are used in other public areas for public transport, where it would be where you're expected to wear it. You could face a fine if you didn't have a reasonable excuse for not wearing a face covering, whereas face mask would be in a clinical setting. So that was the 3 points I wanted to make.
Thank you, John.
In relation to, it's a very good point you made about the home worker, so to speak. If you remember, I said that now in this new environment that we're living in, your home is now potentially a workplace and would be deemed to be a workplace by the legislation and by the courts ultimately if it came to the hearing of a case. But you made the point about right to privacy and whatever. The Human Rights Act and the European Convention of Human Rights, every citizen is entitled to have a private life and has a right to enjoy privacy in their home. But it's a very interesting point about if an employer or a line manager was making some point about what he or she discovered that had happened in that person's home. There would be a whole debate about was it the workplace or was it the home? Was it the private life? Was it the public life? Was it the work life? And you're right that there could be a few speed bumps ahead of us in relation to that. It's a very, very good point that you've raised, and it's a point that I can't give you a specific answer, but potentially it's an opening there for people to rely upon the Human Rights Act if the employer decided that there had been some transgression by the employee that happened in the workplace, being the home, and what rights does that person have, as you say, to privacy, whereby the employer could be looking down some sort of camera at all the events that are happening in that person's home. Should the employer be going out to that person's home, once again back to what we were originally saying, to make sure that the space that they were working in was entirely suitable for a workplace and it didn't impinge upon their private life? So that's a very, very good point. In respect of the face masks, once again, it's just, I was talking about the provision of health and safety equipment. There's going to be a whole legal, medical, scientific debate about these face masks. The high-level clinical grade face masks that I think are used by nuclear scientists it's probably not appropriate that they're issued to all members of the public and all staff members, but there has to be some sort of middle ground here. The other bits are just as the people using in the workplace or in other environments are no better than toilet roll as far as I can make out. And the doctors would say they provide that there are no protection. So face masks or face coverings, if they're going to be, if there is a requirement to use them in the workplace, the employer should at least have the decency to provide proper equipment, I would have thought. What legal cause of action that would give any individual employee, I'm not entirely sure of at the moment, but if that person did sustain a psychiatric injury as a result of the employer's failure to provide proper equipment, there could be some traction in bringing a case like that.
Thanks very much for that, Ben.
Thank you, John. That was great. Thanks very much. And I appreciate your indulgence, gentlemen, in terms of the time running on a little. So what I'm going to propose is the last three speakers will all speak and ask you your questions, and then you can come back to them. So could I call in Francis Doyle, branch 111, Damien 730, and Marty McKee, General Counsel, are coming after that, and the lads will line you up so that you're ready to go. That's you now, Francis.
Okay, Brian, as you say, brevity is a key point here. Just a couple of points and then a question. My branch, as I said earlier, is branch 111 Road in DFC, Department for Communities, and we straddle two buildings. We have nearly 150 members, and we are only 3 reps. In the 3 reps, 2 of us have experience of having skills in the area of mental health first aid. I'm an assist trainer and a mental health first aider, and my colleague Emma is a fully trained counsellor. And we have had a number of occasions, especially since the start of COVID, where members have come to us with mental health issues, and others are regarding health and safety issues in the workplace is causing them undue concern. I have asked the question locally, can you tell me what is the law with regard to first aiders in the workplace? I was under the impression that you had to have a first aider present pro rata to the number of staff in your building. And I've since been told since COVID came in, there's been a clause written in that you do not have to have a first aider in the building as long as somebody is close to a first aid box. And if somebody needs help, you can ring an ambulance. So no first aiders in the workplace. And a second point, maybe for General Counsel to take forward, would it be possible, given long COVID and the fact that the majority of our members have issues or they know of somebody who has a mental health issue, would it be possible for General Counsel to take upon the idea of mental health first aid training for their reps, because it would help us in dealing with our members? Thank you.
Okay, give us on there, Marty. That Connor.
Same. Hopefully, guys, you can see me and hear me. Okay. My question is a wee bit sort of complicated, because one of the things around COVID, it connects with some of the things that have been spoken about, and particularly Patrick had made a point earlier, and other people have indeed made a point around health and safety, but around personal injury claims and issues like that. But the problem within the health service has been, if we think back to March and where we are now, the guidance in terms of what trusts have been instructed to do has been constantly changed. So it has. And I'll give you 2 examples of that. Back in March, the chief medical officer said, and he was on the TV and said this, that residents and staff in older people's homes did not require any PPE. A few months after that, NIPSA, my health colleagues, we were in discussions with the Department of Health, who issued regional guidance in relation to residential childcare. And we were firmly of the view that this guidance did not go anywhere near far enough and should have been much more prescriptive in terms of young people, some young people who would weaponize COVID against staff, and subsequently in a lot of residential facilities in childcare, we have had crises with numbers of staff out at any one time. And so we're now in a position where we may be clear, but one of the things that has come through to our branch is members who have been off sick for some considerable time, the number of people who are getting knocked back for medical ill health retirement, and the correlation of the two, because because the longer term impacts of COVID in terms of people being able to return from work who have had COVID and were exposed to it in work isn't actually known. The question sort of that I have is, where does actual responsibility for that lie? Because in health, the trust takes direction from the health minister and the Department of Health. It's told what to do. And also you have the likes of the PHA, which sits within the health system and also makes recommendations to, or certainly will issue guidance or recommendations. I know there's a difference maybe between the two, and between that and being told what to do. So where does the responsibility that if someone wants to take a case lie? Because the trust can say, it actually wasn't us. We were told to do that from the Department of Health, because you have that evidence from the Chief Medical Officer in relation to that, and you have the Department of Health telling trusts what to do in relation to very specific circumstances. And this is the concern now of a lot of health members in terms of potential longer term exposure of the outworkings of COVID when they have come into contact with that, and what would be areas which would be considered have very high exposure. I hope that makes sense.
So there's another question.
We're going to, thanks Damien, that was very sensible and it does make perfect sense. Just going to let Marty come in, Viv and John, and then that'll be your questions finished and you can answer them sum up for us, please. Thank you. Marty, hopefully they've got you.
Thanks, Brian.
There you're in. You're in, Marty, work away.
Thanks, Brian. As is my wont, I'm going to start by interjecting a wee note of cynical criticism. At the end of it, I do have two questions. One's semi-rhetorical and one's quite pertinent. So I hope to be brief. Right? I've listened today, and despite all the earlier self-congratulatory virtual slap in the back saying how good we all were during the COVID-19 early stage of pandemic and the putative good work of our full-time secondary officials, I have to say that whilst I acknowledge that some of those have done sterling work, by and large, others have been conspicuous by the absence of the matter, and we've been left to plough through a legal minefield on our own. I'm mindful of the other contributions from those members who are working from home and those members who are in work. It could be argued that unions in general, and certainly NIPSA in particular, have facilitated a process whereby members, certainly within the DFC and benefit delivery aspect, have been encouraged, and I'm hesitant only to avoid saying the word forced, have been encouraged to return to work sooner than is reasonably practical, and especially given that current executive advice remains that where possible, people should work from home. And I'm also mindful and cognizant of the advice that John and Viv gave about Article 68. So in light of it, you could argue that this decision, which has been facilitated and signed up by NIPSA, places individual members in the individual's position of being potentially subject to sanctions and discipline for refusing to attend a workplace wherein their safety cannot be guaranteed, and further impose upon them the personal onus that they have to then invoke Article 68 and find out for themselves, because as Patrick said earlier, it's an individual, not a collective right. And therefore, would the two gentlemen agree with me, and they don't have to, it's not compulsory, would the two gentlemen agree with me that members would be better served by a cohesive and comprehensive commitment that should any such member find that he or herself in a position where threats of discipline are being issued, that they will be guaranteed to be fully and unequivocally protected and represented, and they won't be left to their own devices or to the vagaries of interpretation of this order by local managers. And I say this because certainly within Castle Court, wherein I'm largely based, we felt managers, individual managers, threaten to take leave of a discipline staff who have invoked Article 68. And my second question, which is slightly more pressing, and again, it's in light of guidance issued by NICSHR in relation to annual leave carryover. And could the two gentlemen give me an exegesis of the amendments to the Working Time Directive and how this prevents or enables any member to carry over more than 9 days? Thanks so much, gentlemen.
Thank you, Marty. I'll deal perhaps, if you don't mind, with the first couple of queries, and I'm going to hand over to John in relation to the Article 68 issues raised by Marty. Francis, in relation to, I hope I got it down, but one of your primary concerns is in relation to first aiders. I can't point you to the exact piece of legislation, but there is a requirement on every employer to make sure that there is a first aider in the workplace, and I know that from in here that there is a requirement, and for an employer to vary that without good reason, I would have thought is illegal. What cause of action that raises or gives to an individual employee, I just don't know, unless they've suffered a detriment. You know, it would be a genuine grievance, but it doesn't necessarily translate itself into a cause of action. But it is certainly something that it would be reasonable for a trade union to raise with an employer. Any attempt by an employer to evade or water down the impact of the legislation by reducing levels of first aiders or first aid kits within a workplace would be totally unacceptable in this day and age. And in fact, that should be reported to the Health and Safety Executive, and they would possibly consider a prosecution against the employer for failing to abide by the legislation. A lot of people do get confused about the Health and Safety at Work Act, or the order as it is in Northern Ireland. It is actually a piece of criminal legislation largely. It isn't a matter for the civil law. It has an impact on personal injury law, but it's actually a piece of criminal legislation where the government has set up an agency which is empowered to prosecute employers for failing to abide by health and safety legislation. So it is a very, very important tool, and it is open to the trade union to make a complaint to the Health and Safety Executive where appropriate. In these circumstances, you hear cases, unfortunately, they involve largely tragic cases involving death in the workplace where an employer is prosecuted and heavily fined and sanctioned by the courts as a result of prosecutions being brought by the Health and Safety Executive. But they also have a statutory duty to deal with sort of more minor infractions as well. Okay.
Thanks, Viv.
Okay.
What I'd actually been told was I knew it was in law that there had to be a certain number of first aiders depending on the number of staff on site. We're a multi-occupancy building. DFC, Career Service, DFI, we have a number of departments within the building. But what I was told by the premises team was that there's no need to have a first aider on site. As long as we have first aid box, if anybody gets sick, sure, just lift the phone.
Well,
to me, that's totally wrong.
Yeah, well, if you'd like to maybe send me an email, I will make sure that I come back to you chapter and verse on it. As I said, I can't quote you the legislation straight off the top of my head, but I will be able to find the answer for you. Okay?
No problem, Viv. Thank you.
No, and in respect of Damien, to paraphrase Damien, where does the responsibility lie if somebody's off work for a long period of time and the employer is chopping and changing its policies throughout the course of this pandemic? The first thing I'd say is this duty of care that we were talking about earlier, it is non-delegable. In other words, an employer is not entitled to delegate the duty of care that it owes to its employees to third parties, whether that's the public health agency or an outside contractor who's brought in, whether it's a cleaning company or some other services company. They're not entitled to absolve themselves of any responsibility by saying, "Oh, we handed that over to the subcontractor or the public health agency." The duty of care remains, and it's constant, and has to be abided by the employer. So they can't subcontract their responsibilities to outside agencies. The duty of care is owed to its employees, and certainly an employer is entitled to change its policies and practices due to the prevailing situation, or as the law changes as we go forward through this pandemic. But at all times, the duty of care is inviolable, and it has to be abided by the employer. These people who have unfortunately contracted long-term symptoms of COVID, they obviously may not be able to prove that they contracted the disease within the workplace, but they certainly have to be treated with kid gloves, as we were talking earlier, by the employer, because if they were not and they felt under some sort of pressure from the employer, it may well be that they would be able to bring a stress of work negligence, a breach of statutory duty claim against the employer. But as I say, and I qualify nearly everything that I've said, each case will turn on its own set of circumstances. And hopefully that's dealt with Damien's point. Over to Marty's point with John about the members and Article 68, and John dealt with that issue in his presentation, so I'll leave it to him.
Marty, in relation to the protections that NIPSA will afford members, that will depend upon the merits of the genuine and reasonable belief in relation to their refusing to go to work or remove themselves from work. What I will do is what I always do, which is provide the objective advice to the General Counsel to consider. And if my views are that there is a case, then it will be a matter entirely at the discretion of the General Counsel whether it supports those cases. But the law does afford those protections in relation to detriment and/or unfair dismissal in the circumstances where a person is treated in a detrimental fashion because of refusing to go to work or leaving the workplace. In relation to the issue regarding annual leave, the Executive has introduced the legislation to allow the carryover of annual leave for the next 2 years. Also, as a note of caution, the law does afford the employer the ability to effectively compel people to take annual leave. And the obligation is simply to give twice the length of notice in relation to the period of annual leave that the person is being compelled to take. So, for example, if the employer was deciding we're going to put John McShane on annual leave, we're going to put him on annual leave for 2 weeks, what they would need to do is give me notice of 4 weeks to that effect. So they can compel annual leave to be taken. The only issue that I would point out in respect of that is there's some ambiguity in terms of the developing case law, whether a person who's compelled to take annual leave, for example, in a harsh lockdown situation, is effectively amounts to rest. Annual leave is for an individual to take rest, to take a break, to avoid the strains and pressures of the workplace. If effectively you're being placed on annual leave, but you're being put in a position where effectively you can't leave your home because you're in a lockdown situation, arguably that position is not genuine rest. And in those circumstances, there is an arguable case to bring against your employer that you may be compelling me to take this annual leave, but it is certainly not effective annual leave. And in those circumstances, I do not accept, but you're compelling me to absent myself, but I'm going to be pursuing tribunal proceedings in respect of what you contend to be annual leave. I dispute amounts to annual leave because I don't consider it to be adequate rest.
John, in that respect, can a member refuse when compelled, or if compelled by management to take leave, annual leave, which they could argue isn't rest and recuperation, can they refuse to be so compelled?
They can refuse, but the difficulty then is what do they do? You know, you're in the catch-22 where your employer is saying, we don't want you here, leave for 2 weeks, for example. The employee would be well within his rights to say, look, I don't accept that your instruction is amounting to me. I don't accept your instruction, but I'm going to, not getting into a dispute about that. I'm going to go on what you're calling annual leave, but be on notice that what I intend to do is take a cause of action to say that this is not rest. Therefore, you may be compelling me to take annual leave, but in 6 months' time, effectively, I think I'm going to be successful in a case that determines what I was on was not annual leave. So you've paid me to be at home unlawfully, which I'm going to pursue in the cause of action to the tribunal, and I'm going to get my annual leave in the medium to long term. So essentially, in those circumstances, the employer may resile from that position in that it may take a view, this is more trouble than it's worth. Because there is ambiguity, Marty, and be very clear about that. The whole issue is, and maybe one of the individuals that's given, like, it's a pet topic of mine. I really don't think that in a hard lockdown situation, that would be amounting to annual leave. So, for example, if your annual leave was to be compelled from the 27th of November through to the 2-week lockdown we're currently on, I don't accept that if your employer was compelling you to take annual leave during that period of time, that is adequate rest. But say, for example, in spring of 2021, when effectively things are coming, hopefully, back to normal, your employer could be within its rights legally to say, we're compelling you to take annual leave, Marty. You've got 2 weeks to take off. Here's your 4 weeks notice. Take it. I think in those circumstances, it's more likely that would be determined to be annual leave that you're simply compelled to take. So it depends upon the circumstances upon which the employer is compelling you to take annual leave.
Gentlemen, my deepest sincere gratitude for you now have been on for 2 hours and 40 minutes when your slot was booked for 1 hour. I think you will agree with me that the very excellent questions that were produced has been somewhat challenging to you, and it's been very interactive, and I deeply appreciate you coming on and doing that. Can I pay tribute to Francis? Francis, we will answer your question in terms of the mental health first aid. Damien, your insightful questions were great, and Marty, your last bit there obviously had John in a state of flux there, so thank you for that. I'm conscious now, folks, that it's now 20 to 4, so I'm going to hand over to our Vice President, Frances, and she's going to finish off the rest of the afternoon. Thank you.
Thanks, Brian. Our next session was to be what next for NIPSA. But obviously, as we've seen, the legal session has gone on for quite a bit longer than we anticipated that it would. So in light of that fact, what we've actually decided to do, and given the time, is to move on and to the closing session, but in the interim to let people know that if there's anything that you wanted us to take back from today that we already haven't captured, if there's any other comments that you wanted to make, if you email them into NIPSA headquarters, and that's to info@nipsa.org.uk, send it in and we'll take note of any of those comments. Listen, thank you all for the interaction, certainly with the legal aspect there, really was appreciated. The other thing I just wanted to bring to your attention is that within the next few days, the entire seminar is going to be available on YouTube. So if you give us a few days to get the links and everything set up, that will be on to the NIPSA website and you'll be able to access it there. We're going now to the closing session of the seminar. Before I move on to formally close the session, what I'd first like to do is to send solidarity to the fellow members who were on strike today and their day of action in Newry Morning Down. Fantastic turnout. I was on picket lines this morning as the President and the General Secretary were as well in Newry. I was in Downpatrick myself, and great camaraderie. And people were very determined that they were going to see this through to a successful outcome. And talking about the strikes and the action today, we really must sort of commend the actions of our Treasurer, Peter Boyle, and our headquarters official, Kevin Kelly. These things don't come together by accident. There's a lot of hard work. So well done, guys, and a very successful day of action today. 2020, it's been a year like no other. Who could possibly have foreseen this catalyst of a crisis on such a global scale? Quite literally, no one has escaped the clutches of this pandemic. We have experienced unimaginable pain, suffering across our union, and even further deep into our community. We have suffered bereavements in our family circles and among our friends. We have not been able to mourn or pay respects as we normally would. We have been separated from our loved ones. We have felt the fear of being subjected to this terrible disease and the potential impact of it on ourselves and our loved ones. We have struggled to make sense of it all, to find a path through. Our children have suffered. Members' jobs have been threatened. Furlough schemes implemented, hope challenged. Our most vulnerable in society have been the most susceptible to this terrible disease. As a union, we came together as a family to protect each other and to help each other. As a strong union, that is what we're about. This seminar today was brought forward by your General Counsel. Each and all of us agreed that we wanted a seminar to give support to our members, to our reps and our staff, and to provide useful resources and information. We hope you have learned today that in NIPSA, we really are all in this together and all about helping our members. We often have disagreements on issues right across the spectrum, but COVID-19, that is an area where we all agree that together we are one. We have watched how our members have been called to keep services going. Key workers who turned out to be those frontline staff who faced fear and challenges day in and day out. The key workers are across all areas of this union, in health, in education, civil service, local government, housing, voluntary sectors, emergency services, and so many, too numerous to mention individually. When this government needed the services to keep going, they called on the workers, our members, including each and all of you, to put themselves at risk for the sake of others. More often than not, it turned out to be the lower paid members who proved themselves to be the very essence of keeping services going. In health, our healthcare members face challenges not just dealing directly with COVID-19 risks, but also indirect risks, insufficient PPE protections. In education, a sector I've worked for over 35 years, our members continue to open schools for the children of key workers. Classroom assistants being called in during the height of this pandemic, building supervisors, catering, cleaning members, to name but a few, who all stepped up to the challenge. Non-school-based members continue to ensure grants and essential services continued, many people working long hours at home, and to ensure the impact of this pandemic was limited and schools, youth sectors, etc. could continue to function. Others ensured PPE was available and issued. People stepped up. Our members in civil service, for example, keeping our benefits payments going. Our voluntary sector, as Naomi referred to earlier on today, continue to care for our most vulnerable in an already challenging environment. There are many, many examples of how we have stepped up to take on the challenges, and each and all of you did. There's a wee saying that I like, and I think it's quite apt. When times are difficult, look for the helpers. You will always find helpers. Today, at the end of this seminar, I want to take a few minutes to acknowledge and appreciate you, the helpers. In NIPSA, we are gifted to have reps and officials who are dedicated and active in supporting members. Today, on behalf of the General Counsel, we extend our most sincere gratitude to each and all of you. To have faced this pandemic with the same fears and concerns as all our members and still go above and beyond, and to be there for our members is a credit to you as individuals and to NIPSA. We are proud to call you our NIPSA family. In this year, reps and officials have suffered the same losses, faced the same challenges, and still they continue to put members first. As Branch Secretary in Education, I know only too well how often the guidelines have changed. How many times did we put on the news to find out what exactly was going on so that we could interpret that for our members? We became a bit expert at researching information and guidance on health and safety, PPE, shielding, social distancing, bubbles. A lot of these terms we've never come across before this year. We stepped up and we protected our members against redundancy, against any form of detriment. We fought and protected our members' pay, terms and conditions. Folks, as NIPSA reps, we did an amazing job. We worked together for the good of members, for the betterment of NIPSA, and that's what any good trade union does and has as its cornerstone. We really are all in this together. Thank you, each and all. You are both wonderful and valued. We heard today from our speakers on some of the main issues of concern for our members. On behalf of the General Council, we extend our sincere gratitude to each of you for your useful and informative insight. We have learned of resources and we can access and have been better equipped to deal with how to build our resilience against this pandemic as workers and trade unionists. While we were unable to hear from our speaker on the mental health impacts today, we will reiterate the importance of looking after our mental health. It is the silent concern that affects far too many. Please, in these difficult times, look after each other, and most especially, give yourself the care you need. Be kind to yourself. To all who helped bring this seminar into practice today, thank you. It's been a challenge in a very different electronic environment, and we value each and all of you for your assistance, as always. I'd like to especially thank our staff in NIPSA headquarters. Thank you. This year, we've put new challenges your way, and as always, the staff have stepped up and reacted as professionally as ever, going above and beyond. Thank you all. In closing this seminar, I'd like to thank my fellow officers and General Council members for taking this bold step into the remote world of seminars. We are glad to have been able to bring this together. We hope it has provided you with some useful resources. I'd personally like to thank and give credit to our President, Brian, for hosting this seminar so professionally, and to thank him for his contribution. Thanks also to our General Secretary, Alison, who has worked with General Council to bring this with you today. We thank each and all of you for your participation, without which, frankly, we would have been sitting here speaking to ourselves. We acknowledge the work that's been done by NIVAC and appreciate all that they have done for us, and thank them for that also. In closing, on behalf of myself, the President, the General Secretary, and all of your General Council, we hope you continue to stay safe and to look after each other. Thank you.